Now we are going to talk about MCQ from the chapter family planning and contraceptive, and along with it about reproductive health also. So from commit, now let's begin into the question. Now here a contraceptive jet is used by 100 couple for a continuous period of 2 years. During this period 20 women become pregnant despite using contraceptive jet. What is the POD index? Now if you know what is the POD index, POD index is POD index is number of number of accidental pregnancy upon total duration, right? Total duration into 1200. So here number of total accidental pregnancy is 20, total duration is how much? Total duration is 2 years, right? That means in 2 years individually, in 2 years how much? 12 into 2, right? 24 months, right? 24 months, and for 100 couple it is how much? Into 100 and into 1200. So here what we have 10, right? 10 per per 100 women year, right? 10 per 100 women year. So that is the right answer, right? Okay, moving further, the contraceptive efficacy is measured by Pearl index and life table analysis. Both of these are important, right? Moving further, the eligible couple per 1,000 population in India is, the eligible couple means the couple who are in reproductive age group, that means who are at around the age of 15 to 45, right? So these are how much? These are our 150 to 180, right? 150 to 180. Now moving to next question. Okay, the scope of modern concept family planning service include all of the following except it does not include what? It includes screening for cervical cancer, provides service for unmarried mother, screening for HIV, right? It provides screening for what? It provides screening for HIV. No, it does not provide the screening for HIV, right? It provides adaptation service also. So the modern concept of family planning include all of the following except it will not include what? It will include sex education, adoption service for cervical cancer, in vitro fertilization it does not provide, right? Okay, so the following is important in calculation of Pearl index. We have already said total number of accidental pregnancies. Pearl index is expressed right? It is expressed per 100 women year, right? Per 100 women year, right? Per 100 women year. The Pearl index is failure per 100 women of the exposure. Pearl index is defined as accidental pregnancy per 100 women of exposure, right? Okay, per 100 women of exposure. Now moving into next question. The POD index for accidental pregnancy failure, per how much? 100 women in a year, right? The POD index is normally used for studying. The same thing is here. It will study what? It will study our effectiveness of contraceptive, right? Effectiveness of contraceptive. Population control can be achieved by spacing between two populations, right? By spacing between the pregnancies. POD index is used to evaluate, I've already said, contraceptive failures, right? Contraceptive failures. The couple protection rate CPR to bring within normal range in India. Which of the following contraceptive measure is used? Sterilization, condom, IUCD, all of these are used, right? Now talking about natural methods. The natural family planning does not include terminal method. No, it does not include the natural method. Basal body temperature method, yes, right? Okay, and then cervical mucus method, yes, it also includes, right? And then symptothermic method, it includes, right? Combines temperature, cervical mucus and calendar techniques, all these three in the symptothermic method. Now which of the following natural method of contraception is most effective? Which of the following natural method of contraceptive is most effective, right? It is symptothermic method, right? Okay. Here in symptothermic method, what we do is we combine temperature, right? We combine cervical mucus and calendar technique. The barrier method, match the contraceptive anode type. The vaginal sponge, it is what? It is barrier method. Norplant. I'm talking about Norplant. What is Norplant? The Norplant is our subdermal implant, right? I'm talking about our NetM, right? What is NetM? It is our depot formulation, right? And graphene box ring, that is our IUD, right? Vaginal sponge, it is used by the brand name of Today, right? Today sponge or barrier method of contraception, right? Now I'm talking about Norplant, right? Norplant, what it is? It is subdermal implant depot formulation, right? Okay, it is subdermal implant, right? Depot formulation. Now talking about NETIM, right? It is what it is, our norethanoestradiol, right? Norethanoestrone. And talking about Grafenberg ring, what is it? It is first generation non-medicated IUD intrauterine device, right? Okay. Now, so the right answer right here is, okay, the right answer is A, right? The right answer is, sorry, the right answer is B, right? Okay. The barrier method are all except diaphragm, it is foam tablet, it is vaginal sponge, it is. What is not the barrier method? Our lip slope is not the barrier method. Today failure rate is, what is today's? I already said vaginal sponge, it is called today, right? The failure rate is 9 to 20 per 100 women in a year, right? Now spermicide used in contraceptive today is, what is the spermicide used here in today? That is non-oxanol, right? Non-oxanol, that is the spermicide used in today, that is vaginal sponge. Today our contraceptive contains, what it contains? I've already said what it contains. Nonaxenol, right? Nonaxenol, 9-nonaxenol. IODs. In copper T 388, the 380 represent surface area of copper in square mm. The most common side effect of IOD insertion is, what is the most common side effect? We already know what is it. It is bleeding, right? Bleeding is the most common side effect. All are true about progesterone acid. All are true except. Okay. Now here. Progesterone release 65 microgram of progesterone per day. That's right. Progesterone contain 38 mg progesterone, right? Progesterate contain 38 mg progesterone. That is also right, right? Microgram. Progesterate is implanted subdermally, so it is not right, right? Progesterate is not implanted subdermally. Progestate is T-shaped device, yes, it is T-shaped device, so the right answer is C, right? This progestate was the first hormonal intrauterine device, right? It is T-shaped device filled with 38 microgram of progesterone, right? In which the rate of release is 65 mcg per day. Okay. Now moving further, the first common side effect of iodine insertion, which requires its removal. What is the most common side effect which requires its removal? Now that is our pain, right? Not bleeding. The pain is the side effect of iodine insertion which requires its removal, right? Okay, moving further, what we have, the next question, characteristics of ideal candidate for copper T insertion include all of the following except. Has born at least one child, that's right. Willing to check IUD, that's right. Has history of ectopic pregnancy, no, right? Now talking about the ideal candidate for our contraceptive, what we can remember is, we can remember right, we can remember that the woman should have beared at least one child, right? Should not be should not have any of the pelvic diseases, right? Menstrual cycle should be what? Menstrual cycle should be regular. It should not be what? There should not be any disturbance in menstrual cycle, right? And there should be able to follow up regularly, should be able to check the tail, right? Tail of intrauterine device or IUDs, right? Okay, these are the criteria. Okay, so the 49 question 49C is the right answer. The following statements are true about intrauterine device except. Multi-loaded copper 375 is third generation IUD. Okay, now here this statement, multi-loaded copper 375 is a third generation IUD, so it is not right, third generation. Okay, the pregnancy rate of Lippel's loop and copper T200 are similar, yes it is right. IUD can be used for emergencies, it is right. Now within 5 days, right? Levonorgestrel releasing IUD has efficacy a life of 10 years, that's right. So here A is the right answer. The most common side effect leading to IUD removal, I've already said, it is the pain, right? The copper T is preferentially inserted postnatally after how many? After 8 weeks, right? Copper T postnatally, it will be removed after 8 weeks, right? Copper T200, the number denotes what it denotes. We have already said what it denotes. It denotes surface area. which of the following IUD do not require to be changed every 3 to 5 years? Now 3 to 5 year, right, the copper T that should not be removed is copper T380, right? The most common side effect of IUD insertion, we have already said what is the most common, that is bleeding, but the side effect that will suggest us to remove it, that is pain, right? Copper T380 IUD should be replaced once in a 380, okay, it should be replaced once in a 10 year, right? Copper T380 IUD should be removed once in a 10 year. Non-medicated intrauterine devices are also called non-medicated. They are the first generation one, right? First generation IUD. Okay. 158. IUD Marina release levonorgestrel for how many year? Marina release levonorgestrel for how many? 5 year, right? 5 year. Now the most common side effect of IUD insertion, we already know, that is bleeding, right? Copper T380 IUD should be replaced once in a, we already know, that is 10 year, right? Nova T has, what is Nova T contain? It contains silver core, right? Nova T has silver core. Radio opaque material in copper T, what is the radio opaque material in copper T? That is barium sulfate, right? Barium sulfate. The true statement about Nova T is it consists of silver core. All of the following are advantage of third generation IUDs except, okay, high efficacy, that's right. Low expulsion rate, that's right. Long acting, that's right. Low risk of ectopic pregnancy, no, that is not right. This is what? There is no risk of ectopic pregnancy, so low risk of ectopic pregnancy is the right answer. Third generation IUD act by, what it will do? What it will do is, okay, hormonal effect on mucosa of endometrium. What it will do? It will provide hormonal effect on mucosa of endometrium. Absolute contraindication of IUD. What is the absolute? Pelvic inflammatory diseases, right? Multi-loaded device refer to, the multi-load device refer to, what does it refer to? Second generation IUDs where copper will be released, right? Copper ion will be released. So the multi-loaded device refer to, what does this refer to? This refer to our what? Our second generation IUDs, right? Second generation IUDs. Now moving to our next question. The most effective copper T is, what is the most effective? That is Ml copper 250, right? Ml copper 250. Talking about the hormonal method, all are true about Centroman except Centroman is non-steroidal contraceptive. Centroman has been developed in India. Centroman is used for female with PCOD. No, it is not used in women with PCOD, right? In PCOD we use what? Oral contraceptive pills only. Consider the following statement, okay. Use of oral contraceptive pills confers additional protection against fibroadenoma. Okay, fibroadenoma, yes, it provide what? Protection against fibroadenoma, that's right. Ectopic pregnancy, that's right, it reduces ectopic pregnancy. Ovarian cyst and iron deficiency anemia, that's right. It will provide against, it will help in preventing benign ovarian diseases and iron deficiency anemia also. So all three options are right. The woman was taking oral contraceptive pill, then which of the following investigation would be related to long-term consumption of steroidal contraceptives? Okay, if the woman was taking oral contraceptive pills, then which of the following investigation would be related to long-term complication consumption of steroidal contraceptives? Okay, now what we can do in such case? Okay, in such case, right, what we can do here is liver function test. Yes, steroid oral contraceptive pills, liver function test should be done, right? Cervical pap smear, yes, it should be done, right? Weight smear of vaginal secretion for moniliia, it should be done, right? Endometrial biopsy, it is not so important. So option 1, 2, 3 are the right option. Okay, for the woman taking oral contraceptive pill, then of which the following investigation would be related to long-term complication of steroidal contraceptives? Beside pregnancy, the oral contraceptive protects against all except fibroadenoma breast. Yes, it provides what? Fibroadenoma breast. Iron deficiency anemia, right? Ovarian cancer, yes, it prevents ovarian cancer, but it increases what? Cervical cancer. And hepatocellular adenoma, no, there is no role in such hepatocellular adenoma. How much ethyl estradiol does a new load dose oral contraceptive pills contain? Now it contains about 20, right? It contains 20 ethyl estradiol, 20 mcg, right? Which of the following is not a absolute 183 contradiction for oral contraceptive pills, right? Okay, now here now contraindication of use of oral contraceptive pills are all except nursing mother, right? Cancer of breast, yes. Cardiac abnormalities, yes. History of thromboembolism, yes, right? These are what contraindications. Now moving further, what we have is MIL and Mala and oral contraceptive pills differ from Mala D in term of what? Supplied free of cost, right? They is supplied free of cost. Mala and oral contraceptive pills differ from Mala D in term of supplied free of cost. Okay. Now contraindication of OCP, oral contraceptive pills. What is the contraindication? Liver disease, PID, renal disease, epilepsy, and along with ABCD. So what? Liver disease, in liver disease is contraindicated. PID, in PID it is not contraindicated, right? In renal disease it is contraindicated. In epilepsy it is contraindicated. So ACD, all along ACD are the right answer. Contraceptive to be avoided in epilepsy. What is avoided? Combined OCP is avoided during epilepsy, right? In epilepsy. Non-contraceptive benefit of combined oral pills is or are what? Reduction of iron deficiency anemia, that's right. Breast cancer, that's right. Ovarian cancer, sorry, breast cancer is not right, ovarian cancer is right? Ovarian cyst or cancer, iron deficiency anemia, right? And then PID, yes. Ovarian cyst, okay. Ovarian cyst also. So ovarian cyst, PID, ovarian cancer and iron deficiency anemia are the other benefit, right? Other benefit, how we can remember? From other we have got what? Ovarian cyst, right? Ovarian cyst. Other benefit from B we have got benign what? Neoplasm of ovary, right? BE from E we have got endometriosis, right? Endometriosis. BEN we got what? We got BEN, okay, we got what? BENE, right? EF fibroid, right? We got fibroid. DEN EFI we got what? Inflammatory diseases, pelvic inflammatory diseases, right? From T we have got what? Tension, premenstrual tension. T, yes. Okay, these are what? These are the other benefit, right? Other benefit. Okay, now from E we have what? Ectopic pregnancy. It decreases ectopic pregnancy also. Mini pill, right? Mini pill is contraceptive of choice for mini pill, if contraceptive of choice for lactating female. In lactating female we don't give mini pill. Which of the following is or are the benefit of combined OCP use? Hepatocellular adenoma, it is not. PID, it is. Ovarian cyst, fibrocystic disease of breast, and ectopic pregnancy, yes, right? Which of the following is or are benefit of OCP use, right? These are what? PID, yes, PID is ovarian cyst, fibrocystic disease of breast, and ectopic pregnancies, right? Oral contraceptive cause all side effect except Moniliae vaginalis, side effect, right? It is talking about side effect. No. Pituitary adenoma, no. Carcinoma uterus, no. Cervical carcinoma, right? It is what? In severe condition, severe, it causes cervical carcinoma. So none is the answer. Or depot containing DMPA is given every, it is given 3, right? 3 mahine sui, right? DMPA is given every 3 months. The non-contraceptive effect of oral contraceptive pill is all except. The non-contraceptive effect of oral contraceptive pill is all except protection against benign breast disease, that's right. Okay, all except, yes, that is right. Prevention of ectopic pregnancy, that is also right. Dysmenorrhea protection, that's also right. Iron deficiency, right? So yeah, every options are correct, so none is the answer. Now serious complication of oral contraceptive is leg vein thrombosis, right? Leg vein thrombosis. The health worker who distributes OCP pills check all of the following except. Headache is checked, weight gain, breast tenderness, per vaginal bleeding. Okay, now here per vaginal bleeding is not checked, all things are checked. All are contraceptive advantage of oral contraceptive pills except. All are contraceptive advantage of oral contraceptive pills except. Pelvic inflammatory disease, are these the advantages? Yes. Hepatic adenoma, no. Benign breast cancer, yes. Anemia, yes, right? Okay, moving further. The side effect like irregular bleeding, depression are associated with use of. These are the side effects like irregular bleeding, depression are associated with what? These are associated with mini pill, right? Mini pill. The dose of ethyl estradiol in Malayan is 30 microgram. The absolute contraindication for prescribing normal contraceptive pills in women of reproductive age group is absolute contraindication. What is the absolute contraindication? The absolute contraindication is congenital hyperlipidemia. Okay. Congenital hyperlipidemia is the absolute contraindication for prescribing normal contraceptive pills in women of reproductive age group. Malayan contains norgastrel. How much norgastrel? 0.15. Right. Similarly, how much? 30 microgram of what? Estradiol was containing there. Right. It's ethyl estradiol. Mini pill content. What does mini pill contain? It contains only progesterone in a small quantity. It is progesterone only pills. Right. It is progesterone only pill. Okay. And just we solved one question about mini pill, that is absolute contra. Okay. Another question that we just did here is, okay, the side effect like irregular bleeding and depression are associated with the use of mini pill, right? Okay. Now, moving further, mini pill contains, already said, DMP is injectable contraceptive given every how much? 3 months, right? We know about it. 3 months. Mini pill contains, I've already said, only progesterone in a small quantity, right? Okay, moving further, all of the following can be used as emergency contraceptive measure except female condom can be used at emergency. No, it cannot be used. IUD can be used. Mini pill can be used. Giuseppe and Lance can be used. Giuseppe and Lance method are used for, what are these used for? We've already said they are used for what? Just in above question, emergency contraception with OCPs, right? In your emergency contraception with OCP, these are used. Which of the following is used as emergency contraception? Okay, what can be used as emergency contraception? We know that is LNG intrauterine devices. LNG intrauterine devices, are not used as emergency contraceptive. Other all oral LNG, copper T, and oral mifepristone can be used, right? So which of the following is not used as emergency contraceptive? That is LNG intrauterine devices are not used as contraceptive. Other all are used as emergency contraceptive. Okay, post-coital contraception are all except. Now here talking about post-coital contraception, norgestrel, no, it is not post-coital contraception. OCPs, yeah, these are RU486, these are copper TR. Now talking about sterilization, following vasectomy for family planning, a patient should be advised to use some other method of contraception till how much? 8 weeks, right? Till how much? Till 8 weeks, right? Till 8 weeks, but the correct answer is till how much? Till 3 months, right? 3 months. The case of vasectomy is said to have failed as vasectomized persons who have given birth to a child 10 months after the operation. Which one of the following is most probable cause? Failure of husband to use condom after vasectomy, right? Surgical failure, right? Which of the following is the probable cause? The surgical failure is the probable cause. The most common method of sterilization practiced in India, what is it? It is female sterilization, right? Female sterilization is the most common. Going to our next question, the failure rate of Pomeroy technique of sterilization is, that is 0.1 to 0.5%. 0.1 to 0.5% failure rate of Pomeroy technique of sterilization. Miscellaneous family planning and contraception. Which of the following statements is incorrect? Right? Okay. IUDs predisposed to PID and actinomycosis. Yes, it is right. OCP protect against candidiasis. So it is not right, right? Condom are protective against PID, right? Female condom protect against STD and HIV. That's also right. The increased incidence of ectopic is associated with all except increased incidence of ectopic, right? It is associated with what? IUD. Is it associated with IUD? No. Combined oral pill. Increased incidence of ectopic is associated with all of the following except Yes, increase instead of ectopic is associated with IUD. Combined oral pill, no, it decreases the incidence of ectopic pregnancy, right? Menstrual regulation, yes. Safe period, yes. So it is not with combined oral pills. The cost effective family planning method is, what is it, right? It is our what, vasectomy, right? The most cost effective family planning method is vasectomy. Conventional contraceptive are those which, okay, conventional are those which requires action at the time of intercourse, right? Conventional contraceptive are what, method that require action at the time of coitus, like condom, spermicide, jellies, right? Conventional does not means older, right? So here it requires action, what, at the time of intercourse, right? At the time, not after, at the time. All are social demographic goal of national population policy, except, right, here, right, every is the, right, okay. So here achieving 100% institutional deliveries is not what, goal, right? Reducing MMR is achieving 100% registration of birth, death. It is prevent and control communicable disease. That is, the national population policy of India has set all of the following goal, except, okay, it has kept every goal but not to bring total fertility rate to what, to replacement level by 2050. Conventional contraceptive includes the one of the following. What is the conventional? Now out of these, what are the conventional contraceptive method? These are what, okay, we know conventional are what, that should be what, that should come into action at the time of intercourse, so that is condom, right? Okay. Now moving to next question. The Medical Treatment of Pregnancy Act does not protect act of termination of pregnancy after how many weeks? You know, after 20 weeks, right? After 20 weeks. The best contraceptive for newly married healthy couple is, what is it? It is obviously what, our oral contraceptive pills, right? The regular reporting of health statistics is done for, it is done for what, regular reporting is done for evaluate trend of disease, yes. To appreciate health personal effort, yes. For epidemiological research, yes. All of the following is the right answer. Which one of the following rate has media population as denominator? Which of the fertility rate have media population as denominator, right? Here, right? And crude birth rate, media population is denominator, yes. General fertility rate, yes, it is, right? General marital fertility rate, it is there. In age specific fertility rate, it is there also, right? And what, in age specific marital fertility rate, there is also. So all of the above are the answer. Ideal contraceptive for lactating women is, what is the ideal? That is, right, IUCD, right? Okay, IUCD. The ideal contraceptive for couple who are living separately in two cities and meet only occasionally, right? Who are living separately in two cities and meet only occasionally. What is the ideal contraceptive? Okay, the ideal contraceptive is what, the barrier method, right? Barrier method. Ideal contraceptive for newly married couple is, okay, that is again OCP, right? Under Medical Termination of Pregnancy Act, MTP 1971 of India, provision for MTP has been given by, right? It is given by what, wife only. There is no role of husband. Tubal block constitute what proportion of female infertility? Okay, here it is what, 30 to 35%. 30 to 35%. So next question is, family planning service were voluntary in India from, they were from 1977. The contraceptive method of choice, temporary for 37-year-old well-educated woman, for 37-year-old well-educated woman is, what is the contraceptive method for 37-year-old? That is our diaphragm, right? Diaphragm is the contraceptive method of choice, temporary one. Spermicide used in contraceptive today. What are the spermicide? These are nonooxynol, right? We have already said nonooxynol. True regarding MTP Act is, okay. True regarding MTP Act is, MTP Act was passed in 1971. No, MTP Act has brought down the incidence of illegal abortion. No, in emergency, pregnancy can be terminated by single doctor even after 20 weeks without the consulting second doctor. That's also not right. MTP can be done after 20 weeks of gestation if two doctors agree together, no. So these all are incorrect statement. The most effective contraceptive is, we've already talked about it, vasectomy is the most effective contraceptive, right? Now with it, now let's move toward the other questions, right? Which of the following is not included in five cleans in conduct of delivery? Clean hand, it is right. Clean perineum, no, it is not right. Clean cutting and care of cord, that's right. Clean surface of delivery, that's right. So clean perineum is not the one of the five C's, right? The 5 clean practice under strategy for elimination of neonatal tetanus include all of the following except clean surface, clean hand, new blade for cutting, clean airway is not right. So it is the answer, right? Okay, now talking about another question, that is a 37-year-week pregnant woman attends an antenatal clinic at primary health care center. She has not had any antenatal care till now. The best approach regarding tetanus immunization in the case would be give a dose of tetanus toxoid and explain her that it will not protect the newborn, and see that it will not protect the new one, and she should take second dose after 4 weeks even if she delivers in a meantime. So okay, tetanus we give it in 60 to 20 week of gestation, and then the next one after 1 month, that is 24 at around 24, right? 24 to 26 week of gestation, tetanus. Now all are true regarding congenital syphilis except, now congenital syphilis, what is the congenital syphilis mainly occur, infection of fetus occurs at around what, third trimester, right? Not at around first trimester. So this is what the incorrect statement, right? Procaine and penicillin can prevent it satisfactorily, that's right. Neurological damage with mental retardation can be serious consequences, that's right. If mother has late syphilis, chances of transmission decreases. Okay, now moving further. Okay, preterm babies, the less than what, 37 week, right? Okay, next question, all are criteria for identifying at risk infant except birth weight less than 2.8, no, that is 2.5. Birth order 5, that's right. PM and diarrhea, working mother, that's right. So 2.5, not 2.8. For a given population, minimum number newborn to be examined for calculating percentage of low birth babies is, for low birth babies, what we do is we count around 500 babies, right? 500 babies. The term used for babies born as result of retarded intrauterine fetal growth is, right? Retarded intrauterine what, fetal growth. Now what we call such baby, for such baby what we call is, we call small for dead babies, right? Small for dead babies. What are these babies? These babies are what, retarded intrauterine fetal growth, right? Small for dead babies. Intrauterine fetal growth is retarded, small for dead babies. The most common cause of low birth weight baby is, what is the most common cause? Low birth weight babies, that is prematurity. Commonest cause of neonatal mortality is, what is it? It is low birth weight. Which of the following is least likely cause of neonatal mortality in India? It is congenital malformation is least likely cause of neonatal mortality in India, right? Least likely cause of neonatal mortality in India. Okay, the target of health for all by 2004, okay, it is world question, so it is not so relevant, but also the target of health for all by 2000 for reduction in incidence of low birth weight was how much? Less than 10%. All of the following are common cause of post neonatal infant mortality in Nepal except, right, except tetanus. Tetanus is not the cause of post neonatal infant mortality in Nepal. Okay, similarly the next question is, okay, MCH care is assessed by, it is assessed by maternal mortality rate. Maternal mortality rate is calculated by, right, it is calculated by maternal death upon live birth into what, into 10,000, right, into 1 lakh, right. So here the options are not right. Maternal death upon live birth into 1 lakh population, right. Okay, all of the following health are included in cause of maternal mortality rate except following: abortion during lactation first month, during lactation 8 month, during lactation last trimester due to APH. So here all of the following death are indicated as in case of maternal death except, okay, during lactation in 8 month, it will exceed the period, right. Leading cause of maternal death in Nepal is maternal death. What is the leading cause? That is hemorrhage. Which of the following is denominator of maternal mortality rate? We have already said the number of live birth, right? Total number of live birth. Maternal mortality is maximum in which period? It is maximum in postpartum, right? Because postpartum hemorrhage is the main cause. Maternal mortality include what? Pregnancy also, and 42 days of termination of pregnancy also, right? Okay, now moving further, what we have here is the approximately 50% of maternal death are caused by sepsis and hemorrhage, right? Hemorrhage should be there, and sepsis is also the cause. Among the following best indicator for health in communities, what is the best indicator of health in community? That is infant mortality rate. Infant mortality rate does not include what? Perinatal mortality, right? Postnatal it is included, late neonatal mortality, early neonatal mortality it is included, but perinatal mortality is not included. The most common cause of infant mortality is, already we have said, low birth weight. Numerator in infant mortality rate is, what is the numerator, right? Less than 1 year is the numerator. All are important cause of post neonatal mortality except diarrhea it is, malnutrition it is, ARI tetanus is not the important cause of post neonatal mortality. Infant mortality rate IMR is defined as number of death of infant under age 1 per how much? That is per how much hour? 1000 live birth, right? 1000 live birth. Sensitivity parameter of combined pediatric and obstetrics care, that is IMR, pediatric and obstetric care, right? That is infant mortality rate. As per WHO, low birth weight of the child is defined as birth weight less than 2.5. That's right. Which of the following is leading cause of mortality in under 5 children in developing countries? That is what? That is acute lower respiratory tract infection. The mainly included in child survival index. What is mainly included? Right, it is under 5 mortality. Annual under 5 death globally reported are, what are these? These are 6 million, right? Annual under 5 death globally reported are 6 million. Child survival index is calculated by, it is calculated by what? It is calculated by our under 5 mortality rate, right, times 1000 upon 10, right? Under 5 mortality rate. Denominator in under 5 what? Proportionate mortality rate is, what is it? It is total death in same year. Total death in same year. Which of the following does not suggest under 5 care in the community, right? Under 5 care in the community is not suggested by 1 to 4 year of mortality, right? The following does not suggest under 5 care in the community, that is 1 to 4 year mortality. Going to our next question, which of the following advice should be given for an infant suffering from mild diarrhea? Here what can be given is continuing breastfeeding, right? The following statement about breast milk are true except, following statement about breast milk are true except the maximum output is seen in 12 months. No, it is not seen. It is seen in about 4 to 6 months, right? 4 to 6 months. The correct recommendation for breastfeeding is that, what is the correct recommendation? Exclusive breastfeeding should be continued till 6 months of age, followed by supplementation with additional food. That's the right answer. So the next question is, as compared to cow milk, the human milk has more what? More iron. Not true about breast milk is maximum output is at 12 months. No, that's not right. In normal delivery, breastfeeding should be started within 1 hour of delivery. World Breastfeeding Week is celebrated in August, right? Mean output of breast milk per day is maximum during the following month of lactation. During what? During 5 to 6 months of lactation, right? Okay. Now talking about next question, what we have is, as compared to cow milk, breast milk contains more lactose, carbohydrate. Compared with unprocessed cow milk, human breast milk contains more of what? Compared with unprocessed cow milk, human breast milk contains more of carbohydrate. That is what? That is our what? Lactose. The amount of calcium in human milk in 100 ml is 28 mg, right? Okay. The essential criteria for kwashiorkor is edema should be present, right? Kwashiorkor is fucanas, right? The best parameter for assessing chronic malnutrition is, okay, for chronic malnutrition, that is our height for age. Okay, deficit in weight for height in 3-year-old child indicates acute malnutrition. The best parameter assessment for chronic malnutrition, the same thing, height for age. The best parameter for assessing acute malnutrition is, okay, acute malnutrition we said weight for height, right? Weight for height. Okay, now best indicator for growth measurement is, it is not height, it is weight, right? Similarly, the mid-arm circumference is constant during, it is constant during what? It is constant during 1 to 5 years. The age-dependent anthropometric measure of malnutrition is age-dependent anthropometric measure of malnutrition. What is it? It is our mid-arm circumference. Okay, simply our mid-arm circumference only, right? The age-independent anthropometric measure, that is constant between 1 to 4 years. Which of the following is age-independent indicator? That is MSC, mid-arm circumference, right? Okay, Guthrie test is done in neonate for mass screening of, that is for phenylketonuria, right? Phenylketonuria. Similarly, the next question is, the most common neonatal disorder screened is, what is it? It is neonatal hypothyroidism, the most common neonatal disorder, right? Similarly, the uppermost line of road to health card is equivalent to what? It is equivalent to 50th percentile of boys. 50th percentile of boys. WHO growth chart has got information for all asset. Immunization procedure, yes. Child spacing, yes. History of sibling, yes. History of maternal health is not mentioned there. WHO growth chart, lower reference curve represents third percentile, right? Lower reference curve represents third percentile. All are true about growth chart except, all are true about growth chart except it is tool for educating mother, that's right, right? It the position of dot is more important than direction. No, direction is more important, right? So it is not the correct answer, so here it is the right answer. Now question number what? Question number 62. WHO growth chart is, what is it? It is home based, right? Home based. Road to health card or growth chart was first designed by, that was designed by David Morley, right? Okay, the extra energy allowance needed per day during pregnancy is, that is, okay, what is the extra energy? That is 350 kilocal, right? 350 kilocal. So here the appropriate answer is 300 kilocal, right? And lactation is 550 kilocal. Additional daily requirement during first 6 months for lactating women is, that is 550, right? Okay, the next question is, over and above metabolic requirement of pregnancy in total duration consume about how much? That is 60,000, right? Over and above metabolic requirement of pregnant in total duration consumes, pregnancy in total duration consumes about 60,000. Average weight gain during pregnancy in poor women is, in poor women there will be more, that is 12 kg, that is 9 to 12 kg. The late pregnancy calories requirement is, late pregnancy calories requirement is 2300, right? Okay, moving further, what we have is the daily extra calorie requirement in first trimester of pregnancy is, that is 150 kilocal, right? Okay, the outer line of under 5 clinic which touches all other is, the outer line of under 5 clinic which touches all other is, that is health education to mother is not touched. After birth, care of eye in newborn is done by silver nitrate, right? Okay, moving to our next question. The elemental iron supplementation in iron deficiency anemia is 100 to 150. Folic acid supplementation during lactation period is 500 microgram per deciliter, right? Similarly, for dietary, that is 200. During pregnancy is 500, and during lactation it is what? 300 microgram. Minimum ANC visit, that is nowadays, that is 8, right? Okay. All of the following statement true about childhood mortality rate in India is, right? That is, neonatal mortality is higher among female children as compared to male children, right? This is not right. Okay, the late fetal death and early neonatal death are considered in which of the following? That is, late fetal death and early neonatal death are considered where? It is considered in perinatal mortality rate, right? Perinatal mortality rate. Perinatal mortality rate includes, what does it include? Death from 28 weeks to first week of life, right? The extended definition of perinatal mortality includes the crown heel length of how much? Greater than 35 centimeter at birth. What is denominator of perinatal mortality rate? The denominator is total live birth weighing how much over 1000 gram at birth. That is the denominator of perinatal mortality rate. Perinatal mortality rate includes how much? 28 to first week after birth, right? Okay, in given population, okay, let's leave this numerical portion. Right now, the next one is in Nepal, neonatal mortality rate per 1000 live birth is 21, right? Okay, WHO in which year conceived the idea of safe motherhood initiative at conference in Nairobi, Kenya? That is 1987, right? That is 7, 8 and 9. Protective shield is made up of, it is made up of lead. Osteomalacia in pregnancy is treated by vitamin D and calcium, right? Okay, similarly the postnatal period exists, right? Postnatal period exists for 6 weeks, right? Postnatal period exists for 6 weeks. The international comparison for the international comparison, the WHO expert committee defines stillbirth as a birth of dead and underweight offspring more than of 1000, right, gram. If the birth weight is 3 kg, by the end of 1 year the age should be by the end of 1 year the age should of the age it should become triple, that is 9 times. The most common morbidity in school is that is dental alignment, right? Okay, and talking about family planning, right, we have already talked about the MCQ from family planning. Now we are going to do MCQs from what? Non-communicable disease from ComMed, right? PSM. Now without delay, let's move into the question. Now here the first question is, what is the first question? The first question is, following dietary changes are advised to reduce prevalence of coronary heart disease except, right? Increase complex carbohydrate intake, that's right. Saturated fat intake less than 10%. That is also right. Consumption of saturated fat less than 10% of total energy intake, that is also right. Salt intake less than 20 gram per day. No, that's not right, because the reduction of salt intake is to less than how much? 5 gram, right, per day, right? Reduction of fat intake to 20 to 30%. Reduction of fat intake to 20 to 30% of total energy intake, that's right. So here this is option number C is the right answer. Which one of the following statement about influence of smoking on risks of coronary heart disease is not true, right? Here this filter provides a protection effect for CSD is not true, because it does not provide, right? Which of the following is maximally associated with coronary heart disease, right? That is our LDL is maximally associated with coronary heart disease, right? LDL is associated. Which of the following is not dietary modification recommended in high risk cardiovascular group? That is LDL cholesterol less than 100 mg per deciliter is not recommended, right? Avoid alcohol is recommended. Saturated fat intake 7% of total calories, that is recommended, right? And salt intake less than 5 gram, that is recommended. Inability to perform any work without discomfort is, what is it, right? Inability to perform any any work without discomfort, what is it? It is NYHA4, right? NYHA4, that's right. Now moving to next question, the clinical goal of cholesterol HDL ratio recommended for CSD prevention is, what is it? Now here it is our what? The clinical goal, right? The clinical goal is less than 3.5, right? It is less than 3.5. Now talking about another, all are true for coronary heart disease in India compared to West except, right? Now except, right? It is increasing, it is decreasing, common in young group and non, right? Now it is not decreasing, right? It is increasing. All are true of coronary heart disease in India compared to West except it is what? It is not decreasing, it is increasing, and it is common in what it is increasing and it is common in young, right? False about coronary heart disease is, right, Indian CSD occur one decade later than Western CSD. No, it is occurring one decade earlier than Western CSD, because we are not conscious about our health, exercise, we are all into sedentary lifestyle. That's why Indian CSD occurred 1 decade later than Western CSD is the what? Wrong statement. Overall, heavy cigarette smoking is a risk factor. That's right. Male are affected more than female. That's right. All of the following are true about coronary heart disease in India except smoking predisposition is seen. That's right. Mean age of the patient is 10 to 20 years more than that of Western. More in male, diabetes mellitus predisposition to MI is seen. Okay, now here what we have is, here the incorrect statement is mean age of the patient is 10 to 20 years more than that of Western, right? That is the what? Incorrect statement. Smoking is smoking predisposition is seen. That's right. Seen more in males. That's right. Diabetes mellitus predisposition to MI is seen. best known large sample study program for coronary heart disease? What is the best known large sample study program for coronary heart disease? That is our Framingham study, right? Framingham study. Modifiable risk factor for coronary artery disease are all accept. Okay, modifiable are all accept. That means here it is asking about non-modifiable. Obesity is what? It is what? It is modifiable, right? Smoking is modifiable, hypertension is modifiable, personality is not what? Not modifiable. Now into the hypertension. True about hypertension, the primary prevention includes weight reduction, right? Exercise promotion, that's right, reduction of salt intake, right? Early diagnosis of hypertension, no, it is not the primary prevention, it is included in secondary prevention, right? Okay, now so here, right, true about hypertension, the primary prevention include. Okay, here this is not right, but here other all options are right. That means A, right, B, C and E are the right option. Modifiable risk factor for hypertension, what is the modifiable? A6 ethnicity, no, it is the modifiable, right? Obesity is the modifiable risk factor. Now moving into next question, the tracking of BP implies. Now the tracking of BP implies what, right? Okay, now tracking of BP implies BP of what is it? Now here BP of hypertension, hypotensive remains hypotensive, right? BP of hypotensive, right? Hypotensive remains hypotensive, right? So here, so the tracking of BP, what simply what we can do is we can only detect the population at risk. That means the usually the hypotensive population have usually hypotensive will develop into hypotensive type of our BP. What is dash? What is dash? Okay, dash, if you remember dash, what is it? Okay, talking about, okay, okay, now here tracking, okay, what is dash? It is dietary, what is it? Dietary approach to stop hypertension, right? Hypertension, right? To stop hypertension. Diet to be prescribed in hypertension. Now what are the diet to be prescribed? That is low salt diet, yes, obviously low salt diet. Okay, and then what we have is we have got fibers, right? Fibers, fruit, vegetable. Okay, we have got fruits, vegetable and low salt diet. Now rheumatic fever, all of the following statement about rheumatic fever heart disease epidemiology in India are true except prevalence lies between 10 to 11% per 1,000 children aged 5 to 16. That's right, right? Okay, that's right. Now here the mitral regurgitation is common cardiac lesion scene. Mitral regurgitation is not the common cardiac lesion scene, right? It is the mitral regurgitation is the what it is, what it is in children, right? In adult it is mitral stenosis. So mitral regurgitation is common cardiac lesion is what it is not true, right? Now all are true about rheumatic fever in India except, right? Okay, now here rheumatic fever is reported in 1 to 3% of streptococcal infection. That's right. More commonly seen in 5 to 15% years age group. That's right. Except carditis, other manifestation do not cause permanent damage. Okay, that is what, that is also what, okay, that is also right statement, right? Except carditis, other manifestation do not cause permanent damage. But this in revised Jones criteria, evidence of preceding streptococcal infection is taken for last 21 days. That is not the right statement, right? Okay, all of the following are major criteria of Jones in rheumatic fever except pancreatitis. Okay, it is pancreatitis, it is right, JONES, right? From here it is pancreatitis, right? From J we have what, we have migratory what arthritis, that's also right, right? And chorea, Sydenham's chorea, that is also right. But elevated ESR is minor criteria, not the major criteria. So the answer is D, not included among major criteria in acute rheumatic fever, right? Not included in major criteria. Erythema marginatum, that is right. Sydenham's chorea, that is right. Pancreatitis, that is. But polyarthralgia, it is not, because migratory arthralgia is the major one. Rheumatoid heart disease can be prevented by, right? Okay, rheumatoid heart disease can be prevented by screening of school going children, vaccination against streptococcus, treatment of respiratory tract infection in children, all of this. So all of these is the right answer. Now moving to our next question, right? Now moving toward what, our cancers. Now the most common cancer affecting Indian urban women in Delhi, Mumbai and Chennai is. Now here talking about what, urban women, right? Now urban women the most common cancer is our breast cancer, right? Breast cancer. In developing countries like India, Nepal, when it is asked in such a way, right? In developing countries like Nepal and India, the most prevalent cancer in women in women it is what? It is cervical cancer, cervical cancer. But in developed countries, right, developed countries, the most common cancer is what? That is our breast cancer, right, breast cancer. But here it is asking about urban, right, the most Indian urban women. So here it is talking about what? Developed sites, right, developed site within a country. So here the breast cancer is the right answer. The most common cancer affecting both male and female in the world, that is lung cancer, right, that is lung cancer. Now the most common malignant tumor of adult male in India is oropharyngeal carcinoma, the most common, right, it is asking about most common, that is oropharyngeal carcinoma, gastric carcinoma, colorectal carcinoma, lungs cancer. So here the right answer is our what? Okay, here oropharyngeal we can't say because it is oral cavity cancer is the most common, right, oral, right, oral cancer, not oropharyngeal carcinoma. So none of the answer, right, none of the answer is right, right. The most common type of cancer among female in India is, we already said, developing country. That's why that's why our answer is what? Okay, that is our answer is cervical cancer, right, cervical cancer. Habit and costume are conductive to cancer as evident below, except. Okay, now here, right, now except kangaroo cancer in Kashmir due to hot pot in winter, yes. Oral cancer due to pan chewing in India, yes. Penile cancer and cervical cancer following circumcision, no, circumcision does not cause penile cancer and cervical cancer, right. So this is the wrong statement, so here this is the answer. Lung cancer due to smoking, yes. HPV vaccination, true, right. Okay, what is the true about HPV vaccine? Protects from carcinoma cervix in greater than 70% of the cases. 2 primary dose required for immunization. So here 2 primary dose required for the immunization, and the recommended age is 20 to 40 years. Reproductive age group is the right what? A right answer. Now here HPV vaccine protects against 2 HPV type. One is HPV what? One is HPV 16 and 18, right, and that causes 70% of cervical cancer worldwide, right. Now here these two primary doses required for immunization and recommended for the age group of 20 to 40 years is what? It is the wrong statement, right. Here true about HPV vaccination are true, except here it is asking about except. So it protects about for more than 70% of the cases. It provides against SSB 16 and 80. Mixed vaccine need refrigeration, that's right. Okay, now which of the following can be prevented by screening? We all know that is cancer cervix, right, cancer cervix. Cancer breast also can be prevented. Cancer prostate also can be prevented, right. Cancer colon can also be prevented, right. These can be prevented, but carcinoma of lungs is not what? Prevented. So these are the answer, right. The highest increase in survival rate is seen after screening of, that is obviously what? Our, that is carcinoma colon, right, carcinoma colon, not carcinoma cervix, it is carcinoma colon. Highest increase in survival rate is seen in carcinoma colon, right. Okay, moving to our next question. The next question is current cancer patient in India reported annually. What is the current? That is about 1 million are reported. Globally most common cancer is, what is the globally most common cancer? That is our, the globally most common cancer is lung cancer, right, lung cancer. Surveillance, best surveillance is of what? Colorectal cancer, right. The most common cancer affecting India urban women in Delhi, Mumbai and Chennai, but I've already said what is that? That is our breast cancer, right, that is breast cancer. Tobacco responsible for oral cancer. What is the tobacco responsible? How much is it? Is 90% of tobacco is responsible for oral cancer. Maximum mortality in India among women due to which carcinoma? Okay, we know that is due to what? Breast carcinoma, right. Okay, right, breast carcinoma. Now which of the following is most common malignant tumor in adult male in India, right. That is what? That is our what? That is our oral carcinoma, right, oral carcinoma, right. Okay, early warning sign of cancer that public should be aware include all except, right, all except. That means persistent cough, yes, cough, a lump and hard in area in the breast, that's right. Unexplained weight gain, so it is not the right statement, right. So here all are the warning sign of cancer, like persistent cough, lump and hard mass in breast, right. Similarly change in water mole, these are, but what our this unexplained weight gain is not the right statement. So moving to our next question. The best method for screening the early detection of carcinoma breast in young women is, that is how? It is self examination, right. Field carcinogenesis is seen in field carcinogenesis is seen in head and neck carcinoma. Head and neck carcinoma, right? Risk factor for cancer cervix are increased by following, right? Cervix cancer. Okay, risk factor for cancer cervix are increased by following. Now, how these are increased? Risk factor for cancer cervix are increased by following. Now, less than 20 years of age, right? No, it is not that, right? Late marriage, it is also not, right? It is not upper socioeconomic class. No, early marriage. So now it is increased by, right? The risk factor for cancer cervix is increased by what? Early marriage, right? It is increased by early marriage, which is not predisposing factor, right? Factor for carcinoma cervix. Early marriage is what? It is predisposing factor or not, right? Okay, it is not, right? Early coitus is not, early childbearing is not, single childbirth, right? Not predisposing factor. Now here it is asking about these all are early marriage, early coitus, early childbearing are what? Predisposing factor, but single childbirth is not the predisposing factor. It doesn't depend whether there is single or multiple child, right? Now here's again, let's go toward this question. Risk factor for carcinoma cervix are increased by following. Now less than 20 year, no, late marriage is not, early marriage is what? Early marriage is the risk factor, right? Risk factor. Early marriage means less than 18 years, so less than 20 years is not the right answer. Now talking about moving toward what? Obesity, right? Obesity. The Asian population, the normal BMI is, okay, that is how much? That is from what? From 18.5 to 22.9, right? 22.9. That means rather in globally how much? We have 18.5 to 24.99, right? But in Asian we just there is what? We just subtract from the upper end, right? What will be the BMI of male whose weight is 89 kg and height is 172 centimeter, right? So here we need to calculate it, right? We need to calculate it simply by what? Simply by weight upon height in meter square, right? Height in meter square. So simply your weight is 89 kg and height in meter is 1.72, and we need to what? Have a square of it. Now here there will be 30 will be the answer, right? 30 will be the answer. All of the following sites are used for measuring skin fold thickness to assess obesity: accept mid tricep, bicep, subscapular, anterior abdominal wall. Anterior abdominal wall is not used. Which of the following indices of obesity is height independent? So now talking about what? Height independent, that is corpulence index. Corpulence index is what? It is what? This is corpulence index, right? Now this is it is only dependent upon weight, right? Weight. Now here quadrillate index, it is also called BMI, right? This is ponderal index. Ponderal index is height upon cube root of what? Cube root of weight. And talking about Broca's index, that is what? Height minus 100, right? Height minus 100. So these all are dependent upon height, except corpulence index, that is only dependent upon weight. The patient is called obese if BMI is obese, right? Now greater than 25, it is what? Overweight, right? But obese, that is greater than what? 30. International accepted method for measuring obesity is, that is BMI. Which of the following should be done to reduce obesity? Regular exercise with same amount of food. Yes, we should not decrease what? Decrease the amount of food. Regular exercise with same amount of food is needed, right? Okay, moving to our next question. The next question is, the adult is considered to be overweight if she has the BMI. I have already said overweight is greater than how much? 25, right? Overweight is greater than 25. Obesity indices are, what are the obesity indices? That is, okay, now obesity indices are Broca's also, right? Ponderal also, quadrillate index also, and corpulence index also. All these are, right? Overweight BMI is, I've already said how much? More than, right? 30, right? The overweight, it's talking about overweight, not obese, right? Overweight is greater than 25 and obese is 30 to 34. Calculate the BMI of weight of kilogram 98, height in centimeter is 175. So here what we have, the same formula, right? We'll calculate, it will come how much? 32. What will be the BMI of male whose weight is 89 kg and height is 172? Okay, we did it, right? That is 30, right? Which index of obesity does not include height? We have already said corpulence index. The normal BMI range in Asian individual is, we already know, that is how much? 18 to 22.5. The height in centimeter by cube root of body weight is known as, that is ponderal index. Which index of obesity does not include height? We have already said corpulence index. Corpulence index means measurement of what? Okay, corpulence index means measurement of obesity, right? That is only dependent upon weight. So moving to our next question, which of the following what is the cutoff level of waist hip ratio in women indicating abdominal fat accumulation? What is the our cutoff? Okay, we'll go into this later on. Right now let's go toward this question. What will be the BMI of male whose weight is 89 and 172, that is 31, right? Corpulence index means measurement of obesity. Same question. Assessment of obesity by following measurement accept, right? It is correlates, yes. Broca's, yes. Corpulence civilian index is not used. Body mass index is also known as that is quatillate index. Abdominal fat accumulation is assessed by, okay, abdominal fat accumulation is assessed by, now how it is assessed? Now it is assessed by waist to hip ratio, right? Waist to hip ratio, abdominal fat accumulation. BMI, body mass index, is defined as, how it is defined? Height upon weight upon height square, right, in meter. So that is the A is the right answer. Now talking about blindness, the definition of blindness as a visual acuity less than 3/60 in better eyes. The number of blind person per 1 lakh population in India is estimated to be, in India it is how much? It is, okay, it is about 700, right? Okay, now the most common cause of blindness in India. In Nepal it is what? Cataract, right? In Nepal it is cataract. Under NPCB, right, under NPCB the cutoff blindness is defined as having vision of what? Less than 3/60 in what? In better eyes, right? Less than 3/60 in better eyes, or inability to count finger at the distance of 3 meter, right? Okay, disease not included in Vision 2020 India. Okay, which disease is not included? That is cataract is not included, right? Okay, the commonest cause of low vision in India is, okay, what is the commonest cause, right? That is what? That is the commonest cause of low vision in India is cataract, right? According to National Program for Control of Blindness, the highest prevalence of blindness in India is, where is the highest prevalence of what? Okay, we don't know about it, right? It was the old data. The blindness can be seen in, right? It can be seen in where? It can be seen in measles, right? It can be seen in measles. So we are providing measles, right? Vaccination for measles also, right? Okay, now moving to our next question. The blindness surveyed in school as compared to population survey, the estimation of prevalence of blindness will have what? In school only, if we do the estimation of prevalence in blindness, will have what? It will have underestimation, right? It will be underestimated. The disability certificate is given for poor vision of visual acuity 4/60 in tune of visual impairment as percentage, right? Okay, now here, okay, we'll get into this question later on. The disability certificate is given for poor vision of visual acuity 4/60 in tune of visual impairment as percentage. Okay, we'll get into later on. So moving to our next question, the blindness rate in India, right? Okay, now it is also what? We'll go into the new data, so it is not so much important, right? Now let's go into what? These questions. What are these questions, right? Okay, which of the WHO defines blindness as a visual acuity less than how much? 3/60, right? Okay, less than how much? Less than 3/60. The prevalence of blindness in what? The prevalence of blindness in India. What is the prevalence of blindness? Okay, I would like to correct one thing right here, that right, blindness can be seen in, right? The blindness can be seen in it can be seen in what? Measles also and rubella also. I forgot to mention about that thing, right? And here, according to National Program for Control of this much, the highest prevalence of blindness in India was where? In Jammu and Kashmir, right? In Jammu and Kashmir, right? Similarly, the commonest cause of low vision, okay, we already talked about it. Cataract was the right answer, right? Okay, now moving further. Now, okay, WHO defines blindness as visual acuity less than how much? Less than 3/60, right? Prevalence of blindness in India 0.7, right? 0.7%, right? 0.7%. The most common cause of ocular morbidity in India is, what is the most common cause of ocular morbidity? That is cataract, also in our Nepal. The most common cause of blindness due to easily preventable cause in children is, that is vitamin A deficiency, right? Okay, Now Stanford 3 community study, the North Karelia project, and lipid research clinic study are type of, what are these? These are what? These are risk factor intervention trials, right? Risk factor intervention trial, right? Okay, moving to our next question. The most common cause of stroke in India, not in India, it is also in Nepal, that is cerebral thrombosis, right? Okay, now moving to our next question. Which one of the following is not characteristics of non-communicable disease? Not a characteristics of non-communicable disease. Well-defined etiological agent. Well-defined, no, it is not. There is not well-defined such agent. Multifactorial causation, yes. Long latent period, yes. Variable onset, yes. So here well-defined etiological agent, it is the right answer, right? Okay, rule of half is seen as hypertension, right? A preferred public health approach to control non-communicable diseases. Preferred public health approach to control non-communicable diseases, right? It is what? It is our, what is the preferred? The preferred one is our shifting of population curve of risk factor by population based approach, right? Shift the population curve of risk factor by population based approach, right? WHO steps is used for steps, right? In the case of what? Non-communicable disease, steps is used in the case of what is okay, step wise approach to surveillance, right? That is our step is a simple standard method by WHO for surveillance of two type, right? Non-communicable disease. Rural and urban population differ in incidence in all the disease except, right? Rural and urban, difference? There is difference in rural and urban population indices in all of the following disease except, right? Where there is equal, that is TB. TB is equal in both what? Rural and urban one, right? Okay, diabetes mellitus is best diagnosed by fasting blood sugar, right, greater than 100 mg per dl, postprandial 140. Okay, no, it is not, right? Okay, that is our fasting blood sugar greater than 125, and what? Postprandial blood sugar, that is greater than 199. That is the right answer. And has HbA1c, that should be greater than 6.5%, right? 6.5%. And casual, there should be greater than what? 200 mg per deciliter for diagnosis. Now, true about road traffic accident is most common cause of accidental death in India, yes. More in US motor car user than pedestrian, that's also right, right? Okay, that's also right, and it is also right. The more in number than self-inflicted injuries in India, yes. More in number than railway accident in India, right? Contribute 50% of all injury related to death in India, yes. All the statements are right, right? Okay, in India, causing maximum death among the following is, what is it? It is road traffic accident, right? We know road traffic accident. Most reliable test for screening of diabetes mellitus is, what is the most reliable test? That is fasting blood sugar is the most reliable test. Accidents happening during a weekend is, what is the accident happening in weekend called, right? Cyclic trend, seasonal trend, secular trend, point source, epidemic. Okay, now moving into, okay, the answer is cyclic trend, right? Happening during weekend, right? Cyclic trend. Now here, according to NRCB report, okay, it is what? It is the old data. According to NRCB report 2014, the suicide rate in India is, how much is the suicide? Okay, it is the old data, let's leave it. Now, okay, now moving to the review question. What is the least common cause of heart disease in India? Least common cause. The least common cause is congenital. Rheumatoid, hypertension, and ischemic are the most common cause. Primordial prevention in myocardial are all except maintenance of normal body weight, yes. Change in lifestyle, yes. Change in nutritional habit, yes. Screening for hypertension, no. It falls under what? Secondary, right? Corpulence index measures, what does it measures? Obesity. Okay, moving to the next question. The ischemic heart disease is associated with, where it is associated? It's associated with our what? LDL, right? LDL. Smoking is not associated with the following respiratory lesion. It is not associated with what? Chronic bronchitis, it is associated. Emphysema, yes. Lung cancer, yes. It is not associated with sarcoidosis. The following is a risk factor for development of diabetes mellitus. Sedentary lifestyle, right? Is not, right? So sedentary lifestyle is the what? Risk factor. Protein energy malnutrition in infancy, yes. Excessive intake of alcohol, yes. High intake of vitamin A. So high intake of vitamin A is not the risk factor. In North Karelia project, evaluation risk factor of, there is in North Karelia project evaluate risk factor of, now it evaluate risk factor of coronary heart disease. Glycosylated hemoglobin reflects the mean blood glucose level of previous 3 months. the ideal cholesterol level should be below 200, right? It should be below 200. So this way about the questions, right? Now let's move into the other questions. Which one of the following is not characteristics of non-communicable disease? We already talked about is well-defined etiological agent, right? There is no well-defined etiological agent. Concentration of iodine in common salt consumer level 15 ppm. Similarly, production level 50, retailer level 30, and consumer level 15, right? Okay, moving toward all of the following statement about rheumatic fever, heart disease epidemiology in India are true except, right? Mitral regurgitation is common cardiac lesion. No, it is not. Mitral stenosis is, it is mainly in children, right? Not included among major criteria in acute rheumatic fever, that is polyarthralgia, right? Erythema marginatum is included. It is not polyarthralgia, it is what? Migratory arthritis, right? So similarly, moving to our next question, all of the following are major criteria of Jones in rheumatic fever except pericarditis, yes. Syndrome, yes it is. Arthritis, yes. Elevated, yes, it is of minor, right? All are true about rheumatic fever except. So okay, now revised Jones criteria, evidence of preceding streptococcal infection is taken for last 21 days. This is not right, right? Or all are right. Now moving to our next question. Now here, following dietary changes are advised to reduce prevalence of coronary heart disease except increase complex carbohydrate intake, yes. Saturated intake less than, yes. We did this question, the answer was what? Salt intake less than 20 gram per deciliter. It should be less than 5, right? 5 gram per deciliter per day. So the next question is our, okay, modifiable risk factor in coronary heart disease are all except. So obesity, it is modifiable. Smoking and hypertension, all these are modifiable. Personality changes is not the modifiable, right? Which of the following statement about influence of smoking on risks of coronary heart disease is not true, right? Okay, which is not true. So here, filter does not provide protection. It will what? It will not provide protection. Smoking is not associated with which of the following respiratory lesion? Is not associated with sarcoidosis. We just did this question earlier, right? Similarly, which one of the following is maximally associated with coronary heart disease? That is LDL is maximally associated. Which one of the following is not dietary modification recommended in high risk cardiovascular group, right? Which one is not a dietary modification? That is LDL cholesterol less than 100 mg per deciliter. Other all, avoid alcohol, saturated fat intake 7% of total calories, salt intake less than 5 grams. These are, right? Ischemic heart disease is associated with LDL. Ideal cholesterol level should be below 200, right? Okay, now moving to our other questions. The question are the false about coronary heart diseases, right? Nepal, India, CSD occur 1 decade later than Western. No, it occurs 1 decade earlier, right? Earlier. Now, North Carolina project evaluate risks for what? Coronary heart disease. It evaluate risks for coronary heart disease, right? We already did this question. True about hypertension, the primary prevention does not include. It will not include early diagnosis of hypertension because it is what? It is the secondary prevention, right? Okay. Modifiable factor for hypertension is, modifiable is what? Obesity is the modifiable factor, right? Similarly, the other question is rule of half is seen in, it is seen in hypertension, right? Similarly, the most common cancer affecting urban women is urban women, that is breast cancer in urban, in developed one, right? Okay, the most common cancer affecting both male and female in world is, that is lung cancer, right? Okay, the next question, the most common malignant tumor of adult male in India, that is what? That is oral carcinoma, right? The most common type of cancer among female in developing countries is, that is cervical cancer, right? Similarly, the next question is SPP vaccine true is, what is true, right? Okay, 2 primary dose required for, okay, here SPP vaccination true is, right? Okay, 2 primary dose required for immunization. Which of the following cannot be prevented by screening? Lungs, carcinoma of lungs. Highest increase in surveillance rate is seen after screening of what? Carcinoma colon, right? Highest surveillance. Globally, most common cancer is, what is the most common cancer? That is lung cancer. Field carcinogenesis is related to head and neck cancer. Common cause of low vision is, what is? It is cataract, right? Okay, risk factor for carcinoma are increased by the following, right? By the following: early marriage, right? Risk factor for carcinoma are increased by the following: early marriage will increase, late marriage will not increase, less than 20 years it will not increase, upper socio class it will not increase. Which of the following was not predisposing factor for carcinoma cervix, right? Single child birth was not predisposing factor. The most common cause of blindness in Nepal is, what is the most common? That is cataract. Cutoff for blindness is defined as having vision of less than 3/60, right? 3/60. Okay, the next question is the most common cause of blindness due to easily preventable cause in children is, that is vitamin A deficiency, right? Okay, moving to our next question, that is the blindness can be seen in, it can be seen in measles and rubella both, right? Measles. The blindness is surveyed using school as a compared to population surveys, then estimation of prevalence of blindness will have under value, right? It will have underestimation. The following is not risk factor for developing diabetes mellitus. Sedentary lifestyle, it is. Protein energy malnutrition, it is. Excessive intake of alcohol, it is. So here high intake of vitamin A, it is not, right? So moving toward glycosylate hemoglobin reflex of 3 months, right? The same question are repeated. Internationally accepted method of measuring obesity, it is BMI, right? Okay, body mass index is calculated at weight upon height square. Body mass index is also known as what? Quetilate index. What will be the BMI of male whose weight is 89 kg and height is 172 centimeter? That is what? That is how much? 30 will be the answer. An adult is considered to be overweighting if she has BMI more than 25, right? Obese more than 30, right? For Asian population, the normal BMI is what? 18 to 22.99, right? 2 less than what? Worldwide. The patient is called obese if BMI is greater than 30, right? Okay. Now which of the following indices of obesity is height independent? That is corpulence index. The height in centimeter by cube root of body weight is known as what? Ponderal's index. Assessment of obesity by following measurement accept. Assessment of obesity is by following measurement accept. It is not by surveillance index, right? Okay, which of the following site are used for measuring skin fold thickness to assess obesity? Accept. Abdominal, anterior abdominal wall is not used to assess. Abdominal fat accumulation is assessed by waist to hip ratio, right? Similarly, the next question is which of the following should be done to reduce obesity, right? Regular exercise with same amount of food. The most common cause of stroke is that is cerebral thrombosis, right? The most common type of accident is that is what? Road traffic accident. The other the other question are the questions, this much the question from what? Non-communicable diseases, right? So the topic from which we are going to cover MCQ is, we are going to cover MCQ from what? From tuberculosis of what? Our this community medicine from communicable disease. The first topic is about tuberculosis. Now without delay, let's begin our discussion. Now the first question is, if the objective of investigation is to assess the incidence of tuberculosis infection in a community, the most appropriate methodology would be. Now here we are going to what? The investigator is trying to what? Assess the incidence, right? Now if it is trying to find the incidence, then obviously we need to what? Look for the new cases. Now here the right answer is identify new converter to tuberculin test, right? Identify new converter to tuberculin test. Okay, now moving to our next question. The point of control in tuberculosis infection is. Now what is the point of control? The point of control is what? Less than 1% in 0 to 14, right? Less than 1% in 0 to 14 group of children. Okay, that is the point of control. Now moving to our next question. Which of the following is true about tuberculin test? Now which of the following is true about tuberculin test? Now here true statement is it may be negative in dissociative tuberculosis, right? It may be negative in dissociative tuberculosis. That is true about tuberculin test. The most appropriate test to assess the prevalence of tuberculosis infection in community is. Now to assess the prevalence of tuberculosis infection, right? That is what? That is our, right? Here what we have, it is tuberculin test, right? Tuberculin test is what? The most appropriate test to assess the prevalence of tuberculosis infection in community, right? Okay, moving to our next question. The next question is, National Tuberculosis Institute is located in. Now where is it located of India? It is located in Bangalore. The decrease in which of the following parameter indicate the decrease in tuberculosis problem in India? Okay, decrease in which of the following parameter indicate the decrease in tuberculosis problem in India? It is what? It is what? Our incidence of infection. If incidence of infection is what? Decrease, then there will be decrease in tuberculosis problem in India. Overall prevalence of tuberculosis infection in India as per fourth round of longitudinal surveys. It is a world question, so 30 right? It is how much? It is our 40%, right? 40%. The percentage of positive mental talks in Indian if 20 to 40 years of age group is taken, that is how much? 20 to 30%, right? The population of village on 1st June 2007 is 16,500. Since 1st January 2007, 22 new cases of TB were detected. The total registered cases were 2020. What is the incidence of tuberculosis, right? Now Now the incidence is what? New cases, new TB cases, right? 2 new cases upon total population into how much? 1000, right? So here new cases, new TB cases. What are the new TB cases? These are 22. And what is the total population? That is what? Okay, what is the total population right here? Now here the total population that will take is what? Not this much. Will take 16,500, right? 16,500, and then we multiply it by 1000, and that will be how much? 1.33 per how much? Per 1000 population. 1.33 per 1000 population. So if we multiply it, what we get? We get it 133 per how much? 1 lakh population. Which of the following is not false about annual risks of TB, right? Which of the following is not false about annual risks of TB? So the not false statement is what? Okay, it is assessed by tuberculin conversion in previously non-vaccinated children, right? It is assessed by tuberculin conversion in previously non-vaccinated children, right? Incident to okay, now here it is the true statement. It is assessed, right? What is assessed? The annual risks of tuberculosis. The annual risks of tuberculosis is assessed by tuberculin conversion in previously non-vaccinated children, right? Mcqs theory states that the reduced prevalence of tuberculosis occurred due to. Now the Mcqs theory states that the reduced prevalence of tuberculosis occurred due to. Now it occurred due to, right? Now it occurred due to what? It occurred due to social and environmental factor, right? Now this Mcqs theory, it is related to social and environmental factor, right? Social and environmental factor. Okay, the lactating mother woman has sputum positive tuberculosis and her neonatal child is 3-month old. What is the recommended chemoprophylaxis? Okay, we know isoniazid is given as what? Prophylaxis, right? Now here the prophylaxis is what? Isoniazid 5 mg per kg for 6 months, right? 5-6, just remember it. Isoniazid 5 mg per kg for 6 months. Okay, the antitubercular drug, right, which causes optic neuritis. What is the antitubercular drug that causes optic neuritis? That is ethambutol, right? Ethambutol will cause optic neuritis. Okay, moving to our next question. The number of what positive pluses for tuberculosis bacilli if count of AFB sample is greater than 10 per oil immersion field. Now what is it? It is our 3+, right? 3+ are what? The number of pluses for tuberculosis bacilli if the count of acid fast bacilli sample is greater than how much? 10 per oil, right? It is it. One TB infected person can infect how many people in 1 year? Okay, in 1 year it can infect how much? About 10, right? It can infect about 10 people, right? Incidence of tuberculosis in community is measured by. Now incidence of tuberculosis in community, how it can be measured? Now it can be measured with the help of sputum smear, right? It can be measured. Incidence of tuberculosis community measured by sputum smear, right? Sputum smear. Okay. The most appropriate text to assess the prevalence of tuberculosis infection in communities. To assess the prevalence of tuberculosis infection, that is by what? That is by our tuberculin test, right? Tuberculin test. Mycobacterium tuberculosis infection in human is most common because of what? Okay, because of what? Because of our inhalation, right? Because of inhalation, right? Mycobacterium tuberculosis infection in human is most common because of inhalation. One of the following is known as tuberculin conversion index. Now what is known as tuberculin conversion index, right? Tuberculin conversion index is what? It is the incidence of infection, right? It is the incidence of infection, tuberculin conversion index, right? Export MTB, what? MTB RIF test is used to detect what? It is used for what? It is used for assessing, right? Assessing rifampicin resistance. One is the assessing rifampicin resistance, right? Assessing rifampicin resistance, and another is diagnosis of TB, right? These both options are right, right? TB multi-drug regime is given to. Why it is given? It is given to prevent resistance. It is given to prevent resistance. Sputum test TB is sputum positive TB is 1 out of 2 sputum sample positive. That is called sputum positive tuberculosis, right? Similarly, tuberculin positive means, what does tuberculin positive means? It means it means what? It means the patient is infected with microbacterium, right? Microbacterium. Okay, moving to our next question. Our next question is, the sputum positive TB patient on chemoprophylaxis should be isolated at least for For how much time is the patient isolated? It is isolated at least for 3 weeks, right? It is isolated for about 3 weeks. Contact of sputum positive tuberculosis patient who should be given preventive chemotherapy. The contact of sputum positive tuberculosis patient who should be given preventive chemotherapy. Now it should be given to what? Children below 6 years, right? Children below 6 years is given preventive chemotherapy. Okay, in TB cases, what is the case of TB, right? Case is what? Sputum positive is the case in the case of TB, right? National Tuberculosis Institute is situated in it is talking about India. It is in Bangalore, right? Tuberculin unit is what is the unit of tuberculin? That is what? That is our how much? 1 unit of ppd RT3, right? 1 unit of ppd RT3. The most appropriate test to assess the prevalence of tuberculosis infection in community, right? Infection in community, that is what? That is what? Our tuberculin test by WHO. Best criteria for tuberculosis diagnosis is what? Is the best criteria for tuberculosis diagnosis by what? By our WHO. Now it is our sputum positive, right? A case of tuberculosis according to WHO is detected by how is it detected? It is detected by what? The same thing is your sputum exam, right? Sputum exam. True about tuberculosis. What is true? 10 to the power 4 bacilli are required in sputum for detection, right? Mendix test can be differentiated between BCG and infection, can be grown on ordinary culture media. Drug sensitivity is tested by sex test. So here write the option number A, right? It is the correct statement. 10 to the power 4 greater than 10 to the power bacilli are required in sputum for what? For detection, right? 10 to the power 4 bacilli are required in sputum for detection. In tuberculosis, combination of antimicrobial is used. Now in tuberculosis, the combination of antimicrobial is used. Why is it used? To delay the development of resistance, right? Moving to next question. Number of sputum positive cases of tuberculosis per lakh in India is, okay, let's again talk about India. No much of concern. BCG is what? The BCG is live attenuated vaccine, right? It is live attenuated vaccine. What is it? It is live attenuated vaccine. 1 ml of expectoration contain what number of TB bacilli in active case of TB? 1 ml of expectorant contain what number of TB bacilli in active case of TB? Right? It will contain how much? 10,000, right? It will contain 10,000. 1 ml of expectorant contain about 10,000 TB bacilli in active cases of TB, right? In India, tubercular mother is advised for all except give baby BCG. Okay, it is advised, right? 82 mother, yes. Withhold breastfeeding, no, it is not told, right? Mother is asked to give breastfeeding, right? To provide breastfeeding. Now moving to our other questions. The other question are the incident TB in community is measured by, we know that is sputum smear, right? The incident TB in community is measured by sputum smear positive. Okay, World Tuberculosis Day, it is what? It is 24th March. In Nepal, national DOTS therapy implementation is done was there from what? From April, right? 2001, April 2001, right? Okay, DOT was developed by Carol Stablo of International Union Against TB and Lung's Disease in 1970s, primarily in Tanzania, right? Okay, the main cause of childhood death from tuberculosis is tuberculosis meningitis. Prevalence of disease, best available practical index. The prevalence of disease is best available practical incidence. Annual risk of TB is assessed by tuberculin conversion in previously non-vaccinated children. We did this question. Annual risk of TB is assessed by tuberculin conversion in previously non-vaccinated children. Mcqs theory stated that reduction prevalence of TB occurred due to social and environmental factor. We did this question also. Number of +4 tubercular bacilli if count of acid fast bacilli sample is greater than 10 per well immersion field is our 3, right? 3. BCG is live attenuated vaccine. 10 to the power 4 bacilli are required in the sputum for detection of tuberculosis. A case of tuberculosis according to WHO is detected by sputum examination. Which tuberculin test is more precise for measurement of tuberculin sensitivity? Tuberculin sensitivity, it is measured by Mcqs test. Tuberculin positive means what? The patient is infected with what? Mycobacterium. Tuberculin positive means that the patient is infected with microbacterium. Tuberculin test is only way of estimating the prevalence of infection in a population, right? TB affects the active population of how much? 15 to 55 of the country. When only one sputum smear is positive out of 3, a chest X-ray is necessary additional criteria for diagnosis of pulmonary tuberculosis. Which drug developed resistance earlier? That is what our isoniazid. Rifampicin, it is most active against persistent and dormant bacilli. Antitubercular drug which causes optic neuritis, we did it, that is ethambutol. Only bacteriostatic first line drug is what? Our ethambutol, right? But it is contraindicated in what? Children because of optic neuritis condition. Thioacetazone is contraindicated in HIV tuberculosis co-infection, right? Thioacetazone is contraindicated in HIV tuberculosis co-infection. Similarly, ethambutol is contraindicated in children below 6 months of age. It is contraindicated in children below 6 years of age, right? Okay, moving to our next topic, that is next point, that is streptomycin is contraindicated in pregnancy, right? Streptomycin is contraindicated in pregnancy. Ethambutol is contraindicated in children, right? Thioacetazone is contraindicated in co-infections. Aim of BCG vaccine is to what? Right, to stimulate and acquire resistance to prevent complication of TB. Both of these, right? BCG vaccine is given in right arm in Nepal. The protective value of BCG vaccine is 15 to 20 years. Lactating mother has sputum positive tuberculosis, right? Tuberculosis. Her neonatal child is 3 months old. What is the recommended chemoprophylaxis? We said isoniazid 5 mg per kg for 6 months. The most appropriate test to assess prevalence of tuberculosis infection in community is what is it? It is tuberculin test, right? It is tuberculin test. Tuberculin unit is what? 1 unit of PPD RT23. The objective of investigator is to assess the incidence, right? Incidence. So for incidence, what we do? We identify new converter of tuberculin test. Which of the following is true about tuberculin test? It may be negative in what? Dissociative cases, right? It may be what negative in dissociative tuberculosis. Okay, tuberculin purified protein derivative PPD replaced the antigen world tuberculin, right? PPD is purer preparation, given fewer non-spectacular reaction and easier to sterilize. Tuberculin test in use. Mcqs intradermal test, right? Tuberculin more precise test. Books on tuberculin hypersensitivity, right? HIV test, right? HIV test, quick, easy, reliable, and cheap. Preferred for testing large group, and that is fine. Multiple puncture test, that is unreliable, not recommended. Reading of Montauk's text takes how much? 3 days. It is also important MCQ. 1 ml of expectorant contains what number of tuberculosis bacilli in an active case of tuberculosis? That is 10 to the power 4. Microbacterium tuberculosis infection in human is most common because of what? Because of inhalation, right? Because of inhalation, it is the most common infection. One TB infected person can infect how many people? 10 people. TB transmission is mainly by droplet infection and droplet nuclei generated by sputum positive patient with pulmonary tuberculosis. Coughing generates larger number of droplet of all size. One of the following is known as tuberculin conversion index. That is what? That is incidence of infection, right? Incidence of infection. Tuberculin test conversion is defined as increase of 10 mm or more within 2-year period regardless of the age. By WHO, best criteria for TB diagnosis is sputum positive, right? Suspect cases are based on X-ray examination. Expert MTB RIF, right, test is used to detect. We've already said for assessing resistance to rifampicin, right? Rifampicin resistance, and also for diagnosis of TB. Sputum positive TB is what? 1 out of 2 sputum positive. Okay. Now next question is, okay, gene expert is used to determine rifampicin resistance to tuberculosis. Sputum positivity is negative. Okay, sputum positivity is negative in the case of extrapulmonary tuberculosis. Tuberculosis multi-drug regime is given to. Now it is given to what? Prevent resistance. Yes, prevent resistance. Okay, prevalence of drug resistance case is directly related to chemotherapy. What is correct? Now okay, the correct statement is Malnutrition predisposes to tuberculosis is the correct statement. Tuberculosis kill more women in what? In reproductive age group. In Nepal, all of the registered cases, about 62% of what? Male, whereas 32% are female, right? Okay, point of control is that in tuberculosis infection of what? Less than 1% in 0 to 14 group of what? Children, right? Talking about influenza virus, which is incorrect cyclical. What is incorrect cyclical trend in influenza, right? Okay, the incorrect cyclical trend in influenza is type B pandemic every 8 to 9 years, right? All known pandemic influenza are what? What our orthomyxo type A strain. H antigen initiation of infection, right? H antigen causes initiation of infection. N antigen what? Severity and transmission of infection. H antigen causes initiation of infection, whereas N antigen causes severity and transmission of infection. Different strain of virus are antigenically unrelated and therefore induce no cross infection, right? Different strain of virus are antigenically unrelated and therefore induce no cross infection, right? Okay, now H antigen causes initiation of infection because it comes earlier in alphabet, right? Whereas N causes what? It comes later and it determines what? Severity and transmission of infection. Ray's syndrome. What is Ray's syndrome? It is hepatic failure and encephalopathy, right? It is complication of what? B strain, right? R, right, can be made B, so we can memorize that in such a way, right? Hepatic failure and encephalopathy, complication of influenza B, right? Okay, in serology to indicate influenza infection, fourfold or greater increase in titer is seen, right? In serology to indicate influenza infection, fourfold or greater increase in titer can be seen. In theory, immunization offers the best prospect of controlling influenza at percent. Vaccination less effective if what? CD4 count is what? Less than how much? 100 per mcl. Newer influenza vaccine include all of the following except, right? Okay, newer influenza vaccine include all of the following except killed vaccine, right? Killed vaccine. The route of administration of live attenuated vaccine is intranasal. Route of administration of killed vaccine is intramuscular, right? Killed is what? Intramuscular, and live is intranasal. Zanamivir and oseltamivir for prophylaxis and therapy of what? Influenza A and B. True about epidemiology of influenza, right? All ages and both sexes are equally affected, right? All ages and both sexes are what? Equally affected. Which of the following is true about influenza, right? Incubation period is how much? 18 to 72, right? 18 to 72 is the incubation period of what? This influenza. Incubation period is 18 to 72. Yes. Vaccine preservatives used in influenza vaccine are thiomersal, right? Thiomersal, thiomersal are what? The vaccine what? Used, right? Which of the following is not true about influenza virus? Now, which of the following is not true about influenza virus? Major epidemic are due to antigenic drift, right? Okay, it is what? It is because of antigenic shift, right? So major epidemic are due to antigenic drift. That's not right because it is due to antigenic shift. Look, antigenic shift is what? Occurs due to genetic recombination, reassortment, rearrangement, right? Now it is responsible for what? Causing pandemic and epidemic, right? And what our antigenic drift is because of what? Because of point mutation, right? Point mutation. Now antigenic drift is what? It is shift is sudden, right? Sudden. It causes pandemic and epidemic condition, and but our antigenic drift is what? Gradual, insidious, right? Antigenic variation, antigenic shift and antigenic drift, right? Okay, high antigenic variation, influenza A strain. Antigenically stable is what? C strain, right? Antigenically stable is C, whereas high antigenic variation is on A, right? Period of infectiveness means 1 to 2 days before and 1 to 2 days after the onset of symptoms. Avian influenza or bird flu. This includes H5N1, right? H5N1 first infected human in 1997, right? Okay. Pigeon neither harbor nor spread the virus. That is also question, right? Incubation period of swine flu. What is the incubation period of swine flu? 2 to 3 days, right? 2 to 3 days. Pig in H1N1 acts as what? Pig amplifying. No, it does not act. right? It doesn't act as anything, right? Pig in H1N1, right? Okay, swine flu, that is H1N1. Board strain do not infect pig, right? Influenza B strain do not infect pig, right? Okay, C strain do not infect board, right? Do not infect board. SARS, okay, now there is a lot of new things about SARS, right? Okay, this was all about question from what communicable disease from respiratory topic. We talked about tuberculosis and what tuberculosis and our influenza. Now the topic from which we are going to cover MCQ is we are going to cover it from what our vector-borne disease. Now talking about the vector-borne disease, we'll be talking about dengue, malaria, right? Filariasis, right? Filariasis. Now without delay, let's move into our discussion. Okay, now here the topic dengue, right? The first question is, in dengue shock syndrome is characterized by all of the following essay, right? Dengue shock syndrome is characterized by all of the following essay: hepatomegaly, pleural effusion, thrombocytopenia, decreased hemoglobin. Decreased hemoglobin is not seen in dengue shock syndrome. Instead, increased hemoglobin will be seen, right? Increased hemoglobin will be seen. Okay, now the next question is, all of the following about yellow fever. Okay, all are true about yellow fever except, right? Talking about yellow fever, all are true except. So here our incubation period is 3 to 6 days, that is correct. Validity of international certificate of vaccination lasts up to how much, 10 years, that is also right. Urban form is controlled by 17D vaccine, that is also right. Similarly, Aedes aegypti index should not be more than 10% to ensure the freedom from yellow fever. So this is not the right answer, right? It is not the right answer. So here answer is option number D. Classical dengue fever is transmitted by, now how is it is transmitted by what? It is transmitted by our Aedes mosquito, right? Aedes mosquito. Now all of the following are following statement is are true about dengue. Hematocrit is increased, yes. Platelet is decreased, yes. Tourniquet test is positive, that's right. Vector Aedes aegypti usually bite during daytime. Okay, and pleural effusion is present. So here these all the options are correct about what? Correct about dengue. Dengue virus appears to have a direct man-mosquito cycle in India. The mechanism of dengue virus survival in the inter-epidemic period is, dengue virus appears to have direct man-mosquito cycle in India. The mechanism of dengue survival in inter-epidemic period is, how is it? It is our what? Trans-ovarian transmission of virus. It is how? Trans-ovarian transmission of virus. True about dengue fever is or are. Now is most common arboviral infection. Okay, it is the most common arboviral infection, that's right. Okay, now here, okay, can be both epidemic as well as endemic, that is also right. Can survive in ambient temperature, that's right. Now right, now here incidence decrease in India in last 2 to 3 decades, that's not right. Vector is Aedes aegypti, that is also right. The main vector of dengue fever is, what is the main vector for dengue fever? It is our what? Aedes aegypti, right? Aedes aegypti, which is not true of dengue fever, right? Okay, now here what we have is Aedes aegypti is principal vector, that is right. Breakbone fever is a characteristic, that is also right. Serotype 4 is more dangerous than other serotype, it is not right, because there are 4 serotypes which are totally what? Equally dangerous, right? Equally dangerous. Tourniquet test is positive, that is also right. So your option B is not correct, and here it is the right answer. All are true about dengue hemorrhagic fever except lamivudine is drug of choice. Okay, now here lamivudine is not the drug of choice in the case of dengue, right? So it is not the right answer. Malnutrition is protective. Okay, it can be malnutrition is protective. Transmitted by Aedes, causative agent belong to flaviviridae group, that's right. So here answer is this one, right? Okay, now here the treatment of choice is simply what we do. We symptomatic treatment, we just for fever we provide paracetamol, right? And then we do what? We provide ORS, oral fluid, right? Fluid resuscitation, blood transfusion. Okay, which is not true about dengue hemorrhagic fever, which is not true about thrombocytopenia. Yes, it is seen dengue hemorrhagic fever. Now moving toward hepatomegaly, it is seen. Shock, it is not seen in what? Our dengue what? Fever, right? Dengue fever. So it is asking about dengue hemorrhagic fever. Shock is not seen, right? Plasma leaking is seen, right? Shock is shock syndrome, right? This is the feature of shock syndrome. Dengue fever is transmitted by, we know, Aedes aegypti. The infective period of mosquito for classical dengue fever is, what is the infective period of Aedes mosquito? It is asked several times, right? The infective period of dengue is, it is lifelong. Once the Aedes is infective, Aedes mosquito is infected, it will be infective for lifelong. Which of the following statement regarding dengue is correct? Which of the following statement regarding dengue is correct? Now it is endemic in India is what? It is the correct statement, right? It is endemic. It caused by 3 serotype? No, it is caused by 4 serotype. Aspirin is used? No, it is not used because it is contraindicated, because it can further cause different bleeding disorders, right? The clinical course of dengue is more fulminant in children than adult. That is also right. Now moving into what topic? Malaria. API is what? Okay, API is our annual parasite incidence, right? Incidence. The infective form of malaria parasite through a blood transfusion is, now infective form is what? Normally the infective form is what? Sporozoite, but here what is it? It is trophozoite, right? Trophozoite. The infective form to mosquito also is trophozoite, right? Okay, now moving further, the drug preferred for chloroquine resistant malaria in pregnancies. The drug preferred in chloroquine resistant malaria in pregnancy, what is it? It is quinine, right? Quinine. In chloroquine resistance zone, the presumption treatment of malaria would be given. In chloroquine resistance zone, the presumptive treatment of malaria to be given is, now what is given? It is sulfadoxine and pyrimethamine, right? Sulfadoxine and pyrimethamine is the drug of choice in the case of what? In the case of chloroquine resistance zone, right? Okay, the high risk areas, the radical treatment for Plasmodium vivax infection after microscopic confirmation is administration of tablet Primaquine in daily dose of how much, right? In high risk area, the radical treatment for our Plasmodium vivax infection after microscopic confirmation is administration of tablet Primaquine in daily doses of how much? It is 0.25 mg per kg body weight, right? 0.25 mg per kg body weight. So the next question is, the most sensitive index for recent transmission of malaria in a community is, now what is it? For recent transmission, the most it is what? Infant parasite rate, right? Infant parasite rate is what? For most sensitive, and it is for recent transmission. And for what? For our endemicity, that is spleen rate, right? The endemic area, the most sensitive indicator of recent transmission is, I've already said, that is what? That is spleen, right? The spleen rate, right? Spleen rate. Okay, the best indicator for malaria prevalence in community is, now what is the best indicator for malaria prevalence in community? Now the best prevalence indicator, it is our what? It is our spleen rate only, right? It is our spleen rate only for malaria prevention in community. Okay, we did how much? Okay, for recent transmission, that is what? That is our infant parasite rate. For endemic area, that is spleen rate, best indicator, right? Sorry, the endemic area, most sensitive indicator. For here also it is asking about what? Recent transmission of malaria, right? It is also what? It is also infant parasite rate, the same as above question, right? It is talking about recent, right? The recent transmission of malaria, and the most sensitive, it is talking about what? If the answer is infant parasite rate, infant parasite site only. The best indicator for malaria prevalence in community. Now here the answer is what? The answer is spleen rate, right? Spleen rate. Which one of the following is used for radical cure of malaria? Now what is used for radical cure of malaria? That is Primaquine, right? Primaquine is used for radical cure. Okay, moving further, species of Anopheles transmitting the malaria in urban area is, now urban area that is Stephens's, and in rural area that is what? That is Colchicine facies, right? The peak of fever in malaria coincide with a release of successive brood of our what? That is merozoites, right? Merozoites. When merozoites will be released into bloodstream, at that time what will happen? There will be peak of fever. Urban malaria is due to what? We have already said urban, it is Stephens's. True about epidemiology of malaria. What is true? The true statement is the mosquito acts as what? definitive host, right? Mosquito acts as definitive host. Okay, now the malaria is transmitted by, we all know what Anopheles, what Anopheles, malaria is transmitted by what? Anopheles. Now Anopheles stephensi, Anopheles diarrheus, right? These both are the correct answer. The following factors are responsible for resurgence of malaria except, right? Okay, following factors are responsible for resurgence of malaria except use of bed nets, right? Drug resistance, vector resistance, mutation in parasite, these all are what? These all are, but our use of bed net is not. Okay, question number 241. Plasmodium ovale in India has been reported from. Okay, the question from India, it is Gujarat and Odisha. It is Gujarat and Odisha. True about malaria in India is R. Okay, now it is option A is right, 1.5 million cases annually. Prophylaxis of malaria not used, right? For prophylaxis of malaria, what is not used? Now the thing that is not artesunate is not used, right? Prophylaxis of malaria. Chemoprophylaxis of malaria can be done by all except. Chemoprophylaxis of malaria can be done by all except. Okay, it is primaquine, right? Primaquine cannot be done for chemoprophylaxis. Malaria recrudescence is what? Recrudescence is what? It is what? Our reappearance of sexual stage parasitemia after treatment, right? Reappearance of sexual stage parasitemia after treatment, that is what? That is this term, right? Cycle that is seen in RBC in malaria. Okay, we know what cycle is seen in RBC, that is a sexual cycle, right? Now here what? Okay, cycle that is seen in RBC in malaria, that is what? A sexual cycle, right? That is endogenous, right? Endogenous cycle that is seen in RBC in malaria is endogenous, right? Okay, the malaria parasite in India are all except. Malarial parasite in India are all except. Now what is not found in India? That is what? That is Plasmodium ovale, right? Plasmodium ovale is not found. Also in Nepal, incubation period of Plasmodium vivax is, what is it? It is 10 to 14 days, right? Anti-malarial month. What is anti-malarial month? It is June. June is anti-malarial month. API of what is greater than 2. The vector is resistance to DDT. The malathion spray should be done every, okay, it should be done how much? 3 round of malathion every 3 months, right? Okay, 3 round of malathion every 3 months. So 3, 3 and M, these are all what? This seems similar, like M can be made 3 also. So option number D is the right answer. Now the next question is, the malarial survey is conducted in 50 villages having population of 1 lakh. Out of 20,000 slide examined, 500 turned out to be malaria positive. The annual parasite incidence. Now what is the annual parasite incidence right here? Okay, now here the annual parasite incidence is how much? Our 5 is the annual parasite incidence. Okay, the most sensitive index of recent transmission of malaria is, okay, we have said recent transmission, obviously. What is the answer? Infant parasite rate, right? What is causative organism for malaria? We said, what is it? It is Plasmodium. Goal of reduction of morbidity and mortality due to malaria by 2010. So it is so old question, right? Indian question, that is 50% reduction was the answer. Malaria is transmitted by, it is transmitted by female Anopheles mosquito, right? Female Anopheles mosquito. Among various species of mosquitoes belonging to Anopheles gene, one that is highly anthrophilic and transmit even if at low density, right? Highly anthrophilic, right? And even transmit at low density. What is it? It is our Anopheles fluvitalis, right? Fluvitalis. The base determinant index of recent transmission, we have already said infant parasite rate, right? Now moving toward lymphatic filariasis. DEC is used extensively in chemoprophylaxis of filariasis. It is most effective against, we know it is most effective against microfilaria. The organism most commonly causing genital filariasis in most part of Bihar and eastern UPs, right? The organism most common causing genital filariasis in most part of Bihar and UPs, that is what? That is Eucherian Prankofti, right? Okay, moving to our next question. The currently given regime for Bancroftian filariasis, what is the regime? The regime is what? 6 mg per kg per day for 12 days, right? 6 mg per kg per day for 12 days, right? For 12 days. The vector for transmission of Brachyptian filariasis is, what is the vector? Okay, the vector is what? Our Culex fatigans, right? Culex fatigans. DEC mediated salt for mass treatment in lymphatic filariasis was shown to be safe, cheap and effective in, but it was okay, it was in Lakshadweep Island, right? It was in Lakshadweep Island, right? Okay, all of the following are helpful for elimination of filariasis except, right? Okay, now here all of them are what? Helpful in elimination of filariasis except it is what? Larvae are deposited on skin surface where they can't survive, right? The option number C, larvae are deposited on skin surface where they can't survive, is not the right answer. Microfilaria do not multiply in vector, that's right. They multiply in humans, that's right. Mass dog administration can be done, right? But not this option number C. All of the following are true about filariasis except, right? Okay, now tail end is free from nuclei and unsheathed is the what? Is not the correct statement. It is sheathed and nocturnal activity, daytime reside inside the lymphatic, that's right, right? The life cycle of filarial in mosquito is described as, right? It is defined as cyclodevelopmental. It do not multiply, but simply there will be maturation, right? Developmental phase will be there. The clinical incubation period of filariasis, what is the clinical incubation period? That is 8 months to 16 months. Target year for, okay, 2015, it is world question, okay, no problem. Now other questions. The classical dengue is transmitted by, we know, Aedes mosquito, right? Vector for dengue is Aedes aegypti. Talking about other question, the infective period of Aedes mosquito for classical dengue fever, breakbone fever is what? It is lifelong, right? Incubation period of dengue is 2 to 7 days. Classical dengue fever is also known as breakbone fever, right? All are true about dengue hemorrhagic fever except lamivudine is not the drug of choice, right? Which of the four, which is not true about dengue hemorrhagic fever? There is no the feature of shock. Dengue hemorrhagic fever is severe form of dengue fever caused by infection of more than one dengue virus type. Diagnosis of dengue hemorrhagic fever. What we can do? The fever is there, hemorrhagic manifestation, thrombocytopenia, hem concentration or rising hematocrit is seen. Rising hematocrit value greater than 10% of baseline and greater than 20 petechia per square inch are characteristic feature of dengue hemorrhagic fever, right? Moderate to severe protein energy malnutrition reduce the risk of dengue hemorrhagic fever, dengue shock syndrome in dengue, right? Now it is in children. Dengue shock syndrome is characterized by the following except hepatomegaly, yes, it will be there. Pleural effusion, yes. Thrombocytopenia, decreased hemoglobin will not be there. We did this question earlier also, right? Diagnosis of dengue shock syndrome, right? Dengue hemorrhagic fever plus shock, right? That means rapid, weak pulse, right? Weak pulse, right? Pulse pressure will be what? Decreased, right? Decreased BP, hypotension, clammy skin, restlessness. But decrease in hemoglobin is not the feature of dengue virus infection, which is not true of dengue fever, right? The not true is serotype 4 is more dangerous because all of the 4 are equally dangerous, right? 4 serotype of dengue virus are present and produce same illness. Dengue virus appear to have direct mosquito-man cycle. The mechanism of virus survival in intra-epidemic period is, okay, we talked about it, trans-ovarian transmission of virus. Among the various species of mosquito belonging to Anopheles genus, one that is highly anthrophilic and transmit even at low density, that is Anopheles flavivitalis, right? Flavivitalis. Anopheles colchifacis, right? Facis, vector of rural malaria, and Stephensis, urban malaria, right? Okay, and Flavivitalis, right? Efficient vector, high anthrophilic, breed in moving water also, and Sondaicus breed in brackish water. Incubation period 5x, it is 8 to 17 days, 14 days inappropriate. Falciparum, that is 12 days. Malaria, that is 28 days, right? Double of what? 5x. Oval, that is what? 17 days. Okay, moving to next question. The infective form of malaria parasite through a blood transfusion, that is trophozoite. We did it, right? The infection of blood of malaria patient containing asexual form, that is trophozoite induced malaria or transfusion malaria. The host involved in transmission of malaria. Secondary host, that is man is what? Secondary host, intermediate host, acyclical cycle will be here, schizogony will be here, right? These all are what? Acyclical one. And primary host is what? Our female Anopheles mosquito. Definitive host is female Anopheles mosquito. Sexual cycle sporogony will be here. Infective form of malaria is sporozoite. Infant parasite rate, right? Sensitive index for recent malarial transmission. API is, we already talked about annual parasite what? Incidence, right? Annual parasite incidence. The most sensitive index of recent transmission, right? It is what? It is infant parasite rate. Infant parasite rate. The best indicator for malaria prevalence in community, okay, that is spleen rate, right? That is spleen rate, the best indicator for malaria prevalence in community. Annual parasite incidence, right? Sophisticated measure of malaria incidence. Annual blood examination, index of operational efficiency. The drug preferred for chloroquine resistance in malaria in pregnancy, that is primaquine, right? Sorry, that is quinine. In chloroquine resistance zone, the presumptive treatment of malaria is what? That is what? That is our what? Sulfadoxine and pyrimethamine, right? Sulfadoxine and pyrimethamine. Mefloquine should be used only in Plasmodium falciparum cases having proven resistance to chloroquine. Which of the following is used for radical cure of malaria? That is primaquine, right? Primaquine is used. Chemoprophylaxis of malaria can be done by all except it can be not done by primaquine, right? Because it was used for what? Radical cure, right? Radical cure. Primaquine is contraindicated in pregnant women, infant, G6PD patient. Mass treatment of malaria, right? Is okay. Mass treatment of malaria according to WHO recommendation in highly endemic area, right? That is API greater than 5 per 1000 population, right? The mass prophylaxis is not recommended in less than 5 years. Peak of fever in malaria coincide with release of successive broad merozoites in bloodstream, right? Merozoites. Malaria recrudescence is what? Reappearance of sexual stage parasitemia after treatment, right? The recrudescence, reattack of malaria parasite because of surviving malaria parasite in RBC, and relapse is reattack of malaria because of infection by malarial parasite which was surviving in liver, right? Recrudescence, that is what? That is in RBC, right? We are surviving in RBC, and relapse is we are surviving in liver. Okay, now here the same question, right? Now here, what is that? The malaria survey, 50 villages having population of 1,20,000 slide examined, 500 turned out to be malaria positive. The annual parasite index is 5,000 divided by what? 1 lakh into what? Our 5,000 divided by 2 lakhs into 1000, that is 5 will be the answer. The denominator of above question consists of total population under surveillance, not total slide examined, right? The cycle that is seen in RBC in malaria is endogenous, right? We already said main is secondary, intermediate or sexual cycle will happen, schizogony is here. But here in female, primary host, definitive host, sexual cycle and sporogony is in there. All of the following factors are responsible for a resurgence of malaria except, right? Okay, use of bed net is not that, right? Talking about lymphatic filariasis, the vector for transmission of Bancroftian is, it is Culex fatigens, right? Now, Bancroftian filariasis factor is Culex fatigens. Most common method for epidemiology assessment is 20 cubic millimeter of what? Capillary blood collected between 7:30 to 12 midnight. 12 midnight is important here. Most sensitive method for detecting low density microfilaria is membrane filter concentration method. Good method to detect low density microfilaria when other method fails is genodiagnosis. DSC is used extensively in chemoprophylaxis of filariasis. It is most effective against microfilaria. The currently given regime for Bancroftian microfilaria is, what is it? It is DEC 6 to what? 12 days, right? 6 mg per kg per day for 12 days, right? DEC medicated salt 148, right? DEC is a type of mass treatment, right? DEC is effective in killing what? It is okay, stage 3, right? Larva, and effective to adult worm in uncertain. Subcutaneous filariasis is caused by Loa Mansonella, right? Onchocerca, right? Draculosis. Okay, all of the following are helpful for eliminating filariasis except, right? Larvae are deposited on skin surface that they can't survive. This is the answer. Okay, every questions are what? These are repeated. All of the following are true about all of the true about filariasis except, right? Tail end is free from. Okay, this is also repeated question. Life cycle of filariasis in mosquito is what? Cyclodevelopmental. It is also repeated and asked many times, right? Plaque is propagative, right? Plaque is propagative. Malaria has cyclopropagative. Or clinical incubation period of filariasis, same question, 8 to 16 months. Talking about leishmaniasis, Kala Azar is transmitted by, it is transmitted by phlebotomus, what? Orzentis, right? Phlebotomus orzentis. Okay, talking about Kala Azar, right? Types, visceral leishmaniasis, which is by Donovan, cutaneous, tropica, right? Mucocutaneous leishmaniasis brasiliensis. Vector is female phlebotomine sandfly for Kala Azar, and habitat of sandfly, it is crack and surfaces of wall, freehold. Insecticide of choice for sandfly is what? DDT or BSC, diphenyl trichloroethane, and what? Benzene hexachloride. False about leishmaniasis is, the false is Aldred test of Napier is good for the diagnosis, right? It is the false statement, right? Aldred test for Napier is used for surveillance, not for diagnosis, and it is very important. It is asked many of the time. It is used for surveillance. Leishmanial Montenegro test is used for immunity status, right? Montenegro test. Okay, RK39 dipstick test to make a point, and Leishmanial amphotericin B to make a test. Not true about Kala Azar is, what is not true about Kala Azar? Okay, the not true statement about Kala Azar is man has flagellar stage of organism, right? Leishmanial body, LD body, or mastigote form of Leishmania is invertebrate. Flagellate promastigote is in what? Is in insect. So here flagellar state, which it is saying is on man, is the incorrect statement. Flagellated promastigote state is found in insect. Kala Azar is known as black sickness. Pigmented face, hand, feet, and abdomen are seen. Kala Azar is characterized hematologically by what? Reversed albumin globulin ratio, progressive leukopenia, anemia, increase in immunoglobulin J, low WBC-RBC ratio, and increase in ESR. Leishmaniasis is diagnosed in hematological laboratory by direct visualization of a mastigote leishmanial donor body. All are used in treatment of visceral leishmaniasis except hydroxychloroquine is not used, right? Meltifosine, paramocin, and citamacquine are used, right? Citamacquine is new once a day oral drug for treatment of Kala Azar. Oral meltifosine is only drug available and current treatment of choice in treatment of in Nepal, right? Meltifosine. And paramocin is included in Kala Azar control program in India. The current strategy is to replace meltifosine with liposomal amphotericin B. Reservoir of Kala Azar is, what is the reservoir? That man is the reservoir. All of the following statements are true of Kala Azar except, okay, dog is reservoir of infection. No, the dog is not the reservoir of infection, right? The variety of animal reservoirs such as dog, jackal, fox, rodent, and other animal, right? Now, but here we're talking about Indian Kala Azar. It is non-zoonotic infection, so man is only the consider, right? The solo. Okay, this was all about what? This was all about what? Our vector-borne disease, in which we talked about leishmaniasis, right? Dengue, malaria, filariasis, right? Okay. Now the topic that we are going to cover is intestinal infections. Now in intestinal infection, we'll be talking about what? Hepatitis, we'll be talking about diarrhea, typhoid, right? Okay, we'll be talking about these things. Now without delay, let's move into the questions from hepatitis. Now, which of the following is not transmitted through sexual route? Now talking about the transmission from sexual route, right? Okay, the hepatitis A is transmitted from fecal-oral and sexual route both. E, it is exclusively fecal-oral, so this is our answer. But hepatitis E, A and E, no, that's not right answer. And D, it is also what? It is sexually transmitted, right? Sexually transmitted. It is perinatal and percutaneous. Perinatal and percutaneous. So answer is B. The marker for infectivity of serum in hepatitis B is, okay, talking about the marker, right? Now the marker for infectivity of serum, that is what? That is our HBeAg, right? HBeAg, right? Marker of hepatitis B infection in order of appearance in what? Serum. Okay, talking about okay, it is what? It is the marker of infectivity of serum. Now talking about some of the important marker. The first one marker that appears in what? In infection of hepatitis is HBsAg, right? It is hepatitis B. It is in hepatitis B surface antigen, also known as Australian antigen, right? First antigen to appear in serum, right? First antigen to appear in serum. And what? First evidence of infection is also shown by what? HBsAg, right? First evidence of infection, and epidemiological marker of hepatitis B infection also. Now talking about HBsAg, right? HBsAg, it is what? It is the what? It is the antigen that does not appear on serum, right? It is only the antigen that will not appear in serum, right? And talking about HB, right? EAG, right? It is what? Hepatitis B envelope antigen, right? It is secretory form of hepatitis B antigen, and it indicates the active viral what? Infection, right? Active viral replication, right? It is marker of infectivity, right? And what if it persists for what? If it persists for more than what? 3 months, then there is increased chances of chronic hepatitis B, right? And now talking about antibody, such as antibody, right? Antibody what? HBC, okay? It is what? First antibody to appear in serum, right? And talking about antibody HBE, now it is what? It is it indicate what? Stoppage of active viral replication, right? In the periodicity is reflected by antibody SBA. Now talking about anti-SBS, right? Our SBS, it is what? It is the last antibody to appear in serum, right? Anti-SBS is last antibody to appear in serum. Okay, now talking about the next question, which one of the hepatitis B virus serological marker indicates the first evidence of hepatitis B infection? We have already said the first indication is done by what? Our HBsAg, right? Which of the following is true about HCV screening, right? Okay, which one of the following is true about HCV screening? It is the medical students are screened before their joining, right? So the following is true. Okay, this is the right statement, right? This should be done. Now this is okay, this is right one statement, and another is what? Our IV drug users are prone to infection. Yes, hepatitis C, it is IV drug users are more prone to infection. And similarly, what? Our long-term hemodialysis is needed, right? Needed, and interferon is the treatment. So it is what? It is about hepatitis C. Now moving to our next question, that is hepatitis A is. Hepatitis A true is cause mild illness in children, 3% incidence of carrier state, sexual route common, 10% transmission into HCC, vertical transmission is never seen. What is true about our hepatitis A? Now it causes mild illness in children, right? It is what? It is true. It causes mild illness in children. Other all statements are false, right? Going to our next question, which of the following are seen in acute hepatitis B? Now which are seen in acute hepatitis B? We all know, right? Here HBsAg is seen, anti-SBC is seen, right? Anti-SBC is seen, and HBe antigen is seen, right? HBe antigen is seen, right? These are what? These are seen in acute hepatitis B. Now moving further, both HBsAg and HBeAg are positive in. Now HBsAg and HBe are positive in what? Acute infection hepatitis B, acute infection of infectious hepatitis B, right? Going further questions, 1955 hepatitis outbreak in Delhi was. In 1955, the hepatitis outbreak in Delhi was what? It was which hepatitis? It was hepatitis E, right? Hepatitis E. Isolation period of hepatitis A is, what is the isolation period of hepatitis A? It is 3 weeks, right? Acute hepatitis B marker is R. What is it? It is our marker, right? Hepatitis HBsAg and anti what? HBC, HBsAg, right? Anti-HBC and HBeAg, right? These are what? These are the marker, right? These are the marker. The mother is HBsAg positive with 32 week of pregnancy, right? Pregnancy. What should be given to newborn to prevent neonatal infection, right? Okay. Now here what can be given, right? Now here hepatitis B vaccine plus immunoglobulin can be given, right? Hepatitis B vaccine along with immunoglobulin can be given. Most important in diagnosis acute hepatitis B is, what is most important? Okay, the most important is our IgM anti-hemoglobin C, right? IgM anti-hemoglobin, okay, sorry, hepatitis C, right? Hepatitis C, right? And what our antigen, hepatitis E antigen, right? Hepatitis E antigen. IgM antibody hepatitis C is what most important in diagnosis acute hepatitis B. Okay, now moving further, right? Moving further, what we have here is the most important. Okay, now let's go into Notts was diagnosed to have HBeAg, right, antigen, HBs antigen in serum. The most likely she is having. Okay, we already said what is it. It is the active and infectious hepatitis B disease, right? Active and infectious hepatitis B disease. Okay, hepatitis A virus seeding in feces is, right? Hepatitis A virus seeding in feces is, what is it? It is our 2 week before symptom and 2 week after, right? 2 week before and 2 week after. There is seeding in feces. Epidemiology marker of hepatitis B. What is the epidemiological marker? The epidemiological marker is SBSEG. SBSEG is the epidemiological marker. Chance of viral hepatitis type C becoming a chronic is, what is the chance? There is what, 50% or more chances, right? Maximum chances. Now let's go into diarrheal disease, cholera and typhoid, right? A freshly prepared ORS, right, should not be used after. It should not be used after how many? 24 hours. It should not be used after 24 hours, right? A 5-year-old child passed 18 loose stool in last 24 hours and vomited twice in last 4 hours. He is irritable but drinking fluid. The optimal therapy for child is, right? Okay, now here the child is in which phase? The child is in okay, now here the child is in moderate dehydration, right, because he is able to drink water. If it would have severe case, then he wouldn't be able to drink water also. So here the optimal therapy for the child is, what is the optimal therapy? Now here ORS, right? ORS is the optimal therapy, right? ORS is the optimal therapy. Now a best approach to prevent cholera epidemic in a community is, right, what can be done in for cholera treatment? Now here safe water and sanitation is the best way. Which of the following is drug of choice for chemoprophylaxis of cholera? We know it is what? It is tetracycline, right? It is tetracycline. Usual incubation period of typhoid fever is, what is the usual incubation period? It is 10 to 14 days, right? 10 to 14 days. Drug of choice for treating cholera in pregnant women is, what is it? It is none, right? None, right? It is neither tetracycline, doxycycline, fluorajolidone and cotrimoxazole. Drug of choice in treating cholera in children. In cholera, right, here none of the answer is right. Nowadays azithromycin is used. Azithromycin. Here also in pregnancy nowadays azithromycin are used. Azithromycin along with fluorajolidone, right? These two are used nowadays. True about citrate in ORS is, what will citrate do? It will increase what? It will increase the shelf life, right? It will increase the shelf life. Sodium content of resmol rehydrating solution for malnutrition children is sodium content. What is the sodium content? Okay, talking about the sodium content, right? It is 45 millimole, right? 45 millimole is what? 45 millimole is the sodium content, right? Sodium content. For controlling an outbreak of cholera, all of the following measures are recommended except, right? All are used, but mass chemoprophylaxis is not used. Proper disposal of excreta, yes. Chlorination of water, yes. Early detection and management, yes. But mass chemoprophylaxis is not used. Which one of the following gives strong evidence of typhoid fever carrier status? Right? The typhoid. Now isolation of VI antigen, right? Isolation of VI antigen gives strong evidence of typhoid fever carrier status. VI antigen, right? Okay. Now for controlling an outbreak of cholera, all of the following measures are recommended except mass prophylaxis. We already said chemoprophylaxis is not used, right? Moving to our next question, that is antibiotic treatment of choice for treating cholera in an adult in single dose of. Antibiotic treatment of choice for treating cholera in an adult is a single dose of what? It is single dose of doxycycline, right? Doxycycline. Convalescence case of cholera remain inactive for how many? It remain inactive for 14 to 21 days. WHO ORS concentration of sodium is, in WHO ORS concentration of sodium is how much? It is our 90 milliequivalent per liter, right? It is 90 milliequivalent per liter. True about ORS is sodium is 90, yes it is, right? And glucose is 110, that is also right? Sodium is 90 and glucose is what? Glucose is 110, that is right. Okay, now the composition of ORS recommended by WHO is, okay, now here, now let's start from what? Let's start from sodium citrate, right? Sodium citrate, it is how much? 2.9, right, grams. Similarly, potassium chloride, KCl, it is what? It is 1.5, right? Sodium chloride, NaCl, it is how much? It is 2.6. and talking about glucose, it is 13.5. so here NaCl, it was 22.6, not, it is not right. 4.5, it is not right. 2.9, right? Sodium chloride, no. Potassium, sodium potassium citrate, so it is right. Sodium bicarbonate, no, it is not right. Sodium potassium chloride, it is right. So these two options, potassium chloride, right, potassium chloride is right, and along with our what? 2.9 citrate, it is also right. Moving further, WHO ORS contents, right? Okay, the same thing, composition of ORS, which of the following is correct, right? Okay, now here what? Sodium 90 milliequivalent, potassium 20, right? Okay, ringer lactate, true is, what is true about ringer lactate? Now talking about ringer lactate, what? The chlorine is 111, right? And lactate is 29, right? Lactate is 29. 174, WHO ORS is K plus contains 20 millimole per liter, and sodium is how much? 90 millimole per liter. In 12 kg child with diarrhea, fluid to be replaced in first 4 hours. Now what is the fluid that should be required in for 12 kg, right? 12 kg. In 12 kg, it is how much? It is our 800 to 1200 milliliter. Incubation period of typhoid, what is the incubation period of typhoid? It is what? It is 10 to 14 days, right? 10 to 14 days, which is true of typhoid. True statement about typhoid is male carrier thoughtless are more dangerous, right? True about typhoid is male carrier though less are more dangerous, right? Male carrier though are less and but are more dangerous, right? Persistent diarrhea in infant, persistent diarrhea, what is persistent diarrhea? It is for 14 days, right? ORS should be discarded after 24 hours. ORS contains 75 millimole liter of, it contains 75 millimole per liter of what? It is of sodium and glucose, right? Sodium and glucose. Dehydration in children with diarrhea, thirst present, tear absent, that is what? That is thirst is present, that is moderate type. Concentration of sodium in millimole per in low osmolar ORS is 75. New WHO ORS osmolality is, what is it? It is what? Our 245, right? 245 is the new osmolality, right? The ORS amount required for first hour in 1 year old case of dehydration is, how much is it in 1 year old? It is how much? 600 to 800, right? 600 to 800 ml. Which of the following about composition of new ORS is wrong? 185, that is total osmolality is 300. No, total osmolality is how much? We have already said 245 is the total osmolality nowadays. Truth of 8th pandemic of cholera is, right? What is truth? It is that it started in Bangladesh and due to what? Our O19L tour, right? It is started in what? Bangladesh, and this is also right. And low proportion of adult in endemic region are seen, right? The village affected with epidemic of cholera, which is the first step which should be taken in village to decrease the death from cholera? Okay, we have already said, right? Safe water supply and sanitation is the right answer. Ratio of sodium glucose in ORS is, what is the ratio? The ratio is 1:1, right? 1:1. Okay, now drug of choice for carrier of typhoid is, now for carrier, that is ampicillin. Ampicillin is the drug of choice for carrier of typhoid, which is true of typhoid, which is true about typhoid. The true statement about typhoid is, okay, male carrier though less are more dangerous. Salmonellosis disease, isolation is done till, right? Isolation is done till stool culture negative for 3 times, right? stool culture is negative for 3 times. ORS, the concentration of sodium chloride is, we have already said it is how much it is, what it is, what 3.5 grams, right? 3.5 grams. The drug of choice for cholera chemoprophylaxis is, what is it? It is our tetracycline, right? Tetracycline. Typhoid oral vaccine are given in, these are given where? These are given in our 1, 3 and 5 days, right? 1, 3 and 5 days. Isolation of patient with salmonellosis is done till what? Till 3 stool tests are negative. Best disinfectant for cholera stool is, what is it? It is our Cresol, right? Cresol is best infectant for cholera stool. The oral rehydration solution least amount is of, what is least amount of? It is of potassium what? Chloride, right? All of the following statement regarding trachoniculiasis are true except, right? Every statement are true except nirridazole prevent transmission of disease, right? Nirridazole prevent transmission of disease. Chandler's index is used to epidemiology studies of Chandler's. Now it is used for what? It is used for hookworm, right? That is endemic index or Chandler's index, right? It is used for what? Hookworm. Intermediate host for hydrated diseases. What is the intermediate host for hydrated disease? Okay, it is what? Our man is what? Intermediate host for hydrated disease. Chandler's index of hookworm when is health problem? It is when what? It is greater than 300, right? When it is greater than 300. Chandler's index is used for, what? It is used for ankylostoma duodenale, right? Hookworm, right? It is used for hookworm. Use of Chandler's index for hookworm include all except monitoring individual treatment, right? Monitoring individual treatment. Use of Chandler's index for hookworm include all except monitoring what? Individual treatment. Now, talking about next question. WHO consideration regarding trachoniculosis eradication all are true except DT is not true. Drinking piped water and installation of hand pump, that's right. Health education and awareness of public, that's right. Control of cyclops, that's also right. Okay, moving to our next question. Guinea worm infestation is common in worker of, right? Guinea worm infestation is common in worker of steppe whales, right? Guinea worm in steppe whale. Chandler's index is used for, it is used for ankylostoma duodenale, right? Hookworm. According to Chandler's index, water containing 200 to 250 eggs should be considered as what? It should be considered as dangerous, right? Dangerous. Chandler's index, what is Chandler's index? It is what? Number of hookworm per gram of stool, right? Number of hookworm per gram of stool. That is Chandler's index. Okay, trachoniculosis is more common in which of the following state? Now it is more common in what? Rajasthan. Cysticercosis cellulosae causes infection with what? Infection with our Taenia solium. Chandler's index is per what? We have already seen number of egg of hook per in what? In stool, right? Okay, now talking about highest level of health care is, what is the highest level? That is what? Tertiary care, right? Okay, these are all about the questions. Now let's move into what other questions. The usual incubation period for typhoid is 10 to 14 days, right? Incubation period of typhoid is 10 to 14 days. For cholera it is 1 to 2 days. Typhoid is 10 to 14 days. Cholera, it gives what? Rice water diarrhea. Typhoid, there is pea soup diarrhea, right? Pea soup diarrhea. Rose spot are seen in second week. The feature of typhoid, right? Rose spot, feature of typhoid in second week. Common complication of typhoid is intestinal perforation. Cholera is notifiable disease locally, nationally and internationally. Area is declared free of cholera when twice of IP has escaped since last case. The village affected with epidemic of cholera. What is the first step which should be taken in village to decrease the death from cholera? This we did it, right? Safe water. The best approach to prevent cholera epidemic in community is, right? It is what? It is our safe water and sanitation. Which of the following is a drug of choice for chemoprophylaxis of cholera? Okay, it is what? It is tetracycline. Drug of choice for chemoprophylaxis is tetracycline. The drug of choice for treating pregnant women. What is the drug of choice? That is azithromycin, right? Okay, drug of choice for typhoid fever cases, that is cephalosporin, right, ceftriaxone, and carrier, that is ampicillin and amoxicillin. We did this question also. For carrier, ampicillin or amoxicillin was what drug of choice. Or convalescent case of cholera remain infective for 14 to 21 days. Convalescent carrier of typhoid, bacilla, for 6 to 8 weeks. Chronic carrier, bacilla, for greater than 1 year after attack. Ministry of diagnosis of typhoid is what? Our blood culture in first week, right? We remember BASU. In cholera, mass prophylaxis is not advised, right, for total community. It is only advisable for household contact or close community. Typhoid oral vaccine is given in 1-3-5 days. Typhoral, live or oral, type 21A0 vaccine contains greater than 10 to the power 9 viable organism of attenuated typhoid, right? 5-year-old boy, 18 stool, right? Here irritable but drinks water, right? Some dehydration, right? So it is what? Here we give oral rehydration therapy. Oral rehydration solution contains least amount of what? Potassium chloride. Concentration of sodium in low osmolar, that is what? That is 75. Which of the following about composition of new ORS is wrong? That is what? Total osmolarity is not what? 300. Okay, these are about what? The WHO recommended osmolarity and rehydration solution of low NaORSA, right? Okay, the next question is the sodium what is the concentration of sodium? That is 45 millimole per liter. True about citrate in ORSs increase the shelf life. Okay, inclusive of trisodium citrate instead of sodium bicarbonate in WHO ORS makes the product more stable and result in less stool output, right? Low osmolarity ORS reduce stool output by 20% and vomiting by 30%. Most susceptible blood group in cholera is cholera is our B, A and AB. The chronic case of typhoid organism persists in gallbladder and biliary tract, right? The most successful approach in treatment of chronic case of typhoid is cholecystectomy plus ampicillin therapy. The freshly prepared ORS should not be accessed for 24 hours, discarded after 24 hours, right? The freshly prepared ORS solution should not be used after 24 hours. Intravenous rehydration can be done with, right? Intravenous rehydration, Ringer lactate, right? Hartmann's solution, diarrhea treatment solution, right? And normal saline. Okay, now this normal saline is poorest choice. 12 kg, that we already did this question, that is 800 to 1200, right? ORS amount required for first hour in 1 year. 1 year we did this question also, that is 600 to 800. Rehydration in child with diarrhea, thrust, presenteer are absent in, that is are absent in moderate, right? For controlling an outbreak of cholera, all should be done except mass prophylaxis should not be done. Drug of choice, yes, for cholera, that is tetracycline and fluorojolidine. Bacterial conjunctivitis, erythromycin ointment. Diphtheria, erythromycin. Malaria, doxycycline. Meningococcal meningitis, rifampicin. Plaque, tetracycline. Typhoid, none of the above, right? Antibiotic treatment of choice for treating cholera in adult is a single dose of, okay, here we can give what? Doxycycline, right? Okay, in adult we can give doxycycline, in children azithromycin. Pregnancy also we can give azithromycin. For chemoprophylaxis, that is tetracycline. So here every question is asked, right? For adult we can give what? Doxycycline, right? For children, azithromycin, pregnancy azithromycin, and chemoprophylaxis tetracycline is given. Which of the following gives strong evidence of typhoid fever carrier status? Okay, isolation of PI antigen, we know it, right? Okay, which is true of typhoid? Male carrier though less but more dangerous, right? Chronic case of typhoid containing origin gallbladder and biliary tract, right? Typhoid Mary, who gave rise to 1300 cases. PI antibody are seen in 80% of chronic cases. The most successful approach for treatment is this. Okay, persistent of diarrhea in infant, that is 14 days, right? In salmonellosis disease, the isolation is done stool culture negative for 3 times, right? Isolation done until there is stool culture negative for 3 times. Okay, the isolation of patient with salmonellosis is, okay, till 3 stool are negative. Hepatitis, which of the following is not true? Transmitted through sexual route. Okay, all the questions from hepatitis we already did. The questions are similar, right? Similar. Now the topic from which we will be covering MCQ is from zoonotic disease, right? Zoonotic disease. Now here we'll be talking about what? We'll be talking about rabies, we'll be talking about Japanese encephalitis, we'll be talking about chikungunya, we'll be talking about leptospirosis, right? Similarly we'll be talking about what? Plague, right? These things. So without delay, let's begin with rabies. Now here in rabies, the first question is the pre-exposure prophylaxis for rabies is given on, it is given on day 03, right? Day 0, 3, 7 and 28, right? On these days only it is given. class 2 exposure of an animal bite include the following. Now it includes what? It includes scratches without oozing of blood, right? Scratches without oozing of blood. Now for treatment of case of class 3 dog bite, all of the following are correct except. Now for treatment of class 3, right, all of the above are what? Correct except. Now here immediately stitching when under antibiotic coverage is not done, right? What we do, we give immunoglobulin for passive immunity, give ARV, right? And then what we do, immediately wash wound with soap and water, but immediately we don't stitch wound. So this is the answer. Which of the following statement about rabies is true? Now correct statement about rabies is, right, which is the following is correct statement? The correct statement is what? Intracytoplasmic basophilic inclusion bodies are seen in brain cell. These are what are these? These are what? These are the peculiar finding, that is Negri bodies, pathogenomic of rabies, right? Okay, which of the following should be injected in and around the wound in class 3 rabies bite? Now here what should be of the following should be injected in and around the wound in class 3 rabies bite? Now here it should be what? It should be anti-rabies serum. Anti-rabies serum should be done. Now rabies is not found in, it is not found in what? It is, okay, now rabies is not found where? In Lakshadweep Island, right? In Lakshadweep Islands. Bite of which of the following animal do not result in human rabies? Bite of which of the following animal do not result in human rabies? That is bite of what? Bite of mouse, right? Characteristic feature of rabies include all of the following except. Okay, characteristics feature include all of the following except. That is what? Our hematogenous spread to brain, right? Hematogenous spread to brain will not occur. Schedule of intradermal rabies vaccine is, what is it? Now here it is in 80, right, in 8th day, right? Then okay, sorry, it is 804011, right? 804011. Okay, now moving to our next question. The next question is number of rabies vaccine HDCV vaccine required for pre exposure is, which is 0, 7 and what? 28 days, right? Okay, that is what? 0, 7 and how many days? Okay, if we remember, what was that? It was what? Our on 0, okay, it is here, it is 0, 7 and on 28 days, right? Okay, now the next question that we are in is, now we are here on what? Which virus is used to produce rabies vaccine? Okay, and the virus, it is what? It is fixed produce rabies vaccine, that is fixed virus. Which virus is used to produce rabies vaccine? That is fixed virus is used, right? Okay, immediate host of rabies is, now immediate host is what? It is dog, right? Dog is the immediate host. Rabies free country is what? The rabies free country is Australia. Rabies free country is the same question. Okay, the option are different. So here what we have got? We have got Britain, right? Britain is also rabies free. Similarly, all these rabies vaccine are commercially available except, right? Killed sheep, yes. Human diploid, it is. Vero continuous cell, it is. Recombinant glycoprotein virus vaccine is not available. Patient present with dog bite in palm finger and oozing of blood on neck region belong to which of the class of exposure? Dog bite in palm fingers and oozing of blood on neck region. So here what you can say here is this belongs to class what? Class 3, right? Oozing of blood is there. All are true about rabies except it is not DNA virus. It is what? It is what? RNA virus, right? The nervous tissue rabies vaccines are usually manufactured from, these are manufactured from sheep, right? These are manufactured from sheep. Okay, the rabies do not occur in which of the following part of okay, yes, rabies do not occur in which of the part of India? That is Andaman and Nicobar Island. Okay, which of the in which of the case of dog bite the biting animal should be observed for at least about, in case of the dog bite it should be observed at about how many days? For about 10 days. In India, rabies free zone is, what is it? It is Lakshadweep, right? Yellow fever. Now getting into yellow fever. Now the incubation period of yellow fever is, what is it? It is 3 to 6 days, right? All are feature of yellow fever except, now here fatality rate is not greater than 90%. It is not the feature of yellow fever. Subclinical case are, right, one attack give lifelong immunity. It is hepatic and renal involvement in severe case. Yes, it is, right? Okay, according to international health regulation, there is no risk of spread of yellow fever if Aedes aegypti index remain below, right? If Aedes aegypti index remain below 1%, then there is what? There is no what? Risk of spread of yellow fever. Next question, all are true for yellow fever except, right? Now here all are true except what? the incubation period is 16 to 46. It is not the right statement. Other causative agent is flavivirus, febricus, right? Case fatality is up to 80%, right? Validation and vaccination center begins after 10 days and lasts till 10 years, right? Validation vaccination certificate begin after 10 days and last for 10 years. These all the point are MCQ. Vaccine of yellow fever is, what is it? It is what, 17D. True about yellow fever is okay, now here true about yellow fever is transmitted by Aedes. That's right, yellow fever, the Aedes, right? Another is what, incidence are increased by humidity, right? Humidity, and it is flavivirus. Okay, these are right statement. Yellow fever certificate of vaccination is valid for, I've already said, 10 years, right? Okay, moving further, yellow fever vaccination start protection after how many days of injection? That is after 10 days, right? 10 days and remain for what, how many years? 10 years, right? Okay, now moving into next question. Our next question, which is not true about yellow fever, exotic. Okay, it is exotic, incubation period of 2 to 6 days. Yes. Validity of vaccination for only 6 years. No, it is 10 years, right? Live attenuated is 17D strain vaccine. That's right, right? To prevent yellow fever, Aedes aegypti index should be less than, how much it should be? It should be less than how much? It should be less than 1%, right? It should be less than 1%. Yellow fever certificate of vaccination is valid for 10 years starting from 10 day after vaccination, right? Okay, 10 day after vaccination. The yellow fever vaccine starts protection after how many days of injection? That is 10 day. The same question, right? 10 day. Yellow fever vaccine is valid till 10 years. Which act was passed in 20th century, right? In 20th century, Birth and Death Registration Act was passed. Birth and Death Registration Act. Which of the following is yellow fever reference center? The yellow fever reference center is Kasauli, right? In Kasauli, Central Institute in Kasauli. Okay, talking about Japanese encephalitis, all of the following are true about Japanese encephalitis except, okay, now here case fatality is over 90%. It is not true, right? It is not true. So the case fatality rate here is 20 to 40% only, right? 20 to 40% only. True statement regarding Japanese encephalitis is, what is the true statement? The true statement is epidemic is declared if there are 2 to 3 cases in a village. If only 2 to 3 cases in a village, then it is called declared as epidemic, right? Okay, JE virus life cycle in nature runs between, now it runs between what? It runs between pigs to mosquito, right? It runs between pigs to mosquito. Amplifier of Japanese encephalitis is, okay, what is the amplifier? That is pig. Pig is the amplifier, right? Japanese encephalitis is transmitted by, it is transmitted by what? It is transmitted by our Culex mosquito. Not true about Japanese encephalitis is man-to-man transmission is not seen. So it is the right answer. Vector is Culex tritionichroanus, okay, rice field and horse shows symptoms. Yes, vector of Japanese encephalitis is, okay, we know the vector is what? The vector is our Culex, right? The three major determinant to eradication of Japanese encephalitis is, what is the major determinant to eradication of Japanese encephalitis? That is our large number of apparent infection, right? Large number of apparent infection. Okay, now talking about KFD, right? Now, okay, now talking about KFD. Now, which of these is not useful for prevention of KFD, right? Deforestation is not useful, right? Now, KFD in control measure of KFD are control of ticks, right? Restriction of cattle movement, vaccination killed KFD vaccine can be given, personal protection through repellent can be given. Okay, vector for KFD, what is the vector? Okay, now vector is Haemaphysalis, right? Haemaphysalis is the vector of KFD, and Cancer forest disease is transmitted by, now here cancer forest disease, it is what? It is what? It is heart tick, right? It is transmitted by heart tick. Cancer forest disease is transmitted by the same question, right? Ticks, right? It is transmitted by ticks. KFD in India is transmitted by the same question, ticks. Now talking about plague, all are true about plague except, right? Now here all are true except the domestic rat, Rattus has been incriminated as a main reservoir, right? So it is not the right statement, and other all are, like both sexes of rat flea bite to transmit the disease. Yes, IP4 bubonic plague is 1 to 3 days incubation period. Infant under 6 months are not given the kill vaccine. So these are all the right statement, but here domestic rat, Rattus has been incriminated as a main reservoir is not the right statement. The most effective method to break transmission chain in plague is, so what we can do? What we can do is we can control the fleas, right? Fleas, control of fleas is the main treatment. All the following statement about plague is wrong except, right? That means which is the right statement. So bubonic is the most common variety is the right statement, right? The plague epidemic in Surat 1995 has occurred after the silence period of how much? It is talking about India, that is 28 years. Maximum explosiveness of plague is determined by maximum explosiveness. It is determined by what? It is determined by Mcqs index, right? Mcqs index. Severity of spreading plague is detected by the same thing, Mcqs index, right? Review question, Mcqs index is what? Now it is average number of Mcqs per rat, right? Per rat. Average number of Mcqs per rat, right? Okay, the next question, the highest infections clinical form of plague is the highly infectious clinical form of plague is, now what is it? It is pneumonic plague, right? Pneumonic plague. Dose of equine anti-rabies immunoglobulin ERIG is, now what is the dose? The dose is 40 what international unit per kg body weight, right? Dose of anti-rabies immunoglobulin. Plague is transmitted by, we already know what? The rat flea, right? Rat flea, transmitted by rat flea. Okay, now this was what? This was about our the question from those topic. Now talking about other things, what are true about rabies except these are not DNA virus, right? These are RNA virus. Causative agent is Lassa virus type 1, bullet shaped. Pathogenic feature of rabies is what? Hydrophobia, right? Negri body. Only communicable disease of man, that is always fatal. It is what? This one. Water appears to be most effective natural barrier to rabies. Bite of which of the following animal do not result in human rabies? That is what? That is mouse, right? Okay, all of the rabies vaccines are commercially available except, we have already talked about it, recombinant glycoprotein. Nervous tissue rabies vaccine are usually manufactured from, these are manufactured from sheep, right? Cell culture vaccine more potent and much safer. Rabies vaccine is unique because it is only vaccine that is given after exposure of infection. And intradermal dose, what? Intramuscular dose divided by 5 is the intradermal dose. Rabies vaccine are given intramuscularly in deltoid and must not be given into a buttock, right? And in 1883, Louis Pasteur first developed anti-rabies vaccine. Characteristic feature of rabies include all except, can manifest as ascending paralysis, yes. Hematogenous spread to brain, no, this is not the right statement, right? Chief and dreaded complication of vaccine is neuroparalysis. Multi-site intradermal regime lower the cost of vaccination by around 70%. In the case of dog bite, the biting animal should be observed for at least about 10 days. The pre-exposure prophylaxis for rabies is given in how much? 0, 7 and 28 days, right? Schedule for intradermal rabies is 80411, right? Okay. Now class 2 exposure of animal bite include the following. Now it is what? Scratch with oozing of what? Scratch without oozing the blood, right? The patient present with dog bite, fingers oozing blood on the, okay, oozing of the blood is there, so type 3. Class 3, which of the following should be injected around the wound in type 3? Okay, there should be ARS, right? Anti-rabies serum. ARS, anti-rabies serum. For the treatment of case of class 3 dogs, of the following are correct except, right? Immediate stitches should not be done, right? Should not be given. So okay, now these are what type of contacts, right? First, touching or feeding the animal, right? Lick on the intact surface. Second, nibbing of uncovered skin, right? Minor scratches, right? Without bleeding. Here bleeding is not seen, but here bleeding are seen, right? Breaking of licks on broken skin, right? Now here, okay, now what can be done here? No, nothing is done, right? Nothing is done in the case category 1. In 2, wound management and anti-rabies vaccine can be given, but here anti-rabies vaccine is given and wound management is done. Along with it, rabies immunoglobulin should be given. Okay, which of the following statement about rabies is true, right? Intracytoplasmic basophilic inclusion body are seen in brain, that is Negri bodies. Yellow fever, all are true for yellow fever except incubation period is 16 to 46, right? Causative organ is Flavivorm febricus. Incubation period of yellow fever is 3 to 6 days. So the above question 16 to 46 was wrong, right? Okay. All are the feature of yellow fever except, so fatality rate is 90. No, it is not. It is how much? It is 80, right? Live attenuated is our 17D. We did this question. According to international health regulation, there are no risks of spread of yellow fever if the Aedes goes what? Below 1%. False about yellow fever is, right? It is found in what? Asia, right? It is found in Asia. Yellow fever is not found in Asia, right? It is not found in Asia. Okay. Now yellow fever certificate is given for 10, right? Starting from 10 days to 10 years, right? Okay, but according to new guidelines, yellow fever vaccination certificate is valid to 10 days till the lifelong. Okay, Japanese encephalitis is transmitted by culex, right? Now, not true about Japanese encephalitis is man-to-man transmission is not possible in the case of Japanese encephalitis. Similarly, the next question, Japanese encephalitis virus lifelong in nature runs between what? It runs between pig and mosquito, right? Pig and mosquito. Next question is, all are true about Japanese encephalitis except case fatality is over 90%. No, it is how much? 20 to 40. So, this is what? This is the answer, right? Major determinant to eradication of encephalitis is, what is the major determinant? Large number of apparent infection, right? Okay. The true statement regarding Japanese encephalitis is, epidemic is declared if if 2 to 3 cases are seen in a village, right? And then it is called. Amplifier of Japanese encephalitis, there are pigs, right? Now talking about chikungunya, causative agent is group A chikungunya RNA virus, right? Okay, now here no death has been admitted to chikungunya. Drugs like aspirin, steroids should be avoided. No vaccine yet been developed. It causes severe pain and severe joint pain. There are no cure for disease. Treatment is focused on relieving the symptoms. Talking about leptospirosis, causative organism is Leptospira corkscrew shaped bacteria. Leptospira shed in urine, can survive for weeks in soil and water. Penicillin is drug of choice. Rat and rodent are most important reservoir. More severe in tropic region. Plaques synonyms are Black Death or Mahamari, the Great Death, right? Case fatality is 30 to 60%. And Yersinia pestis, right? Bipolar staining with Weisson stain. A partially blocked flea is more dangerous than totally blocked flea because it lives longer, right? This is the important MCQ. Partially blocked flea is more dangerous than totally blocked. Maximum explosiveness of plague is determined by, yes, Cheopsis index, right? Cheopsis index. Severity of spreading plague is detected by the same thing, Cheopsis index, right? Cheopsis index greater than 1 indicator of possible explosiveness of if outbreak occur. Drug of choice for treatment is streptomycin. Drug of choice for chemoprophylaxis is tetracycline, right? Okay. Chemoprophylaxis it is tetracycline, and for our treatment is streptomycin. Commonest and most efficient vector for plague is rat plague. All of the following statement about plague is wrong except, right? Now here our bubonic is the most common variety, that is the right statement, right? The highly infectious form of plague is highly infectious, that is pneumonic plague, right? Talking about the most effective method to break transmission chain in plague is, it is control of fleas, right? Control of fleas. We can do controlling of fleas. Okay. All are true about plague except now domestic ratitis has been incriminated as a major reservoir. We did this question, right? WHO recommend plague vaccination should only be preventive and not for control human plague. The plague epidemic in Surat has been occurred after silence period of how many? 28 years. We did this question, right? So this was all about question from what? The question from zoonotic disease. Now we are going to cover MCQ from surface infection. Now in surface infection we'll be talking in detail about leprosy and HIV/AIDS, and we'll be talking about some of the miscellaneous sexually transmitted infections. So without delay, let's move into the discussion. So the first question is, the first question from leprosy. The first question from leprosy is false about leprosy is. Now here the false statement is, what is the false statement? The false statement is it has been eliminated from India. Yes, it has already been. It is transmitted through breast milk. Yes. Leprosy test is not diagnostic test. Yes, it is not diagnostic test. It is what? It is prognostic test, right? And MDT is contraindicated during pregnancy. No, it is not contraindicated during pregnancy. So this is the answer. Leprosy can be transmitted through all except, right? It can be transmitted through all. Yes, it can be transmitted through all, right? So none of the answer are right, right? It is transmitted through every medium, right? Now moving to our next question. Leprosy is considered public health problem if prevalence of leprosy is more than 1 per 10,000, right? Prevalence is more than 1 per 10,000. Okay, moving to next question. In the management of leprosy, leprosy test is most useful for what? Prognosis. I have already said, right? Which of the following statement about leprosy test is not true? Now it is, which of the following statement about leprosy test is not true? It is diagnostic test. No, it is not diagnostic test. It is prognostic test, right? Okay, Moving to our next question. The next question is, the patient with leprosy had slightly erythematous anesthetic plaque on trunk and upper limb. He was treated with postbacillary multi drug therapy, right, for 6 months. At the end of 6 months, he had presented persistent erythema and induration in plaque. The next step of action recommended by World Health Organization in such patient is, now here what we need to do is we need to stop the anti-leprosy treatment here, right? Stop the anti-leprosy drug, right? Okay, all of the following are mode of transmission of leprosy except, so here also everything mentioned here is the mode of transmission, so none are the answer. In management of leprosy, lepromin test is not used for diagnosis. All of the following statement about leprosy are true except, okay, all of the following statement about leprosy are true except, right, a defaulter is defined as person who has not taken treatment for 6 months is not the true statement. Overall, multibacillary leprosy is diagnosed when there are more than 5 skin patches. New case detection rate is an indicator for incidence of leprosy. That's also right. A target for elimination of leprosy is to reduce the prevalence to less than 1 per 10,000 population. That's also right. So option number C is not right statement. All of the following are tests used to detect cell-mediated immunity in leprosy except, right? All of the following are tests used to detect cell-mediated immunity in leprosy except. So here, which FLA-ABS test is not what? It is not used to detect cell-mediated immunity. Overall, lepromin, lymphocyte transformation test, leukocyte migration inhibition test, these all are used, right? Erythema nodosum leprosum, right, occurs. Now this erythema nodosum leprosum occurs in those with lepromatous leprosy, in those with lepromatous leprosy. True about leprosy in India is or are, now the true statement is leprosy is decreased in Orissa, right, Odisha. True about leprosy in India, what is true about leprosy? Prevalence decrease in past decade, right, and it is highly communicable, right? Okay. True about epidemiology of leprosy, what is the true statement? It is insect can transmit the disease, right? Insect can transmit the disease, it is the true statement. Which of the following about lepromin test is not true? It is diagnostic, it is not diagnostic test, right? Yes. Okay, the next question is, elimination of leprosy is defined as a prevalence when it is less than 1 per 10,000, right? 1 per 10,000. Leprosy is not yet eradicated because what? Long incubation period? Yes, long incubation period. Okay. As per WHO, leprosy is public health problem if prevalence is more than, as per WHO, leprosy is public health problem if prevalence is more than how much? Prevalence is more than 0.01%, right? 0.01%. Prevalence of leprosy in India per 10,000 is, right? It is how much? It is 0.69, right? 0.69 is prevalence of leprosy in India per 10,000 cases. Generation of time for leprosy bacillus is, how much is the generation time? The generation time is 12 to 15, right? 12 to 15. Erythema nodosum is seen in treatment of which type of leprosy? Erythema nodosum. Erythema nodosum is seen in what? Lepromatous leprosy. Lepromatous leprosy, right? Multibacillary is a spectra of disease seen in. It is seen in leprosy. Yes, we know, right? Leprosy. Ridley-Joplin leprosy classification is a type of what? It is a type of what? It is a type of our clinical bacteriological, immunological and histological classification, right? Clinical, bacteriological, immunological, right? Then what? Histological, right? Histological. So the option number C is the right answer. Clinical, bacteriological, immunological, histological classification, right? Lepromin test is used for all of the following except not for diagnosis, right? Not for diagnosis. So the next question is true regarding leprosy. What is true statement regarding leprosy? That is clofazimine included in treatment regime, right? Clofazimine included in treatment regime. Another is drain zone in lepromatous spectra, right? Drain zone in lepromatous spectra. Similarly, MBL recommended treatment for 12 month duration, right? MBL recommended treatment for 12 month duration. Now talking about other question, Mitsuda reaction is read. Now it is read at how much? 21st day, right? Leprosy commonly spread by, how is leprosy commonly spreaded? It is spreaded by droplets, right? Droplets. In multibacillary leprosy, the following are examination of adequate treatment should be done yearly for. Multibacillary, how much it is done? It is done for 5 years, right? As per WHO, leprosy is a public health problem if prevalence is how much? If prevalence is how much, it is 0.01, right? 0.01. Most common knob involved in leprosy is ulnar knob, right? Treatment of leprosy according to WHO is done by all drug except it is done by all drug like dapsone, rifampicin, clofazimine. It is not done by ciprofloxacin. That's right answer. Which of the following is true statement about leprosy? 2 plus indicates 2 different sites. Is it true? Now here, okay, no, it is not. Paucibacillary leprosy bacterial index is less than 2, right? In paucibacillary, the bacterial index is less than 2. Other all are what? The wrong statement. Paucibacillary leprosy, the single drug dapsone is continued for how many time? It is continued for how much? It is continued for 6 months, right? So 180 days. Lepromin test is valuable for, it is valuable for prognosis, right? It is valuable for prognosis. In leprosy, +1 bacterial index indicates how much? Okay, it indicates how much? It indicates our okay, the +1, it indicates 1 or less than 1 bacilli in each what? In each high powered field, right? 1 or less than 1 bacilli, right? Okay, moving to our next question. Live attenuated yellow fever vaccine is, it is 17D, right? It is 17D. Only objective way to monitor the benefit of treatment of leprosy is, we have already said, what is it? Okay, it is bacteriological index, right? Bacteriological index is the objective way of monitoring the benefit of treatment of leprosy. Lepromin test is used for all of the following except it is not used for diagnosis, right? Many times it has come that it is not used for diagnosis. Lepromin, right? Prognosis only. Which of the following type of leprosy by Indian classification of leprosy is not included in Madrid classification? So it is what? It is pure neuritic type, right? Pure neuritic type is not included there. Multibacillar leprosy, bacterial index is more than how much? It is more than 2. That's it, right? Which of the following measurement indicates whether the leprosy cases are being detected early or not? Which of the following measurement indicates whether leprosy cases are being detected early or not? It is what? It is our prevalence rate of disease, right? Prevalence rate of disease. Duration of MDT to resolve paucibacillary, we have said. In multibacillary, it is how much? It is, right, 5 years. In now here in our paucibacillary, it is how much? It is 6 months, right? It is what? It is 6 months. Okay, now moving toward what? Moving toward the questions from what? Questions from HIV, right? The first question from HIV is, right, the commonest mode of transmission of AIDS in India in descending order, right? In descending order, that is the commonest is what? The commonest is heterosexual, transplacental and homosexual, right? Heterosexual, transplacental and homosexual. This is the order. Moving to our next question. The next question is, in which of the Indian states the maximum number of AIDS cases has been reported till now? That is what? That is Tamil Nadu, right? Now moving to our next question. The next question is, World AIDS Day is on, it is on what? 1st December, right? The first country in Southeast Asia to report AIDS, what was the first country? The first country in Southeast Asia to report AIDS was Thailand. The most common mode of HIV transmission in India is, right, it is what? The most common transmission, that is sexual transmission. The highest number of AIDS cases in India have occurred at the age group of, it has occurred at the age group of how much? 30 to 44 years. 30 to 44 years. WHO stage 4 HIV include all except it includes all except what? Oral thrust. Oral thrust is not included. Toxoplasmosis, pneumocystis, carini, right? HIV wasting syndrome, all these are seen. Major sign for AIDS case definition according to WHO. Major sign for AIDS case definition according to WHO. What is the major sign? The major sign is obviously our what? A is also right, generalized lymphadenopathy, right? B is also right, prolonged fever for more than 1 month. And then what we have got is, we have D, that is chronic diarrhea for more than 1 month and weight loss greater than 10 kg, right? These are all right. Regarding epidemiology of HIV true is, regarding epidemiology, right, of HIV is true is, that is what? Seminal secretion are highly infectious than vaginal secretion, that's right, right? Another thing is that infectious is in window period, that is also right. And Southern Africa have 72% of total global burden, that is also right, right? Similarly, the children are rarely affected, that's also right. Which of the following is used to prevent transmission of HIV from infected pregnant mother to newborn child? which of the following is used? And here nevirapine, right? Nevirapine is used, right? Is used to prevent to newborn, right? To prevent to newborn. Okay, now next question is risks of mother to child HIV transmission in pregnant women at the time of delivery, after delivery, and non-breastfeeding women is, what is it? It is 15 to 30%. 15 to 30% is the chance. HIV post-exposure prophylaxis should be started within 72 hours, right? Within 3 days. Okay, now going to our next question. The criteria included in AIDS surveillance definition includes, now what does it include? Extrapulmonary tuberculosis, that's right. Cryptococcus, that is also right. Candidiasis, that's also right, right? And we have Kaposi sarcoma, right? Criteria included in AIDS surveillance definition includes what? Extrapulmonary tuberculosis, Cryptococcus, Candidiasis, Kaposi sarcoma. HIV transmission mother to child can be stopped by all except HIV transmission mother to child can be stopped by all except, right? It can be stopped by all except what? It cannot be stopped by vitamin A supplementation, right? Cesarean section, yes, it can be stopped. Stopping breastfeeding, yes. Gituvirin to mother, antenatal and newborn after delivery, that also can be done, but vitamin A supplementation cannot prevent, right? Most common subtype of HIV in India, that is HIV-C, right? HIV sentinel surveillance is used to identify or calculate. What is it used to identify and calculate? High risk population, that's right, right? Okay, prevalence of HIV, trend finding among population, that's right, all of the above. Antiviral prophylaxis decrease the chance of transmission of HIV to fetus during pregnancy, of HIV to fetus during the pregnancy by, okay, it will prevent by how much time? 65%, right? HIV virus was discovered in the year, it was discovered in the year 1983. In 1983 it was discovered. In HIV infected child, which vaccines should not be given? In HIV infected child, which vaccine should not be given? The vaccine that should not be given is OPV, right? Right, oral polio vaccine should not be given, right? True about epidemiology of AIDS, all are true except, now here maternofetal transmission is the most common mode of transmission. It is what? It is not true, right? Maternofetal transmission is the most common mode. It is not true. So here in India it is mainly caused by HIV-1. Yes, IV drug user abuse increase the risk, that's right. Medical personnel are at higher risk of getting infection with HIV, that's also right. First cause of AIDS was reported in, the first AIDS case of AIDS was reported in what? In 1981, right? It was reported in 1981. All of the following statement are true for viral genome in HIV except, right? All of the following are true for viral genome in HIV except they contains DNA dependent DNA polymerase activities. No, they don't contain so, right? From epidemiological point of view of AIDS, which of the following state in India is put in group first, right? And that is what? That is in group first, right? Okay, in group first, which state is kept in group first, right? It was the older data. It is question of India, and Nagaland is the right answer. Detailed plan titled 3/5 implemented by WHO in 2003 for AIDS means 3/5. What does this 3/5 means, right? Providing treatment to 3 million sufferers by 2005, right? It is also the world question. The window period of HIV infection is, that is 3 to 12 weeks, right? 3 to 12 weeks. The most common mode of HIV transmission from mother to child is in which time period? It occurs perinatally, right? Perinatally, right? Perinatally. Now the other questions from other, lymphogranuloma venereum is caused by, now lymphogranuloma is caused by Chlamydia trachomatis, right? Chlamydia trachomatis. All of the following are causative agent of sexually transmitted infection except, right? Now here Echinococcus is not transmitted sexually, it is not STD. Which of the following is not STD agent? Now here Chlamydia, right? Chlamydia psittaci is not what? STD agent, right? Match the treponeural disease and their causative agent. Okay, now what? Now we'll go toward the questions mentioned in our book, that is STD, lymphogranuloma venereum is caused by, I've already said. What is it? It is Chlamydia trachomatis, right? Chlamydia trachomatis. Of the following causative agent of sexually transmitted infection except Echinococcus is not sexually transmitted infection, right? Incubation period of cancroides, what is the incubation period? That is less than 7 days. Less than 7 days. Incubation period of syphilis is 9 to 90 days, right? 9 to 90 days. Okay, now here talking about syphilis, it is 9 to 90 days. LGV, right? it is 3 to 12 days. Donovanosis, that is 3 to 21 days. Cancroid is 3 to 5 days. Gonorrhea, it is 1 to 5 days. Okay, talking about LCD, right? Now here L, right, LGV, cancroid, LCD, right, and then G, gonorrhea. These lie somewhere in the range of 3, right, in the range of 3. Okay, and HIV is 10 year. The syndromic management of urethral discharge include treatment of, right, it include treatment of Neisseria, gonorrhea and herpes genital, right. Syndromic management of urethral discharge include Neisseria, gonorrhea and herpes genitalia, right. Okay, now case detection in STD is done by, it is done by notification, right. STD is done by notification, right. The method of case detection in control of sexually transmitted disease in which person names and the persons moving in same socio-sexual environment is cluster testing, right, into same sexual environment, that is cluster testing. Contact tracing is sexual partner of diagnosed patient are identified, localized, located, investigated and treated, right. Cluster testing is screening of all person of either sex who move in same socio-sexual environment of the patient. A sexually active long distance truck driver's wife came with vaginal discharge. Under syndromic approach, which drugs should be given? Now here metronidazole, azithromycin and fluconazole are given, right. Now talking about AIDS, right, we did these questions, right, the similar questions are here. Okay, now here the nevirapine, right, to prevent into newborns, right. Post exposure prophylaxis should be started within how many? 3 days. This is also the question. The most common mode of transmission from mother to child is what? Perinatal. We did this. Risk of mother to child, it is 15 to 30%. We did this. Window period 3 to 12 week. This is also the question. HIV, which should not be given. OPB should not be given. This is also repeated. Leprosy, right, insect can transmit. We did this question. Droplet will cause maximum. We did this question. Prevalence rate of the disease is what? Detected early or not is done by prevalence, 1 per 10,000. It is done already, right. Multibase. Okay, now here defaulter. Now here defaulter is defined as a person. We did this question also. Okay, cell mediated immunity is not found by FLAABS. We did this also. Treatment for multibacillary for 5 years. We did this. And here 6 months. We did this for paucibacillary leprosy. Yes, multi-drug, that is to paucibacillary, it is 6 months. We did this. Only subjective way of monitoring the benefit treatment of leprosy is bacteriological index. This is also repeated question. Paucibacillary lactobacillary index less than 2, right. That is also done, right. 1 or less than 1, it is also repeated question. Bacterial index is more than 2. We did this. So here every question is repeated one, right. Every question is repeated one. Okay, the Ridley-Joplin leprosy, right. Clinical, bacteriological, immunological, histological, right. Okay, this is also repeated question. So every question are repeated. So this is all about the question from surface infection. Now we are going to solve MCQ from emerging and re-emerging diseases. Along with it, we will be talking about what? We will be talking about MCQs from hospital acquired infection and some of the disease of what? Neonatal and childhood illnesses, right. Okay, now without delay, let's move into the MCQs from emerging and re-emerging diseases. Now before getting into the MCQs, I would like to make some of the point about emerging and re-emerging diseases. Now okay, now what are emerging diseases, right. Emerging diseases are, okay, these are what? These are new disease, new problem or new threats, right. Are those diseases whose incidence has increased during last 20 years, right. Whose incidence has increased in last 20 years, right. Similarly, it is talking about what? Past 20 years. It's talking about past. Now in future, what? There is threatened to increase in future, right. Increase, right, or threatened to increase in future, right. It is talking about past, right. In past, what? It has increased in last 20 years, and in future there is threat of increasing more. And talking about present, right, it is newly appearing disease, right. Newly appearing disease, right. Now another thing is that these are also the disease which are spreading to new geographical area, like cholera in South Africa, like new geographical area, right, like cholera in South Africa, yellow fever in Kenya, and so on. So here what are the emerging diseases? These are new threat, right, whose incidence has been increasing, which has been increasing in past 20 years. Those threatened to increase, whose incidence is threatened to increase in for the future also, right, who are newly appearing disease, right, and who are increasing in new geographical areas. Those are what emerging diseases. Now here the first question is, emerging diseases are all except those whose incidence has increased in last 20 years. Yes, those threaten to increase in future. That's right. Those who are previously easily controlled but are reappearing. No, we did not talk about this, right? We did not talk about this. And those spreading to new geographical area, that is also right. So here option number C is not correct. Other all are what the correct statement about emerging diseases. Now here talking about, right, okay, these are the points we have already said. Incident had increased in last 20 years, threatened to increase in future, newly appearing disease, right, spreading in new geographical area. These are what emerging diseases, right? Okay, now I would like to mention about what disease, the new emerging diseases, right? Emerging diseases are further classified into what disease due to right disease due to what disease due to new variant, right, new variant, right, and disease due to what, due to new agent, right, new agent. Similarly disease due to what due to non-communicable disease, right, disease resulting due to non-communicable disease. So here new variant, right, new agent, non-communicable disease. So VAN, right, new due to new variant, new agent, non-communicable disease. These are what, these are these are the type of what examples of emerging diseases. Now here in new variant, now what we can say is new variant consists of what, the variant of E. coli, right. Similarly we can talk about bird flu, right, which is our avian flu H5N1, right. Similarly swine flu, right, we can talk about swine flu, that is H1N1, right, H1N1. Similarly what we have, the new variant of cholera. These are what, these are new variant disease. And talking about new agent, right, okay, talking about new agent, right, new agent, these are what, these are our what okay, we can remember by RACE, right. From R what we have is, from R we have what, we have rotavirus, right, rotavirus, right, rotavirus 73, right. And from R we can remember respiratory condition like SARS-CoV, right, SARS-CoV. Okay, new agent. From A what we can say is, from A we have got what, we have got AIDS, right, AIDS, right, AIDS is also emerging disease. From A we have got anything? No. From C we have got what, Campylobacter jejuni and Cryptosporidium, Campylobacter jejuni and Cryptosporidium. And from E we have got Ebola hemorrhagic fever, So okay, we talked about what, we talked about our this due to new agent, that RACE. From R we have got what, respiratory condition SARS. From R we have got what, from R, right, from R we got what, rotavirus, right. From A we have got AIDS, RAC. From Campylobacter and Campylobacter and Cryptosporidium, right. From C, okay, we got that thing. And then what, hepatitis C also, right. From C we can add hepatitis C also. From E we have got hepatitis E, right. From E we have got hepatitis E and Ebola virus, right, Ebola hemorrhagic fever, right, Ebola hemorrhagic fever, RAC, we can remember like that. And talking about non-communicable disease, we can say it is what, it is HCL. From H what we have got, from H we have got hepatitis C, right. Hepatitis C is here, that will cause liver cancer, right, liver cancer. And from C we have got chlamydia. From L we have got leukemia and lymphoma, right, leukemia and lymphoma. So emerging disease, we know the example of emerging disease due to what, new agent, right, due to new agent, due to new what, new variant, and then due to what, non-communicable diseases, right. From new agent also we remembered with mnemonics RACE. From R what we have, from R rotavirus. From R we have got SARS-CoV-2. From A we have got what, from A we got AIDS. From C Cryptococcus Cryptosporidium and our what, Campylobacter jejuni, right. From E Ebola hepatitis E, right. From new variant we talked about bird flu, swine flu, right. We talked about bird flu, swine flu, and what other condition we talked about, the new variant of cholera, right, cholera, E. coli. From non-communicable disease we talked about what, that was hepatitis C leading to liver cancer, liver carcinoma, right, cancer carcinoma, HC. From C we got what, C chlamydia, and from L lymphoma and leukemia. So these are the emerging diseases, right. Okay, now moving into the other thing, right. Okay, there are re-emerging diseases also. Re-emerging diseases are like Mycobacterium tuberculosis, right, Mycobacterium tuberculosis, right. Similarly, we have got what? Dysentery, right? Dysentery, right? Malaria. These are re-emerging diseases. Now let's move into what okay, there are other questions also, right? Talking about other question. Okay, let's move into what? Hospital acquired infection, right? Hospital acquired infection. Now here the infection is nosocomial if it occurred how many hours of the hospital infection, that is 48 hours, right? Nosocomial infection occur more than 48 hours after admission, right? After 48 hours of hospital admission, nosocomial infection may be epidemic or endemic more common, right? Okay, following are the major infection: UTI, surgical site infection, right? And then pneumonia and what? Blood stream infection. These are the major infections. The most common hospital acquired infection is urinary tract infection, right? The most common hospital acquired infection is urinary tract infection. The most common route is through what? Through hand, right? Now moving into another thing, that is, okay, which of the for which is of more than 2 months, right? For the age group of more than 2 months, CBIMNCI consists of tool for management for all of the following except, right? Okay, now here CBIMCI, right, for more than 2 months, right? Here it will look up into diarrhea also, ARI also, right? Malnutrition also, but it will not look up to eye problem, right? It will not look up to eye problem. CBIMCI for 2-month old to 59-month age group comprise of ARI, diarrhea, malaria, HIV, AIDS control program, measles control program, right? These are what the CBIMNCI will look into. So ARI, right? Diarrhea, right? Similarly malaria, HIV, AIDS, measles, right? HIV, AIDS and measles, right? Okay, now here, okay, what are the okay, that is, we talked about what? Okay, we can remember as DAM cube, right? From D we have got diarrhea, right? Diarrhea. From A, what we have got? We have got ARI, acute respiratory infection. From M we have got what? We have got measles, right? We have got malaria, right? We have got malnutrition. So DAM is cube, right? D, diarrhea. A, we have got ARI, acute respiratory infection. From M we have got malaria, measles and malnutrition. Okay, now on the ground level, most crucial representation of CBIMNCIR. Who are these? These are female community health volunteer, right? The IMCI training was designed to teach integrated management of sick infant and children to first level health worker in primary care setting that have no laboratory support, only a limited number of essential drugs. 3 components of IMCIR: case management skill of health personnel to examine children of less than 5 years of age, improvement in health system, improvement in family and community practice. Concept of IMCI came forward in 1990, right? In 1990, it was implemented in Nepal in 2000. After 10 years, IMCI is implemented all, right, in all 75 districts of Nepal, but now it is 77 districts of Nepal. IMCI has developed in achieving Millennium Development Goal 4, right? Millennium Development Goal 4. Okay, the age, right, up to, okay, now it's talking about fasting. Fast breathing is indicated by, okay, the age up to 2 months, what, greater than 60 breath per minute is considered what? Normal, right? Okay, from 2 to 12 months, right, greater than 50 is considered per minute, and from 12 months to what, 5 years, greater than 40 per minute. That means 60, 50 and 40. And talking about age group, that is what, or we can say less than 1 year, right? Okay, we can say up to 2 months, right? 2 to 12 months, less than 1 year, and more than what, 1 year, right? It is what, less than 1 year, and it is more than 1 year, right? And in up to 2 months, that is how much? 60 breath per minute, right? And talking about 2 months to 12 months, that is 50 breaths per minute and 40 breaths per minute. CBIMNCI consists of 2 set of tools. What are these? For young infant up to age 2 months and child is 2 months to 5 years, right? What are the danger sign in child? The danger sign in child are not able to drink or breast feed, right? Vomit everything, convulsion, abnormal, sleepy or difficulty to awaken, right? Not able to drink, whatever he drinks will vomit, right? Convulsion, abnormally sleepy or difficult to awaken. Diagnosis of pneumonia in children based upon respiratory rate is best available method. Diagnosis of pneumonia, right, in children based upon respiratory rate is best available method. The drug of choice for pneumonia under CBIMNCI program is, now what is the drug of choice for pneumonia? under CBI MNCI, it is amoxicillin, right? For pneumonia, it is amoxicillin, right? Amoxicillin. Okay, cotrimoxazole is drug of choice in pneumonia, right? It is the cotrimoxazole is the drug of choice in pneumonia, right? Injectable chloramphenicol is used in severe pneumonia case, right? It is used in severe pneumonia case, chloramphenicol. Okay, severe pneumonia is indicated by presence of any danger sign, right, or chest injury or stridor. Severe pneumonia is indicated by presence of any danger sign. We already said, right, unable to drink, unable to feed, right, vomits for everything that he or she drinks, right, and then convulsion, abnormally sleep, right. Pneumonia is indicated by fast breathing. We already talked about what? Fast breathing, right, in less than 2 months, right, in less than 2 months. How much? 60, right? In less than 1 year, right? That means 2 months to 12 months, that is 50, and more than 1 month, that is how much? That is 40, right? Classification of dehydration. Okay, now okay, no dehydration, some dehydration, and severe dehydration. Okay, from no dehydration, some dehydration, to severe dehydration, what we have is, now we need to what? We need to look, okay, we need to look, feel, right? Okay, look, feel, and what? Touch. Okay, now here in no dehydration, okay, let's not go into detail, right? Here no specific symptom are seen, right? The eyes are not sunken, right? The tears are present, right? Then what? The mouth is wet, right? The mucosa of mouth and tongue are wet. Similarly, what? Similarly, the person feels what? Thirsty, and person, while looking, the person is not so what? He is not so ill looking, right? He is not so toxic. So in some dehydration, right, there will be restlessness, right? Irritability, sunken eyes will be there. Here drink eagerly, right? Thirsty, skin pinch will goes back slowly, but here skin pinch goes back to what? It will go quickly. But talking about here, skin pinch will go very slowly, right? Not able to drink or drink properly, right? Not able to drink or drink properly. The person is not able to drink. There are very sunken eyes, right? And lethargic or unconscious state will be there. General danger sign or clouding of cornea or deepening of extensive mouth ulcer occur in severe complicated measles, right? Now here, this is important. In complicated measles, danger sign or clouding of cornea or deepening and extensive mouth ulcer occur in severe case of measles. Post draining from eye and mouth, right, also occur in measles with eye or mouth complication. Now in measles, another thing that we can see is post draining from eye, right, from eye, from mouth, right, mouth also. It occurred in what? In measles. Visible severe wasting, right, bagging pants, right. Monkey faces occur in marasmus, right. Marasmus, what is this? Succinus, right. Succinus, and quasicar, it is what? Fucanus. So in marasmus, right, in marasmus, visible severe wasting, right, baggy pants, monkey faces are seen. Edema of both feet may signal kwashiorkor, right. Edema, now edema, that is Fucanus. Edema of both feet may signal what? Kwashiorkor. Severe persistent diarrhea indicate diarrhea for more than how much? 14 days. Zinc is supplemented as sulfate, right, acetate or gluconate formulation at a dose of 20 mg of elemental zinc per day for children greater than 6 months for the period of 14 days, right. The zinc supplementation is done as what? Sulfate, right, acetate or gluconate formulation at a dose of how much? 20 mg of elemental zinc per day, right, for children greater than how much? 6 months for the period of 14 days. Integrated management of childhood illness IMCO was taken to prevent morbidity and mortality of all of the following except yes, malaria, malnutrition, otitis media, upper respiratory tract infection leads to otitis media also. So here neonatal tetanus is not the right answer, right. Okay, so these are what? These are the questions from what? The questions from these small topics. Now in detail we'll be talking about vaccine preventable disease in another video. So here the topic that we are going to cover, the MCQs that we are going to cover is from what? Is from our vaccine preventable disease. Now here in vaccine preventable disease, we'll be talking about what? We'll be talking about smallpox, right? We'll be talking about smallpox. We'll be talking about, along with it, we'll be doing questions of measles, right? Similarly, rubella, right? Rubella, diphtheria, whooping cough, right? Okay, we'll be talking the questions from these which are vaccine preventable disease. Now without delay, let's move into the first question, that is from smallpox and chickenpox, right. Okay, the infectivity of chickenpox lasts for. Now before getting into the question, right, okay, I would like to talk about what the infectivity of various diseases, like the first thing is, okay, chickenpox, right. Chickenpox, the infectivity of chickenpox. What is the infectivity of chickenpox or period of communicability, it is 1 to 2 day, right? 1 to 2 day what before and 4 to 5 days after, right? 4 to 5 days after, right, after the appearance of rash, right? Okay, now talking about chickenpox, the 1 to 2 days before and 4 to 5 days after, right, after the appearance of rash. Okay, moving toward another, that is what, that is our measles, right? Measles. Now in measles, what we have this 4 days before and what 2 5 days, what 5 days after appearance of rash, right? 4 days before to 5 days after the appearance of rash, right? 1 to 2 days before and 4 to 5 days after, right? Okay, another is what, diphtheria. In diphtheria, what we have is we have 14 to 28, right? 14 to 28 days from disease onset, onset of disease. Now similarly, the next is polio. Talking about polio is 7 to 10 days, right? 7 to 10 days before and after the onset of disease. So here, okay, now for chickenpox, 1 to 2 days before and 4 to 5 days after. So after, it is similar to chickenpox and measles, they have 4 to 5 days, 5 days after, right? But in talking about what the earlier days before, that is 1 to 2 days in chickenpox, and in measles it is 4 days, right? Okay, and diphtheria, it is 14 to 28 days from the onset of disease, and in polio 7 to 10 days. So these are also these are the infectivity of chickenpox in different diseases. Now the infectivity of chickenpox lasts for how much, right? Till the last swab falls 6 days after the onset of rash, 3 days after the onset of rash, till forever subside. Now here, okay, we said 4 to 5 days, that is 6 days after onset of rash, right? Now also we need to know about what chickenpox. Now what is now talking about chickenpox, right? It is also known as varicella, right? Varicella, right? And causative organism is varicella zoster virus, right? Varicella zoster virus. And here the secondary attack rate is how much? 90% is the secondary attack rate, right? 90%. Incubation period is 14 to 16 days is the incubation period, right? Now here talking about chickenpox and smallpox, the difference between these two is that, right? Now here in chickenpox, what will happen is that dewdrop on rose petal appearance will be there, right? Dewdrop will be appeared, right? Dewdrop, how it will be appeared on rose, right? Rose petal appearance, right? Rose petal appearance, it will be in this type, right? And here in chickenpox, what we have is we have centripetal distribution, right? Centripetal, right? But now here, as I already said, petal, right? Rose petal like appearance, it is centripetal, right? Now, to chicken, what we are doing pitai, right? So centripetal. Now talking about smallpox, right? Smallpox, there is centrifugal, right? Centrifugal, right? Centrifugal, right? And what these are, chickenpox are pleomorphic, but these are non-pleomorphic, right? These are non-pleomorphic. So these are the difference between smallpox and chickenpox rashes, right? Okay, now going further, chickenpox is categorized by all of the following except, right? So pleomorphic stages, yes. Rashes symmetrical, centripetal, dewdrop like, yes. Palms and soles not affected by rash, that is also right. But scab are infected, it is not the right statement, right? Smallpox eradication was successful due to all of the following reasons except subclinical stage did not transmit the disease. A highly effective vaccine was available. Infection provide long immunity. Cross resistance existed with animal pox. So here cross resistance existed with animal pox is not the right statement. But overall subclinical case did not transmit the disease, yes. A highly effective vaccine was available, that is also right. Highly effective vaccine was available, and if infection period provided lifelong immunity, that is also right. Okay, now here talking about okay, next question, that is all of the following are true about varicella virus except, right? Now here, 10 to 30% chance of occurrence is not the right statement, right? Single attack of varicella give lifelong immunity, right? Single attack of this varicella virus gives lifelong immunity. So this is not the right state. Overall, all stages of rash are seen in the same time, right? Secondary attack is 90%, yes. Rashes commonly seen in flexure area, that is also right. Smallpox eradication was successful due to all of the following reasons except, right? Cross resistance existed with animal pox. This is, we did this. WHO declared global eradication of smallpox on, it was declared global eradication on what, 8th May 1980. Secondary attack rate of chickenpox is, it is how much? 90%, right? Chickenpox vaccine is, what is chickenpox vaccine? Chickenpox vaccine is live vaccine, right? Live vaccine. Okay, Now moving to our next question, chickenpox is infected 2 days before and 2 days after. We said 4 to 5 days after, right? And 1 to 3 days. So here 2 days before and 5 days after the rash appearance. Answer number B. Now moving to our next question. The next question is, what is the next question? Okay, the infectivity of chickenpox last up to. Now infectivity of chickenpox will last up to how much? Now it is how much? 6 days after the rash. All are true about chickenpox except, right? All are true except, now here cross-contact live virus is not the right answer. Cross-contact live virus is not the right answer. Centripetal in distribution, yes. Pleomorphic recession, yes. Our rapid progression from macula to facial, that is also right. True about chickenpox, all are true except, right? Now here, right, again the same question, cross-contact live virus is not the right statement. Lesion appeared in crop, yes. Centripetal distribution of rashes, that's right. Rashes show rapid progression from macula to facial, that's right. Now moving toward the topic of measles, right? Okay, we did chickenpox and smallpox, now measles. Which of the following is not true of measles? Now here, now talking about measles, right, which is also known as rubeola, right? What? Rubeola, right? Now here, not infectious in prodromal state is not the right answer, right? Not infectious in prodromal, because in prodromal stage also it is what it is infective, right? It has what? Higher secondary attack rate, that's right. Only one strain causes infection, that's also right. Infection confers lifelong immunity, that is also right. So here is not true about measles. Not infectious in prodromal stage is not answer, right answer. So talking detail about brief about measles, right? Measles, right? Period of communicability is, we have already said, what? 4 days before and what? 5 days after the appearance of rash. Now here talking about rash, okay, now here talking about rash, what we have is, right, it occurs in retroauricular region, retroauricular pattern, right? Auricular origin, right? It is retroauricular in origin. Measles is highly infectious during prodromal period and during eruption, right? Infectious, right? Infectivity is very high during what? Prodromal and what? And during eruption, right? During eruption. So okay, it is the question. We cannot forget, period of communicability decline rapidly after the appearance of rash, right? After appearance of what? Appearance of rash, right? Rash, what? Infectivity will be decreased, right? Similarly, measles has no second attack, lifelong immunity is seen as what? As chickenpox, right? Okay, that is what we need to know about measles for now. So which of the following is not true? Okay, we have already said prodromal stage and during the eruption of what? It is very infectious, that is right. Which of the following is least common complication of measles? Now the least common complication is, right, now here, now talking about, okay, the least common complication is SSPE, right? SSPE, subacute sclerosing panencephalitis, right? SSPE, right? It is also known as Johnson disease or Johnson encephalitis, right? It is rarest complication of measles, right? Rarest complication that will develop at around 7 to 10 years, right? Okay, now talking about the complication of measles, right? Talking about the complication, now what we can get here is measles, right, does lead to several complications. Common complication of measles. The common complication, what are the common complication? The common complication are our diarrhea, right? Diarrhea, pneumonia and other respiratory conditions, right? Similarly, otitis media, right? Otitis media. Most common complication of measles in children is what? Most common in what? Children, right? That these are the common complication. And talking about what? The serious complication, right? Serious complication. I'm talking about serious complication. What we have convulsions, right? Convulsions. Similarly, what we have encephalitis, right? Encephalitis. Similarly, what we have SSPE, right? SSPE. That is what? That is our encephalitis, right? Panencephalitis, right? Panencephalitis. Subacute sclerosing panencephalitis. And here we are saying what? This is not so common. So here this is the question, that it is least common type. Diarrhea, pneumonia, otitis media, these are common, right? Common type, right? Common type of complication. And talking about serious, we have got convulsions, encephalitis, SSPE, right? Okay. Now here, okay, the least common complication of measles is what? We have already said SSPE. Which of the following statement is true about epidemiological determinant of measles? Now, which is true statement? Now here the true statement is secondary attack rate is less than that of rubella, right? Rubella. Secondary attack is less than that of rubella. This is the correct statement, right? Secondary attack rate of measles is how much? 80% of measles, right? Of measles it is 80%. And talking about rubella, right? Rubella it is how much? It is 90%. And I like to mention it, we're talking about rubella, right? Rubeola is what? It is also measles. Rubeola is measles, right? Okay, now the next question is true about measles is all except coptic spot appear as rash disappears, right? No, it is not the right answer. So this is the answer, but it is not the right statement. Overall, it is prevented by both active and passive immunization. That's right. Otitis media and meningitis are most common complications. That's right. TB is exaggerated in post measles. That is also right. So the wrong statement is A number, right? Okay. Now here we have already said, right, measles, right? In measles, what the incubation period is how much? 10 to 14 days. 14 days, right? And here the causative origin of measles is what? It is RNA paramyxovirus, right? RNA paramyxovirus, right? And talking about other thing, the source of infection is, right, these are the cases, right? And period of communicability we already said 4 day before and 5 days after, right? Now here the measles has no second attack, right? It provides lifelong immunity, right? It has no second attack. So once the children are found with once with having measles, they will not have another, okay, another attack of it, right? Okay, now now this coptic spot and rash, they what they occur simultaneously, right? They occur simultaneously. Now it is what? It is the pathogenomic clinical feature of measles, coptic spot, right? Coptic spot is pathogenomic feature, and it is what? It is appearance of spot on buccal mucosa opposite to second molar, right? Second molar, opposite to second molar, there will be what? There will be spots, right? Okay, true, all are true regarding measles vaccine except, right? All are true except, now here these are freeze dried live attenuated vaccine. Yes, single intramuscular dose of 0.5. no, it is not right, right? And the dose is it is not single intramuscular dose of 0.5. okay, moving further, right? It is occasionally associated with TSS. yes, it is occasionally associated with TSS. And contraindicated in pregnancy. yes, it is. So answer number B is right, right? Which of the following is reservoir for measles? Now talking about reservoir, the man is the reservoir, right? Okay, true about the measles is coptic spot appeared in prodromal stage, right? Yes, this is right, right? Coptic spot appear in prodromal stage. And another is fever stop after onset of rash. That is also right statement. Fever stops after onset of rash, right? And vaccine about against measles is given at 9 months, right? At 9 months, that is also right. The measles vaccination campaign between 9 to 14 years age for elimination is that is catch up, right? Catch up is what? For the campaign between 9 to 14 years age for elimination of measles, right? Okay, coptic spot are seen in, now coptic spot are seen in, we have already said, in prodromal state. Most serious complication of measles is, okay, talking about the most serious complication, that is meningoencephalitis, right? Meningoencephalitis is the most serious complication. The most common cause of death due to measles is, what is it? It is secondary bacterial infection, right? It is secondary bacterial infection, right? Not pneumonia, it is secondary bacterial infection. To eradicate measles, the percentage of infant population to be vaccinated is at least how much should be? Okay, here talking about eradication, so it should be how much? 95%, right? 95%. okay, moving to our next question, what we have here is measles vaccine is not given before, it is not given before how much? 9 months of age. To eradicate measles, percent of population to be vaccinated at least, we have already said how much? 95%, right? 95. For measles, incubation period is, what is the incubation period? We have already said for measles the incubation period is what? Sorry, the incubation period is 10 days. Yeah, infectious is 4 days before the rash. Yes, and 5 days after. Coptic spot are seen. So all are true, right? The measles coptic spot is seen in prodromal state. We already said it. Most common cause of post-measles death is what? We have already said, right? What was it? Secondary infection, but here it is not there. So the most common cause of post-measles death is diarrhea. In measles, the infective period is 4 days before and 5 days after the appearance of rash, right? 4 days before and 5 days after. The incubation period of measles is how much? 10 days. We are sure about it? Yes, 10 days. All are true about measles except, all are true about measles except both active and passive immunization are given simultaneously, right? It is not given simultaneously, right? It will cause flaring up of TB, yes. Most infectious during the rashes, yes. Cause pneumonia and otitis media, that is also right. So here the not incorrect statement is both active and passive immunization are given simultaneously. The baby was given a dose measles vaccine at 6 months of age due to epidemic of measles and malnutrition. Correct regarding given subsequent dose will be, right. Now here the correct regarding given subsequent dose will be give after 9 month age, right. 9 month age, that is right. Now talking about what rubella. Now here the recommendation vaccine strategy for rubella is vaccinate first and foremost, right. Now vaccination strategy for rubella, it is what it is, women for what, for 15 to 49 years of women, right. Now priority group of rubella vaccination is what, first priority 15 to 49 years of reproductive age group females, right. And second, all children, how much, 1 to 14 years of age. And third priority is what, routine universal immunization of all children aged, right. Okay. Now here another thing I would like to mention is about what, Ford-Chamber sign, right. What is this? Okay, what is it? It is FORCHHEIMERS, Ford-Chamber sign. Now it is what, it occurs in what, it occurs in 20% of the cases, 20% of the cases, and characterized by small red papule on the area of soft palate, right. It is also seen in what, rubella. Okay, next question, risk of damage of fetus by maternal rubella is maximum if mother get infected in. Risk of damage of fetus, right, by maternal rubella is maximum if mother get infected in. Okay, that is in what, 6 to 12 week of pregnancy, right. 6 to 12 week of pregnancy, right. That will cause what, congenital rubella syndrome, right. Now here this, okay, risk of damage of fetus by maternal rubella is maximum if the mother get infected in. The same question is here. The question is what, our that 6 to 12 week of pregnancy, right. 6 to 12 week of pregnancy. Now other manifestation of CRS, congenital rubella syndrome, may include spleen and liver, bone marrow problem, mental retardation, microcephaly, low birth weight, thrombocytopenia, right. Okay, these are what. Okay, now talking about next question, all of the following statements are true about congenital rubella except, right. Now here all are true except it is diagnosed when infant has IgM antibody at the birth, right. It is diagnosed when the infant has IgM antibody at the birth, that's right. It is diagnosed when IgG antibody persists for more than 6 months, that is also right. The most common congenital defect are deafness, cardiac malformation and cataract, that's also right. Infection after 16 week of gestation result in major congenital defect, that is not right. So the infection after 16 week of gestation result in major congenital defect is not the right statement, right. The MMR vaccine is recommended at the age of, right, it is recommended at the age of 15 to 18 months, right. MMR. Okay, the rubella feature include all except, right. Okay, it includes all except what, tender lymph node in neck, that is right. Congenital infection with cataract, that is also right. Incubation period is less than 10 days, that is also right. But caused by what, oh sorry, the incubation period is not less than 10 years, right, and it is caused by RNA virus only. Under eradication of congenital rubella syndrome, right, program that first prioritize the group of rubella vaccination, we have already said. It is what, it is what, reproductive age group of 15 to 49, right, 44. So all non-pregnant women of age 15 to 44 years. False about congenital rubella syndrome is, what is the false? Okay, IgG is diagnostic, yes, it is true, right. Okay, talking about most commonly associated with CVS anomaly, that is also right. Cataract and hearing loss, yes. High risk if infected after 16 week, it is not the right statement, right. And IgM antibody may be seen shortly after birth, yes. So high risk if infected after 16 weeks is not the right answer. Mumps. Now let's go into mumps, right. Most common complication of mumps in children is, what is it? It is what, the most common complication, it is aseptic meningitis, right. Aseptic meningitis is the most common complication of mumps in children. Incubation period of mumps is, what is the incubation period of mumps? That is 18 days. 18 days is the incubation period of mumps. Influenza. Now let's talk about influenza. All of the following is not true about influenza virus, right. Which of the following is not true about influenza virus? Influenza virus A is subject to frequent antigenic variation. Okay, it is, right, it is, so it is the right statement. Antigenic drift is gradual antigenic change over a period of time. Antigenic drift is not a gradual antigenic change, right? Okay, talking about antigenic drift, right, it is what? It is point mutation, right? It is point mutation, right? And it's here what will happen, there will be insidious, right, the change over the time, right, in what our antigenic drift. So it might be the answer. So antigenic shift is due to genetic recombination. Yes, it is due to genetic recombination along with reassortment, right, and rearrangement, right? It is sudden, and epidemic and pandemic are caused because of shift, right, because of shift. And major epidemic are due to antigenic drift. So major epidemic, right, so it is somehow correct. Okay, so no, it is not right. So here what we can say here is major epidemic are due to antigenic drift. I'm sorry, I would like to mention a few points about what antigenic drift, right? Okay, antigenic shift and antigenic drift, right? In antigenic shift, what we have, it is because of genetic genetic recombination, reassortment and rearrangement, right? Rearrangement, and it is what? It is sudden, right? It is sudden, right? And it causes what? Epidemic and what? Pandemic, antigenic shift. But here this will cause what? Sporadic cases, and here there will be what? Antigenic drift. Here there will be point mutation, right? Point mutation, right? And here it is gradual and insidious in nature. So here the thing that I mentioned, that it is what? Antigenic shift, antigenic drift is responsible for epidemic. It is not right statement. So here antigenic shift is responsible for epidemic and pandemic. So answer number D is the right. Here C is right, B is also right, and A is also right. So I'm sorry that I said B was the answer, but the answer is D. I think we are clear. Newer influenza vaccine include. Now what does it include? Now newer influenza vaccine, it include what? It include split virus vaccine, right? It include neuraminidase, right? Neuraminidase, and also recombinant vaccine. This new influenza vaccine include these things. Now true about epidemiology of influenza. What is true about epidemiology of influenza? Now here the true statement about epidemiology of influenza are, right, all sexes and ages are equally affected, right? That is the true statement about influenza. Which of the following is true about influenza? Okay, the true is affects all ages and sex. The same question again. And incubation period is 18 to 72 hours. This is also the right statement. Which of the following lead to an outbreak of influenza in China 2013? In 2013 there was what? There was H7N9, right? H7N9, right? Okay, incubation period of swine flu. What is the incubation period of swine flu? It is 1 to 3 days. 1 to 3 days. Okay, moving to our next question. The pig H1N1 influenza acts as. Now here the pig acts as what? Okay, here the pig acts as none of the above, right? None of the above. In amplifying host, the pig was acting as amplifying host in one of the vector-borne diseases. The major reason for H5N1 not become a global pandemic is why? Because man-to-man transmission was not possible, right? It was very rare. Man-to-man transmission was very rare. Talking about diphtheria, right? Talking about diphtheria. Now, true about diphtheria are all except. Now, true about diphtheria are all except. Now, here carriers are more common source of infection than cases. That is right. Carrier are more common sources. Incubation period 2 to 6 days. That is also right. Right. 25 LF of diphtheria toxoid are present per ml in DPT vaccine. No, this is not right. So here it can be the answer. And diphtheria is an endemic disease in India. That is also the right answer. Right. So now, diphtherial toxoid are present per ml. So this is not the right answer. Right. Now, positive. Right, SEC test indicate, right? It indicate what? Susceptibility to diarrhea, right? Diphtheria, susceptibility to diphtheria. Okay, now here test of immunity, right? What are the different tests for diphtheria? What for diphtheria, right? Okay, test of susceptibility, immunity test, right? Immunity status test. Like for diphtheria, what we have SEC, right? Which is mentioned here in the question. Right. Now for tuberculosis, what we have for tuberculosis? We have Montox, right? Montox. Similarly for leprosy, what we have? For leprosy we have lepromine test. That is prognostic, right? And in Kala Azar we have Leishmanian test, right? Leishmanian, that is Montenegro test. Leishmanian test. So what are different immunity tests are for diphtheria? That is mentioned right here, right? For immunity diphtheria, for for susceptibility of diphtheria, right? Okay, similarly for TB we have Montauk's. For for leprosy we have got lepromin test, and for Kala Azar we have got Leishmanian test, right? Lepromin test and Leishmanian test. The herd immunity of over certain percent is considered necessary to prevent epidemic spread of diphtheria. So it is, right? So here what we have is more than 70% is considered necessary to prevent epidemic spread of diphtheria, right? Management of non-immunized diphtheria contact include all except, right? Management of non-immunized diphtheria contact include all except. It include prophylactic penicillin also, right? It include what? It does not include single dose of toxoid, right? And daily throat examination also it does not include. And daily throat swab culture, yes, it includes, right? Sorry, it includes daily throat examination but not daily throat swab culture. So single dose of toxoid it does not include. It does not include daily throat swab culture, right? So these are the the not correct statement about management. So now moving to our next question that we have is, right, now here the herd immunity, okay, we already talked 70% is considered necessary to prevent epidemic spread of diphtheria. Treatment of choice for diphtheria carriers is, what is the treatment of choice for diphtheria? That is our erythromycin, right? Erythromycin is the treatment of choice. Okay, sick test does not include, it does not include what? It does not include carrier of diphtheria, right? Diphtheria carriers are diagnosed by, it is diagnosed by what? It is diagnosed by our what? It is diagnosed by throat, okay, it is diagnosed by throat culture, right? Diphtheria carrier are diagnosed by the throat culture, right? A negative acid test includes, now a negative acid test includes what? Immunity to diphtheria, right? Immunity to diphtheria. Now there are questions about what? Whooping cough, right? Whooping cough. Now on vaccine preventable disease we are going to talk about whooping cough now, right? Now the question is, the question that, okay, the first question is the usual incubation period of pertussis is, what is the usual incubation period of pertussis? It is 7 to 14 days, right? 7 to 14 days. Okay, now talking about, okay, 7 to 14 days. Okay, now which of the following statement is true regarding pertussis? Now true statement about pertussis is erythromycin prevent spread of disease between the children, right? True statement regarding pertussis is erythromycin prevent spread of disease between the children. True regarding pertussis is, now which is true regarding of pertussis? Except, right? Now all are true except, right? Okay, it is associated with inspiratory hoop, that is right. It is droplet infection, that is also right. Parapertussis causes more severe disease than pertussis, that is not the right statement, right? And pneumonia is most common complication, that is also the right statement. So parapertussis causes more severe disease than pertussis is not the right statement. True about pertussis is, what is true about pertussis? Okay, now here incubation period is 7 to 14 days, that is what? That is the correct statement, right? Similarly, main source of infection is chronic carrier, right? No, it is not the right answer. Can if infect at any age, that is also the right statement. Secondary attack of unimmunized person is 90%, that is also the right answer, right? Okay, now true about pertussis is incubation period is 7 to 14, that is right. The main source of infection is what? Chronic carrier, no. Can affect any age, secondary attack rate is that much. Okay, review. Treatment for pertussis contacts children for, treatment for pertussis contacts children for, right? It contacts what? Okay, prophylactic antibiotic for 10 days, right? Prophylactic antibiotic for 10 days is what treatment of pertussis contact children, right? Okay, now moving to our next question. The next question is, a child with pertussis should be isolated for, it should be isolated for how much? 3 to 4 weeks, right? 3 to 4 weeks. Child with pertussis should be isolated for 3 to 4 weeks. About pertussis, the true statement about pertussis is, right? Okay, T secondary attack is what? The secondary attack rate is what? 90%, right? No cross immunity with parapertussis is seen, that is also the right statement, right? And similarly affect only humans, right? It's also the right statement. Meningococcal meningitis, now true about, okay, talking about meningococcal meningitis, now here now the causative organism is gram negative diplococci, right? That is right, right? Following statement about meningococcal meningitis are true except. Now following are true except, right? Now here, right, the source of infection is mainly clinical cases, right? The source of infection is mainly clinical cases, that is right. The following statement about meningococcal meningitis are true except the source of infection is mainly clinical cases, right? Okay, now the carriers are the most important source of infection in meningococcal meningitis, right? Xavier and Yogender stay in same hostel of same university, right? Okay, university. Xavier developed infection with group B meningococcus. After few days, Yogender developed the infection due to group C meningococcus. All of the following are true statement except, right? So here, now here, the vaccine prophylaxis of contacts of Xavier is what it is not the true statement. Other, educate student about meningococcal transmission and take preventive measure. That is right. Chemoprophylaxis against both group B and C group should be done. Vaccine prophylaxis of contact of Yogender is also done, but the vaccine prophylaxis for contact of Xavier is not what it is not the true statement. The vaccine for meningococcal meningitis should be what routinely given to. It should be routinely given to what? It should be routinely given to young adolescents, right? Young adolescents. Routinely all adolescents of 11 to 22 years age, right? First dose at 11 to 12 years ago, followed by booster dose at 16 years age, right? First dose at 11 to 12 years, 11 to 12 years, right? 12 years, and second dose how much? At 16 years, right? Booster dose. Okay. Now prophylaxis of meningococcal meningitis, the prophylaxis is rifampicin, right? Rifampicin is the prophylaxis. WHO criteria for high endemicity for meningococcal disease includes what? It includes 0.01%, right? 0.01%. Now similarly the next question is, right, the next question what we have is, okay, meningococcal vaccine available is, what is the meningococcal vaccine available? That is our ACW135Y, right? ACW135Y is the vaccine available. Now moving to our next question. Now what is the next question? The next question is the neurological complication, right? The neurological complication of DPT are due to, the neurological complication of DPT are due to pertussis component, right? Pertussis component. Okay. Chemoprophylaxis for meningococcal meningitis. Chemoprophylaxis, we have already said what is the chemoprophylaxis for meningococcal meningitis. We already said that is rifampicin, right? Rifampicin. Now acute respiratory infections, right? A 2-year-old female child was brought to PHC with a history of cough and fever for 4 days, right, with inability to drink for last 12 hours. On examination, child was having weight of 5 kg and respiratory rate of 45 per minute with fever. The child will be classified as suffering from, now okay, now here the child will be classified as very severe disease, right? Very severe disease. Why? Because here the child is not able to feed and severe malnutrition. That means weight 5 kg at 2 years is make the child having very severe disease, that is very severe pneumonia, right? Okay. Child is 24 months, was brought to primary PHC with complaint of cough and fever for past 2 days. On examination, child weighs how much? 11 kg, right? 11 kg. Respiratory rate was 38. The chest indrawing was present. The most appropriate line of management for the patient is, now here since the child is how much? 2 years, right? 2 years, right? 2 years, child is 2 years, and there is cough and fever, right? Examination, child weighs how much? 11 kg weight, right? Child weighs how much? 11 kg, right? And respiratory rate is 38. In chest indrawing is present. So now here, now what we have is, we will classify child as what? Severe pneumonia, right? Severe pneumonia. And what we do, we start antibiotic, start antibiotic and refer the patient. We will classify it as what? Severe pneumonia. Yes, start antibiotic and refer urgently, does not refer directly. So option number C is right. In this question, the child is 24 month, weight 11 kg, right? Respiratory rate is 38 per minute. Chest indrawing was present, right? Chest indrawing makes the child severe pneumonia, right? Chest indrawing means severe pneumonia. Thus the child will be referred immediately after giving first dose of referral antibiotic, right? After giving first dose of referral antibiotic. Also the now here the next question is the most important feature, the most important feature to diagnose severe pneumonia. What is the most important feature to develop severe pneumonia, right? The most important feature to diagnose severe pneumonia, it is what? It is chest indrawing. We have already mentioned chest indrawing, right? Chest indrawing. Now the 10-month-old child is brought to PSC with a history of cough and cold. On examination, he has respiratory rate of 48 breath per minute, and there is absence of chest indrawing. His weight is 5 kg. He is probably suffering from. Now here, right? Now here in the question, the child is 10-month-old, right? And the child is 10-month-old and has a respiratory rate of how much? Respiratory rate of 48 breath per minute, right? Similarly, there is what? There is absence of chest indrawing, right? And what these all are the feature of what? Feature of severe pneumonia, right? Severe pneumonia, right? Severe pneumonia. But the child has weight 5 kg, right? 5 kg expected weight at 10-month age is 9 to 9.5 kg. So the child is severe malnutrited also, right? Hence it is a case of very severe pneumonia. So we can't say severe, we can say very severe pneumonia, because the malnutrition is here, the child is less than expected weight, right? That's why. Now moving toward, okay, now let's go toward some question from our book. Which of the following is not true for measles? We already solved. Not infectious in prodromal state, right? Measles is infectious in prodromal state, and SSP is the least complication. True about measles all except, okay, Koplik spot appears as rash disappear. No, Koplik spot appear a day or 2 days before the rash appear in measles, right? Not after the rash disappeared, before the rash appear. Measles is not given in a single IM dose of 0.5 ml, right? Measles is not given in single IM dose of 0.5 ml. That is also the question. Which of the following is reserved here for measles? That was man, right? Koplik spot are seen in prodromal state. We did it, right? Spot appear in prodromal state. Fever stops after onset of rash, right? Fever stops after onset of rash. Vaccine is given at 9 months. That is also right? Measles vaccination campaign between 9 to 14 years of age for elimination is catch up. This was also a question. Measles is very severe in malnourished child. That was also the question. So the next question is most important complication of measles is meningoencephalitis. We did it. To eradicate measles, the percentage of population should be vaccinated is 95%. We did this question also. Incubation period is 10 days. Pneumonia is most common life-threatening complication of measles. Yes, pneumonia, bacterial infection, right? Infective period of measles is 4 days before and 5 days after the appearance of rash. Measles is not given before 9 months. Talking about rubella, recommended vaccine strategies for rubella vaccine first and foremost are for how much? 15 to 49 years of age, right? Recommended vaccine strategy for rubella vaccination was first and foremost to 15 to 49 years of age. Yes, we did this question also. All of the following statements are true about congenital ASAP, right? Congenital rubella ASAP, right? Infectious after 16 weeks of gestation result in major congenital defect, right? Infection after 16 weeks of gestation results major complication defect. It is what it is, not the true statement. Risk of damage of fetus by maternal rubella maximum if the mother gets infected in 6 to 12, right? 6 to 12 week of pregnancy. Pregnancy is considered contraindicated in rubella immunization. Yes, Yamamara vaccine is recommended at the age of how much? 15 to 18 months, right? 15 to 18 months. Okay. Now diphtheria. True about diphtheria are all except, right? 24. This one was what? It was not the right statement, right? Positive acid test indicates susceptibility of diphtheria. This was the question. The herd immunity of over 70% is considered necessary to prevent epidemic spread of diphtheria. That was also the question. Treatment of choice in carrier of diphtheria is what? Erythromycin. Acid test does not include about carrier is erythromycin, right? Acid test does not include about the carriers is erythromycin, right? Diphtheria carriers is diagnosed by what? Throat culture. This was the question. A negative acid test include immunity to diphtheria. Whooping cough, the usual incubation period of pertussis is 7 to 14 days, right? Yes, 7 to 14 days. The usual incubation period of pertussis is 7 to 14 days. Erythromycin prevent the spread of disease between children. True regarding pertussis is what is true about pertussis accept, right? Now here okay, the true about regarding pertussis is all except. So parapertussis causes complication is not the true statement. Parapertussis causes less severe disease than pertussis. Parapertussis causes less severe disease than pertussis. Secondary attack of unimmunized person is 90%, right? Prophylactic antibiotic for 10 days is treatment for pertussis contacts children. Prophylactic antibiotic for 10 days is treatment for pertussis contact children. That was also the asked question, right? A child with pertussis should be isolated for 3 to 4 weeks, right? 3 to 4 weeks. Measles is also called rubeola, right? Now mode of transmission for measles is droplet infection, droplet nuclei. Pathogenomic of measles, Koplik spot behind what? Second molar, right? The adverse effect of measles vaccination is toxic shock syndrome, right? The adverse effect of measles vaccination is toxic shock syndrome. Causative agent of tuberculosis is Mycobacterium tuberculosis. Rubella is accompanied by low-grade fever, lymphadenopathy, and maculopapular rash. The classical triad of congenital rubella: deafness, cardiac manifestation, and cataract. These are very important and asked so many times. Congenital rubella is chronic infection but requires acquired rubella is acute infection. Chickenpox is also called varicella, right? Chickenpox is transmitted by droplet, personal contact, droplet infection, and vertical transmission. Rashes of chickenpox are centripetal. Yes, centripetal in distribution, we have already mentioned about it, right? Okay, centripetal in rose petal like sign. Characteristic feature of rashes of chickenpox are pleomorphism, right? Non pleomorphism in what? In smallpox, and centrifugal in smallpox. Mode of transmission is droplet and direct contact, right? Now, whooping cough is also called what? Pertussis. For whooping cough, it is droplet, direct contact, and freshly contaminated fomites. Whooping cough stages: catarrhal stages is convalescent stage, right? Whooping cough is most infectious during catarrhal stage. Difference between rubella and rubella. Rubella, it is what? It is measles, right? Rubella, it is what? It is also called German measles, right? Large number of rubella, right? Large number of rubella. Okay, rubella is more, and rashes. Okay, rubella is more communicable than rubella. Rashes is less communicable than rubella. Rashes are confluent. Rashes are what? Not as in rubella, right? Rashes spread and clear slowly. Rashes spread fastly. So these were what? These were about the question from vaccine preventable diseases. So now the question that we are going to solve is from occupational health, right? Occupational health. So from here, let's begin our first question. The following are occupational diseases are not notifiable in India Factory Act 1976 except. Now here it is Indian question, that is the answer is Mcqs, right? Mcqs. Now it is what? It is because of sugarcane, right? Sugarcane. Now next question is the ideal periodial examination of worker in an industry is done every depending upon the type of exposure, right? The Indian constitution has declared that children less than years should not be employed in factories or mines. Less than how much year? Less than 14 years, right? 14 years should not be employed in factories or mines. Safety officers have been appointed in factories where number of worker is more than. Safety officer are where the number of worker is 1000, right? 1000. Useful screening test for lead is measurement of what? The useful screening. The useful screening is coproporphyrin in urine, right? Coproporphyrin in urine. Similarly, the next question, the lead poisoning in industries commonly occur by. Lead poisoning is mainly because of what? Because of inhalation, right? Because of inhalation. Inhalation of sugarcane dust could cause Mcqs, right? Mcqs, that is this. Okay, similarly, okay, all feature of silicotuberculosis except high sputum. There is rarely high sputum positive. Normally what? But normally they have what? They do not have high sputum acid fast bacilli positive. Children of such case do not get disease. Yes, this is right. Impairment of total lung. Yes. Nodal fibrosis. That's also correct. All are disease manifestation associated with low temperature except, right? Chilly veins, prickles, frostbite, trench fever. So here prickles are not associated with low temperature, right? Prickles are not associated with low temperature. Periodic examination of factory worker is a type of periodic examination. So periodic examination is a type of what? Early diagnosis and treatment, right? It is what? It is secondary prevention, right? Okay. With the reference to lead poisoning, various parameters are given below with the level of. Okay, now okay, now here what we have here is, so talking about lead poisoning, right? Lead poisoning, coproporphyrin in urine is what? Should be greater than what? Should be greater than our 150, right? So the coproporphyrin should be greater than what? 150. Coproporphyrin in urine should be greater than 150, right? Similarly, aminolevulinic acid, right? Levulinic acid, it should be what? The aminolevulinic acid should be greater than how much? Greater than 5, right? 5. Similarly, we have what? Lead in urine and lead in blood, right? Lead in urine, it should be how much? It should be greater than how much? In urine it should be greater than 0.8. And talking about what? Talking about in blood it should be greater than 70, right? So this is what? This is the correct answer. So here the D is the right answer. The minimum airspace per worker prescribed by Indian Factory Act is, what is the minimum airspace? The minimum airspace is how much? It is 500 cubic feet, right? 500 cubic feet. The maximum permissible level of whole body occupational exposure to ionized radiation is, right? Maximum permissible level of whole body occupational exposure to ionization radiation is, it is how much? It is 5 rem per year, right? 5 rem per year, right? 5 rem per year. Maximum permissible level of whole body occupational exposure to ionizing radiation is 5 rem per year, right? Okay. White fingers may result from which of the following occupational hazard? The white finger may result because of what? Because of vibration, right? White finger may be result because of vibration. Okay. Respirable dust responsible for pneumoconiosis has a size limit of how much? It has a size limit of our 5 micron, right? 5 micron. It is from 0.3 micron to 5 micron, right? Which of the following pneumoconiosis are more prone to develop tuberculosis? That is what? Silicotuberculosis. So okay, so here which of the following pneumoconiosis are more prone to develop tuberculosis? So tuberculosis, it is the silicotuberculosis, but that is not prone. So here none of the above are the right answer, right? Which of the following pneumoconiosis is caused by thermoactinomyces saccharine? That means what? Sugar cane. That is our Bagasosis, right? Which of the following pneumonia is caused by Polyspora feniae, right? That is farmer's lung, right? All are true about lead poisoning except, right? The except. Now here okay, now here all are true except greatest source is drinking water from lead pipes, right? Greatest source is drinking water from lead pipe because the greatest source is inhalation, right? We did question above, that is inhalation. Nearly 3/4 of occupational cancer are what are the maximum? These are what? These are our about maximum of the occupational cancer are our skin cancer, right? Maximum. Which of the following are associated with bladder cancer? The bladder cancer, it is what? It is our what? Naphthalamine, right? Naphthalamine. These are what associated with bladder cancer. Pre-placement examination has an important role to play in. Pre-placement examination has an important role to play in, right? It is what? It has an important role to play in occupational health, right? Occupational health. Now next question, under ESI Act, sickness benefit is given for the period of how many? 91 days, right? 91 days. Sickness absenteeism is useful index to assess what? Health status of the state of what? State of health of the worker, right? State of health of the worker. Which of the following are true for occupational lead poisoning except, right? Inhalation, yes, it is the most common. Lead in blood and urine provide quantitative indicator. Lead is not notifiable disease, right? Yeah, it is what? It is not the correct statement. Lead poisoning is not notifiable disease. All the following features are suggestive of asbestosis except, right? All the following occurs within 5 years of exposure, right? No, it is not correct, right? It is not correct. The disease progresses even after removal of contact, yes. Can lead to pleural mesothelioma, yes. Sputum contain asbestos bodies, that's right? Occurs within 5 years of exposure is not right answer. So it does not usually appear until 5 to 10 years of exposure, right? Okay. Now Bagasosis can be prevented by spraying. Now it can be prevented by spraying what? It can be prevented by spraying propionic acid, right? 2% of propionic acid, 2% propionic acid, right? Bagasosis is a pneumoconiosis caused by inhalation of pneumoconiosis caused by the inhalation of what? Sugarcane dust, right? Sugarcane dust. According to Factory Act 1948, maximum permissible working hour per week is, right? What is the maximum permissible? That is our 48 hours, right? 48 hours. Financial contribution of ESI comes from financial contribution for ESI. It comes from what? It comes from our state government, central government employ, all of them. Following are chemical agent which cause occupational dermatitis by local irritation except. Following are chemical agent which cause occupational dermatitis by local irritant except. Now here every causes what? Every causes, but okay, here ether does not causes dermatitis by local irritation, but rubber, extra and lime they causes, right? They causes. Now the most common mode of lead poisoning. What is the most common mode of? We have already said inhalation, right? Inhalation is the most common mode. Now occupational exposure may cause sterility in female, right? Which occupational exposure may cause sterility in female? Now it is caused by what? It is caused by lead and agriculture insecticide, right? Lead and agriculture insecticide. Chairman of ESI in India is, okay, it is again the Indian question, that is Union Minister of Labor, right? Union Minister of Labor. True about ESI Act 1948. What is true? The true is applicable on educational institute also, and maternity benefit for 3 months, right? Maternity benefit for 3 months and applicable on what? Educational institute also, right? False about ESI is, what is false? The false is worker with income less than 70 per day has to pay 300 per month, right? Worker less than, this is one, and another is what? Funeral expenses is 50,000. okay. The extended sickness benefit is given for, the extended sickness benefit is given for nowadays it is 2 years, but earlier it was 309 days, right? 309 days. Bicyanosis is seen in, bicyanosis, that means cotton, right? Cotton, that is textile industries, right? Textile industries. Bagasosis is seen in what? Sugar cane, right? Similarly, bagasosis occurs with cotton, sugar cane industries, right? Same question. Now silicosis occurs with what? Silicosis occurs with silica fibers, right? A person working on hot environment who consumes more H2O without salt is likely to develop what? Heat cramp, right? Heat cramp. It is likely to develop heat cramp. The ESI provisions state government employee contribute to fund employee contribution is, what is the employee? It is 4.75, right? Benzene is associated with the cancer of benzene, right? Benzene is associated with the cancer of leukemia, right? Benzene is associated with the cancer of leukemia, right? Leukemia. Okay. Now the further question, a wrist drop may be caused by industrial hazard in, it is caused by what? Lead, right? Battery industry, that is lead, right? Snowstorm appearance is seen in, silicosis, we know that, silicosis. Exposure to cotton dust, we know, bicyanosis. Bagasosis is occupational disease of lung caused by inhalation of bagasosis. It is caused by sugar cane dust, right? ESI Act include all of the following except, ESI Act include all of the following except defense establishment is not included here. Defense establishment is not established here. All are covered under ESI except, all are covered under ESI except non-power using factories with 18 members, right? Non-power using factories with 18 members. Monday fever is associated with, it is associated by bicyanosis, right? Bicyanosis. Silicosis affects what? Upper lobe of lungs, right? Upper lobes of lungs is affected by silica. Respiratory dose for pneumoconiosis is how much? It is how much? It is 0.1 to what? 5, right? 0.51 to 5 or 0.3 to 5. Dust particle in industry is a dust particle. It is what? It is chemical hazard, right? Chemical hazard. Bagasosis is due to long-term inhalation of, bagasosis is a long-term inhalation of sugar cane dust. Which of these is true regarding Factories Act, right? True about regarding Factories Act is what? 500 square feet minimum usage is required per person, that is right. A 40-year-old man working in coal mine since 15 years developed cough, dyspnea on exertion, chest pain, X-ray showed snowstorm appearance. The most likely diagnosis is, what is the most likely diagnosis? The most likely diagnosis is our silicosis. The Factory Act, the age of the child to work should be minimum how much? It should be 14 years, right? The next question is, which of the following is occupational lung disease but not pneumoconiosis? Okay, it is occupational lung disease but not pneumoconiosis. Okay, it is our what? Brucellosis, right? Brucellosis is occupational lung disease but not pneumoconiosis. According to Factory Act 1948, minimum space of each worker should have how much? 500, right? 500. Which of the following is not advantage for employee under ESI Act? Which is following is not advantage? It is what? It is exemption for sale tax, right? Exemption for from sale tax. Which of the what are the maximum permissible working hour in work person week according to Factory Act? That is how much? 48. Okay, less than 48 hours, right? 48 hours. Particle size in micron at which dust particle gets lodged into respiratory tract. That is how much? That is how much? That is our 0.5 to 3, right? 0.5 to 3 micron. Under ESIS Act, the state government share expenditure on medical care. How much? It is how much? It is 1/8, right? 1/8. Minimum duration of developing coal minor pneumoconiosis is, okay, it is how much? It is greater than 10 years, right? Greater than 10 years. Okay, which is not included in pneumoconiosis, which is not included in pneumoconiosis already. Okay, which is not included. Okay, it is our psittacosis, right? Psittacosis is not included, right? Psittacosis is not included. Similarly, the next question is bagasosis is caused by sugarcane. Occupational exposure to cotton dust causes what? By cyanosis, right? ESI act maximum time for sickness benefit of how many? Okay, it is how many? It is our 91 days. Okay, it is 91 days, right? 91 days. The occupational exposure that may cause sterility in female. Okay, sterility in female, that is what? That is lead, right? Bagasosis is caused by dust of bagasosis, sugarcane. Clinical symptom of least toxic are associated with blood level of lead toxicity are associated with the blood level of how many? 70 mcg in blood, right? That is lead level in blood. Minimum space, that is what? 500 cubic feet. Yes, we did this question. The ESI program is to employee contribute to the fund. The employer contribution is how much? We did this 4.75. Thermoactinomyces saccharine causes what? It causes saccharine, right? It causes what? Bagasosis. Ergonomics is what? What is ergonomics? Now, ergonomics, adjusting worker to the job, right? Okay, the ergonomics, what is the correct statement for ergonomics? The correct statement is adjusting the worker to his job, adjusting the worker to his job, right? Okay, the next question is, okay, the next question is sickness benefit under ESI is extended to what? It is extended to 2 years, right? The most common heavy metal poisoning in world is, what is the most common heavy metal poisoning? The most common heavy metal poisoning is lead, right? All are occupational cancer except breast cancer. Breast cancer is not occupational cancer. Which of the following is true about ESI Act 1948? True about ESI Act is what? Which of the following is true about ESI Act 1948? The true is that state government share 1/8 and ESI corporation is 7/8. That is right. Okay, this is the right statement, right? According to the Workers' Compensation Act 1992, which of the following is considered as occupational disease? Now, which of the following is considered as occupational disease? Now, here the occupational disease is anthrax, right? Anthrax. According to Workmen's Compensation Act, right? Which of the following is considered as occupational disease? That is anthrax. Main cause of farmers' lungs due to microorganism, that is what? Phene, right? Phene, micropolyspora phene. Under ESI, of benefit which is not given in cash, right? This is what? This is medical benefit, right? Medical benefit which is not given in cash, which is are not true of ESI Act 1948, right? 100% wages is temporarily disability, right? In temporal disability, and extended sickness benefit up to 91 days, right? These are not true. Okay, the question are dust particle in industry is, what are these? These are chemical hazard, right? The particle size is 0.5 to 3 micrometer in size, right? Bagasosis we know sugarcane, right? Which of the following is occupational lung disease but not pneumoconiosis? We have already said what is this? Brucellosis, right? Brucellosis, right? Brucellosis is infectious zoonotic condition caused by Brucella species and by dust particle, right? Okay, and okay, these are what? These are our pneumoconiosis, right? These are pneumoconiosis. Now, moving to our next question. Okay, farmer lungs we know micropolyspora phene, right? Siderosis iron, stenosis tin, birds fisher's lung, that is avian or bird droppings. Composite lungs, composite organism like Aspergillus. Silicosis affects upper lobe, right? Peribronchial diffusion, basal lung fibrosis are seen in what? Asbestosis, right? These are seen in what? Asbestosis. Similarly, nodular fibrosis, a part of lung, is seen in silicosis, right? Asbestos bodies in sputum is a feature of asbestosis. Snowstorm appearance are seen in, these are seen in silicosis, right? Snowstorm appearance in field is seen in X-ray in silicosis. Progressive massive fibrosis of respiratory is found in what? Anthracosis. Okay, this is also asked. Anthracosis, what consists in anthracosis? Progressive massive fibrosis. Grinder's disease is silicosis, right? Grinder's disease is silicosis. Black lung is other name for anthracosis, right? Bagasosis can be prevented by spraying what? 2% of propionic acid. With this is question. Bagasis control can be done by keeping moisture content greater than 20%. Yes, Spring bag acid with 2% propionic acid, that is right. Painter's colic is due to lead poisoning, and most common mode of absorption of lead is by inhalation, right. The useful screening for lead poisoning is what? Corpoporphyrin in urine. Monday's fever is by cyanosis, right. The most common occupational cancer is skin cancer. Waldear's flesh is due to ultraviolet radiation. Minimum duration of developing cold minus pneumoconiosis is greater than 10 years. Minus nystagmus is due to poor elimination. It is also asked question. Minus nystagmus. White finger may be result of which of the following? That is vibration. White finger are seen in person using drill and hammers due to exposure to vibration. Maximum permeable level of occupational exposure to ionization radiation is 5 rem per whole body. That is also asked question. Sickness abstinence means what? It is for what? Health of the worker, right? State of health of the worker. Sickness abstinence is useful index in industries to assess the state of health of the worker and their physical, mental and social well-being. Ergonomics means adjusting the worker to his work. Which is the most common heavy metal poisoning in the world? It is lead poisoning. Wrist drop, it is seen in what? Battery industry. Lead poisoning. Peripheral neuropathy is in lead poisoning, common in battery industry, causes wrist drop and foot drop. The clinical symptom of lead toxicity are associated with blood level of that is 70 mcg per 100 ml. Useful screening test for lead is measurement of corpoporphyrin in urine, right. Laboratory parameter for diagnosis of lead poisoning are what? Corpoporphyrin CPO, that is 150 microgram, right. That is aminolevulinic acid, how much? Our 5 mg per liter. Lead in blood is 70 and lead in urine is 0.8, right. And basophilic stippling in RBC, right. The lead poisoning in industry commonly occur by inhalation. Lead can be absorbed by inhalation, most common mode. Ingestion is through skin, right. All are true about lead poisoning except, right, greater source is in drinking water from lead pipes. It is not, because inhalation is the greatest source, right. Okay, greatest source of lead in lead poisoning, plumbism, saturism or painter's colic is gasoline, petrol or vehicle exhaust, automobile exhaust. All of the following is true for occupational lead poisoning except, right, lead poisoning is not notifiable disease, right. It is not notifiable disease. Following occupational diseases are notifiable except, okay, the all are notifiable disease except, now which is not notifiable disease? Our bagasosis is not notifiable disease. All are features of silicotuberculosis except high sputum AFP positive, right. We did this also. So all are disease manifestation associated with low temperature except with this question. We did this question also, right. Now periodic examination of factory worker is a type of, it is secondary prevention. Ideal periodic examination of worker in an industry is done every how many? Depend upon type of exposure. This also we did it, right. Minimum year space, that is 500. We did this question. Maximum permissible, that is what? 5 rem per year. Thrombosaccharide, that is what? Bagasosis, right. Fanny, that is farmer's lung, right. The main cause of farmer lung is Fanny, right. This is also what we did this question. Now here nearly 3/4 they are skin cancer. Benzene is what? Leukemia, right. Occupational cancer except breast cancer. Associated with bladder cancer, naphthalene, right. Okay, which of the following features are suggestive of asbestosis except occurs within 5 years is not the right answer, right. Okay, the next question is following are chemical agent which causes occupational dermatitis by local irritation except ether will not cause such thing. Biocinosis is seen in, it is what? Cotton, right, in textile industry. A person working in hot environment without salt will develop what? Heat cramp, right. Heat cramp. So these are what? These are about the questions from occupational hazards. Now from mental health we are going to solve MCQ. So the first question is the most commonly abused agent in India. What is the most commonly abused agent in India? That is tobacco, right. Tobacco. Which of the following is not a socio-pathological factor associated with mental health? Emotional stress it is, frustration it is, anxiety it is. So endocrine disease are not what? Socio-pathological factor. Maximum loss of daily occur occur in which psychiatric disorder? It occurs in what? In depression, right. It occurs in depression. So the other questions, the ability to think abstract thinking, the ability to think abstract thinking develops it develops at 7 years, right. The sensory motor stage, right, is since up to birth up to 2 years of age. That is what? That is sensory motor stage, right. And concrete thinking stage, what is concrete thinking stage? That is 2 years to 7 years, right. 2 years to 7 years, that is what? That is concrete thinking stage. And abstract or conceptual thinking stage, that is 7 to 11 years, right. 7 to 11 years. That is what, that is abstract or conceptual thinking stage, right? Similarly, adolescent thinking or formal operational stage from 11 years to lifelong, right? Adolescent from 11 years to lifelong, abstract or conceptual thinking from 7 to 11, concrete from 2 to 7, and sensory motor stage birth to 2 years, right? Okay, Moron is IQ with how much? 50 to 69, right? Moron is IQ with 50 to 69, that is called Moron, right? Okay, the significant average intelligence is considered when intelligent quotient is 2 standard deviation below mean value, such that IQ below 70. IQ below 70 is considered as what? It is what it is here, the person is called as sub-average intelligence, of having sub-average intelligence. IQ, what is IQ? That is mental age upon chronological age, right? Mental age upon chronological age into 100, that is what, that is our IQ, right? Intelligent quotient. Now mental retardation, right? The mild, the commonest one, it is what? It is 50 to 70, right? 50 to 70, the one, the moron which we are talking about, right? Moron, it falls under what? This, right? The commonest one, moron, right? Moron. Now the moderate is 35 to 50, right? We're just, what we're doing, we're subtracting 50. Similarly, we'll subtract further 50, that is 20 to 35. So here the most common type, that is 50 to 70, that is the mild, the commonest one, right? 50 to 70 is the most commonest one. Similarly, the moderate one is 35 to 50. Similarly, 20 to 35 is severe, and profound is less than 20. The most common cause of death due to mental illness is dementia, right? The most common cause of death due to mental illness, that is dementia, Alzheimer's, right? Alzheimer's and other condition. The most common abused agent in Nepal and India, both it is tobacco, right? Tobacco. Amphetamine are also called Superman drug. Cocaine, which is derived from leaf of coca plant, is also CNS stimulant, right? Cocaine is also CNS stimulant, right? Cocaine does not produce physical dependence and withdrawal symptoms. Okay, the major ingredient in sleeping pills which produce craving is what? That is our cocaine. Preparation of resinous extract from flowering top cannabis is known as what it is called? It is called what? Hashish, right? Hashish. The cannabis is most commonly abused drug in world and is obtained from cannabis indica, right? Cannabis is most commonly abused drug in world and is obtained from cannabis indica, right? Resinous exudate, right? Resinous exudate from flowering top contains hashish inactive ingredient, and from small leaves ganja, dried leaves and flowering shoot forms bhang, right? What is bhang? Bhang is now the dried leaves and flowering shoots are bhang, right? Similarly, what these this hashish or ganja, right? These are what? These are resinous exudate from what? Resinous exudate from flowering tops, right? Okay, and when and from small leaves, these are ganja. Cannabis produces dreamy state of altered consciousness, that is most common symptom, right? Dreamy state of altered consciousness and psychotic dependence. Heroin is narcotic analgesic. Addiction to heroin is a worst type, right? Heroin. So no, what heroin is, the addiction to heroin is the worst type. LSD is most potent hallucinogenic agent, right? LSD is most potent hallucinogenic agent. Alcohol is what? It is CNS depression, right? Alcohol is only drug which is socially acceptable for intoxication. It acts as sedative, hypnotic, tranquilizer, or anesthetic agent, right? Alcohol is what? It is what? It is of what? It performs. It causes continuous depression of CNS and produce what? Psychic dependence and physical dependence, right? Physical dependence. Barbiturate, also called intoxic. Barbiturates also produce what? Intoxication similar to alcohol, and both type of dependence, right? Both type of dependence. 2.3 million people will die due to alcohol related problem, that is 3.7% of total death. Tobacco is drug responsible for maximum number of deaths as compared to all other psychoactive substance consumed. More people die of tobacco due to cancer, right? 30% of cancer related death. Withdrawal symptoms occur for 4 to 6 weeks, and it includes what? Irritability, anxiety, insomnia, lethargy, craving, tremors, right? Volatile solvent are CNS depression, producing similar effect like alcohol. What are volatile substances? These are CNS dependent depression, right? Producing similar effect like alcohol, right? Caffeineism arises after intake of more than 500 mg per day. Caffeineism after intake of 500 mg per day. That is what? That is caffeineism. Detoxification in chronic alcohol is done with anti-abuse, right? Anti-abuse and abuse, such as disulfiram, right? Clonidine, chlorpromazine, right? Detoxification in chronic alcohol is done with anti-abuse such as disulfiram, clonidine, chlorpromazine, right? Okay, gender identity disorder of children is diagnosed at early age of puberty, 2 to 4 years. Feeling sexual gratification by inflicting of pain or physical cruelty on partner is known as what? That is sadism, right? And just opposite is our mosaicism, right? Fetishism. Now, what is this fetishism? Fetishism is individual what derives sexual pleasure by looking on belonging of opposite sex, right? Fetishism. And sexual sadism is what? The sexual pleasure obtained by physical or psychological humiliation or torture or injuring sexual partner, right? And exhibitionism is what? Sexual pleasure by exposing one's genital to other, right? Unsuspecting stranger, usually female, and often followed by masturbation, right? That is exhibitionism. Now, voyeurism or peeping tom, sexual pleasure by observing secretly other getting undressed or engaged in sexual activities. That is voyeurism, right? That is peeping tom. Zoophilia or bestiality. What is this zoophilia and bestiality? Performing sexual activities with animal, right? With animal, right? Male erective dysfunction, that is impotence, right? Mosaicism, opposite of what? Sadism, sexual pleasure when humiliation or injury is inflicted on oneself by other partner, right? Pedophilia, as name suggests, right? Pedo, that means habit of performing sexual activities by adult of at least 16 years of age with children of at least 5 years younger than adult, right? Of 16 years when conflicting what? Sexual activities of less than 5 years, right? That is pedophilia, right? Okay, conversion disorder or reaction, hysteria, right? Conversion disorder or reaction or hysteria is characterized by somatic symptoms, right? Somatic symptoms involving secretory and motor functions, so that symptoms suggest an organic, medical or neurological disorder, but there are no objective sign of organic illness, right? Conversion disorder or reaction means what? Characterized by somatic symptoms involving sensory or motor function. Symptoms suggest an organic, medical or neurological disorder, but there are no objective sign of organic illnesses. And ICD-10 classification, there are 11 category of mental disorder, right? Okay, toxin that can cause psychiatric disorder. What are the toxin? These are carbon disulfide, mercury, lead. All of them causes psychiatric disorder. Carbon disulfide, mercury, manganese, right? Tin, lead are toxins which can cause psychiatric disorder. Deficiency of thiamine, pyridoxine and iodine can cause psychiatric disorder also. Family-based health services are most useful in early diagnosis and treatment of mental disorder. In this too, casework and counseling is the most commonly employed by family service agencies. In major mental illnesses, right, the person is insane and out of touch with reality, right? Depression is associated with hypofunctioning of non-adrenaline and serotonin and elevated level of cortisol. What is depression? Depression is associated with hypofunctioning of non-adrenaline or serotonin and elevated level of cortisol, right? In schizophrenia, dopamine overactivity is implicated as a cause, right? In schizophrenia, dopamine overactivity is implicated, right? And in depression is associated with hypofunctioning of non-adrenaline and serotonin and elevated level of cortisol, right? Okay, moving to next. Late age of onset, not similar past history, right? No family history and no apparent psychological precipitation indicate an organic cause of psychiatric disorder, right? Late age of onset, no similar past history and no family history and no apparent physiological precipitation indicate an organic cause of psychiatric disorder. Maximum loss of daily occurs in which psychiatric disorder? Maximum loss, that is depression, right? We did this question. Depression is most common psychiatric disorder causing daily disability, adjusted loss, year loss, right? Depression is fourth common cause of daily loss of all age and second most cause of 15 to 45 years. Alcohol abuse and dependence is most common substance abuse disorder causing daily, right? Depression, what? Depression is the second, okay. Alcohol abuse and dependence is what? The most common substance abuse disorder causing daily loss, and depression is fourth common cause of daily loss of all ages and second most common cause of what? Our daily. Which of the following is not a sociopathological factor associated with mental illness? That is, endocrine disease are not. Phobia is an exaggeration of unnecessary form of fear, right? Type of emotion, fear, the most common emotion of man. Phobia, when fear become exaggerated unnecessarily, that is phobia. When fear become exaggerated unnecessarily. Anger or rage, that is what? Reaction of offensive, destructive in nature, right? Type, offensive type, reaction of offensive type, destructive in nature, that is anger. Anxiety may lead to tension or pain. Anxiety will lead to what? Tension or pain. Love, feeling of attachment to some person, that is love, right? Inner substance, thought of a person toward an individual or situation is best described as inner subjective thought of person of a person toward an individual or situation is best described as what? Belief, right? Inner subjective thought. Which of the following is not major mental disorder? Neurosis is not major mental disorder. Schizophrenia, paranoia and mania are. Major illnesses. Psychosis consists of schizophrenia, that is split personality, maniac, depression, psychosis, right? Paranosis. And minor are neurosis, psychoneurosis, personality and character disorder. So this was all about what? This was all about question from mental health. Now we are going to cover MCQs from what? From health delivery system in Nepal and from what? From health delivery system in Nepal and health planning and management, right? So without delay, let's begin with the first question. The concept of primary health care was first brought into limelight 8, right? It was brought into limelight 8, Alma Ata Conference 1978, right? Alma Ata Conference 1978. Alma Ata Conference was held in USSR, right? Sustainable Development Goals were adopted following UN Sustainability Developmental Summit in September 25 to 27 in 2015 in New York, USA. Which of the following is not element of primary health care? Right, talking about the element of primary health care, right? We know how we can remember the element of primary health care, okay, by ELEMENTH, right? From E we have got education, right? Education concerning prevalence of health problem and method of preventing and controlling them, right? Education, right? From L we have got what? We have got locally endemic disease, right? Okay, prevention and control of locally endemic disease. From E, what we have got? From E we have got essential drugs, provision for essential drug. From M we have got maternal and child health care including family planning. Now, right? ELEME. From E we have got that ELEME we have got essential drug, and we have got nutrition, right? From E the same thing, essential drug. From N we have got what? We have got nutrition, right? From E we have got nutrition. Now nutrition, right? Nutrition. And then from T we have got treatment of what? Treatment of what? Common diseases and injuries, right? And from yes we have got what? From yes we have got safe water and basic sanitation. So here promotion of food supply and proper nutrition. So it is what? It is the element. Maternal child health, it is legislative against food adulteration. So it is not seen an appropriate treatment of common disease. It is also. So the option number C is not the element of primary health care. Now which of the following is not principle of primary health care? So principle, right? Okay. Now talking about the principle of primary health care, intersectorial coordination, yes. Appropriate technology, that's right. Community participation, that's right. But profitable health service, it is not right statement. So this is the answer. Principle of principle of primary health care. What is the principle? Okay, these are what? These are our what? Appropriate technology, right? Principles, right? Element, we already talked about element. Now talking about the principle, appropriate technology, right? Our intersectorial coordination, right? And what? Community participation and inequality distribution, equitable distribution, right? Appropriate technology, intersectorial coordination, community participation and equitable distribution. How we can remember it? We can remember it with the help of, right, what? ACE inhibitor, right? What? Appropriate technology, right? Then community participation. From C, what we have got? From C, community participation. From E we have got equitable distribution, and from I, intersectoral coordination. Which is the first step in health planning cycle? What is the first step? The first stage is analyzing of health situation, right? Analyzing of health situation, which is management method based upon behavioral science, that is organization design, right? Organization is based on what? Behavior, right? Which is the management method based upon behavioral science, that is organizational design method based upon behavioral science, right? These are what? These are organization design, personal management, communication, information system, management by objective, right? Which is quantitative method of management. The quantitative method of management is quantity, right? It's talking about cost. So cost accounting is quantitative method of management. Which of the following is not quantitative method of management? It is obviously what? Cost. Okay. Which of the following is not quantitative management method? Quantitative. It is what? It is our communication. Communication is not a quantitative method, right? Quantitative method includes what? Cost benefit, cost effective, cost accounting, input output analysis, network analysis, right? PERT and CPM. So this cost benefit, cost effective, cost accounting, right? These all input output network analysis, which include PERT and CPM. These all are what? These are quantitative method. Which of the following compares the economic outcome of health program with the cost of its implementation? So here it is talking about what? Cost. So cost benefit analysis is the right answer. So cost benefit analysis is the right answer. Of the following does not express the outcome of health program in monetary term? Does not explain in monetary term. Obviously it is cost effective, right? Cost effective. Okay, cost effective. Now moving further, what we have is what does MBO mean in management? That is management by objective, right? It means management by objective. Moving to next question, which of the following comes under network analysis? POT and CPM both are, right? The longest path of network is called critical path is the longest path. Which is true about health administration, right? Okay, involves thinking and planning, right? It is not involved in thinking and planning. It is involved in thinking and planning. Education is done by management, right? Education is done by, it is called implementation is done by management, right? So it involves thinking and planning. Is done by what? Management, right? Health administration is concerned more with health administration is concerned more with determination of objective and policies and involved thinking and planning. Health management has executive functions and involves doing and acting. Health management has executive function and involves doing and acting, which is not objective of Nepal health sector program to implementation plan, right? Which is not objective. Okay, now here to implement legislation and gradually eliminate traditional health sector, which is not what objective, right? Other all like to assess to and utilize quality of EHCS, right? To reduce harmful cultural practice and cultural and economic barrier, to assess healthcare service in partnership with non-state sector, to improve health system to achieve universal coverage of, right? EHCS. These all are what? These all are the objective, right? Okay, now one of the policy of NHSP2 is to develop Ayurvedic system of medicine by managing and utilizing the hub available in the country, as well as development of other complementary medicine system, which is not element of evaluation of health program, which is not element of evaluation of health what program, that is appropriateness, right? Appropriateness is not. Other all accessibility, right? Acceptability, adequacy, these all are what? Element of evaluation of health program, right? Which of the following is a set point framed for long-term plans, but yet something that cannot be quantified or measured? That is what? That is goal. Which of the following is a set point frame for long-term plan, but yet something that cannot be quantified or measured? That is goal, right? That cannot be quantified or measured. Okay, the correct sequence of planning cycle is, okay, the correct sequence of planning cycle, okay, right? Now the correct sequence is, now here at last what we need to have, what? Evaluation, right? Planning, object, goal and evaluation, right? Evaluation. So answer number B is the right answer, right? The most comprehensive indicator of cost effective analysis is, what is the most comprehensive? That is QALY, right? Gain, right? QALY gain is the most comprehensive indicator of cost effective analysis. Time taken for any project is estimated by network analysis, right? For a time taken for any project is estimated by network analysis, right? Network analysis consists of POT and CPM, right? If any activity along the critical path is delayed, the entire project would be delayed. Which of the following is not a source of manager's power? Efferent is not the source of manager's power, right? Reward, legal and coercive are what? The source, but efference is not. The management tool which is more promising tool for application on health field is, what is the management tool which is more promising tool for application on health field? That is what? That is cost effective analysis, which is more promising tool for application on health field, right? More promising tool for application on health field, that is cost effective analysis. All are true regarding critical path method, CPM, SF. All are true. SF is a part of input output analysis, right? It is not part of input output analysis, it is a part of what? Okay, this is the part of network analysis, right? Okay, all are true about CPM, SF. It is a part of input output analysis, right? In management, goal refer to what? Goal refer to our what? Ultimate desired state towards which objective and resources are directed. Ultimate desired state toward which objective and resources are directed, right? The systemic observation and recording of activities of one or more individual carried out at predetermined random interval. What is it? Okay, now here the systemic observation and recording of activities of one or more individuals carried out at predetermined random interval. What is it? It is work sampling, right? It is work sampling. Qualities of leader include all except. Qualities of a leader include all except burning and breaking of bridges is not the quality of leader. Leading from front, courageous and fight instantly are the qualities. Number of health related goal in Millennium Development Goal. Now what are the number of health related? These are what? These are 3, right? These are 3. Okay, now talking about okay, these are 3, right? So the first one, right, the first one is related to what? The first one is related to poverty, right? Second, education. Third, equality. 4, what? Child mortality, maternal mortality, right? 4, 5, 6, what? Child mortality, maternal mortality, and HIV/AIDS, right? So these are what? Health related. 4, 5, 6 are health related, right? And then 7, environment, right? 8, what we have got? Global something, right? Okay, so there are 8, right? 8 Millennium Development Goals. Out of them 3 are related to health. 4, 5, 6, right? 4, 5, 6 are related to health, children, maternity, and HIV/AIDS, right? Okay, there are goals 4, goals 5, and goal 6, right? 4, 5, 6. What is associated with? That is associated with quantitative, right? Quantitative, right? Quantitative. The study was conducted among nursing staff to find out different aspects of patient care through bed preparation, monitoring of vital diagnosis, attending doctor's round, blood sampling, drug administration. Which management technique would be applied for the analysis? Network analysis would be applied for the analysis. According to MDG, children mortality has to be reduced by how much by 2015? Right? According to MDG, children mortality has to be reduced by 2/3. Right? It should be reduced by how much? Reduced by 2/3, right? Millennium Development Goal pertaining to HIV/AIDS. What is it? 5 4 what? Children, 5 mother, and 6 HIV/AIDS. So it is 6, right? The target of SDG is to achieve global MMR by 2030 is less than how much? 70 by 70 per how much? Lakh live birth, right? 70 per lakh live birth. That is what? That is the target of SDG, right? To achieve global MMR by 2030, right? 2030. Okay, a good manager should have the following skill set. Okay, the good manager have following skill set: ability to do work himself, right? Ability to do work himself. The purpose of health planning is to improve the health services. All of the following are component of input in healthcare delivery system except, right? All of the following are component of input of healthcare delivery system except management, right? Management is not the component of input in healthcare delivery system. All of the following techniques are used in health economics except, right? Management by objective, right, is not used, right? Is not used technique in health economics, right? Management by objective, right? MBO is not used. Or the cost accounting, cost effective input output analysis are used, right? ABC analysis is, what is ABC analysis? ABC analysis is drug inventory control technique, right? Drug inventory control technique. What is it? It is drug inventory control technique, right? Inventory control technique. Input output analysis is qualitative method in health planning derived from the field of economics, right? Economics. Input output analysis is qualitative method in health planning derived from the field of economics, right? The biggest strength of healthcare organization is, what is the biggest strength? That is trained and motivated manpower, right? Manpower is the strength of what? Healthcare organization. PERT stand for what? Program evaluation and review technique, right? It is review technique, right? Review technique. Program evaluation and review technique. Among the goal of SDG, only health related goals are 3, right? Goal 3 consists of 13 targets. Overall SDGs consist of 169 targets. So this was okay. Now the highest designation of PHC, right? Now health delivery system of Nepal, in highest designation of PHC is of what? In PHC, medical officer is of highest designation. Which goal of SDG is health related? That is third, right? Which goal of SDG is related to health related? That is third. Goal 3 consists of 13 indicators, right? Goal 3 consists of 13 indicators. There are altogether 17 goals in SDG and 169 target overall. How many division and center are there in Nepal which work on the Department of Health Service? Right now here 7 division and 6 center, right? 7 division and 6 center. The second long-term health plan was developed in when? The second long-term health plan was developed in how much? When? 1997, right? Second long-term health plan. How many health posts are there by 70 to 70? So it is world data 3803, right? So now the next question is CSD stand for Child Health Division, right? CSD stand for Child Health Division. Okay. MD stand for Management Division, right? Management Division. FSD Family Health Division. NTC National Tuberculosis Center. NHEICC, that is National Health Education Information and Communication Center, right? NHTC, that is National Health Training Center. ENM stand for what? It is Auxiliary Nurse Midwife, right? Auxiliary Nurse Midwife. Okay. FCS, Female Community Health Volunteer. CMA, that is Community Medical Assistant. Community Medical Assistant, right? MO, that is Medical Officer, and HA is Health Assistant, right? So these are what questions from our health delivery system in Nepal. Now we are going to solve question from inferential statistics, right? Now the first question is, which is the best probability distribution to study the daily administration of head injury patient in trauma care center? So that is Poisson's distribution, right? Now Poisson's distribution is what? Best probable distribution to study daily administration of head injury patient in trauma care center. The standard normal distribution has what? Variance of 1, right? It has variance of 1 in standard normal distribution. Normal distribution curve depend upon what? Mean and standard deviation. It depend upon mean and standard deviation. The normal distribution curve, it depend upon mean and standard deviation, right? So here we'll not go into it. For negative skewed data, mean will be what? It will be less than median, right? For negatively skewed data, mean will be less than median, right? How much of sample is included in 1.96 standard deviation in normal distribution, right? How much sample is included in 1.96 standard deviation in normal distribution? That is 95%, right? 95% sample is included. So the next question is, if systolic blood pressure in a population has a mean of 130 mmHg and median of, right, mean is 130 and median is 140, right? The distribution is said to be, now here median is more than mean, right? Median is more than mean, or mean is less than median, so here it is negatively skewed, right? Negatively. In normal curve, what will be there? In normal curve, mean will be equal to what? Median. Mean will be equal to median. Mean will be equal to median, right? Z-score is for which type of distribution? It is for what? Normal type of distribution, right? Z-score is for normal type of distribution. It is for normal type of distribution. Pearson's skewness coefficient is given by, it is Pearson's, right? Pearson's skewness coefficient is given by what? Mean minus mode divided by standard deviation, right? Mean minus mode divided by standard deviation. For calculation of sample size, right? For calculation of sample size for a prevalence study of all following are necessary except, right? Now for calculation of sample size of prevalence study, all the following are necessary except desired precision, right? Desired precision is not necessary. In study, people are separated into certain subgroup and then some are selected randomly from each of these subgroup. What type of sampling is being done, right? Now here, right, in study people are separated into certain certain subgroup, and then some are selected randomly from each of these subgroup. What type of sampling is done? Now here stratified sample handling is done, right? Stratified random sampling is done. The true about cluster sampling are all except, right? Now sample size same as simple random. No, it is not true. Sample size same as sample random. It has two-stage sampling. Yes, it is right. Cheaper than other method. Yes, it is method for rapid assessment. So here option number A is the right answer, right? So here now, okay, let's leave this numerical portion, right? The prevalence of diabetes is 10%, and probability that the 3 people are selected at random from population all have diabetes is how much? 0.001. Okay, chances of passing genetic disease white rate by affected parent to children is 0.16. They plan to have 2 children. The probability of both child having white rate is what? 0.0256. In the study variation in cholesterol level was seen before and after giving a drug. The test which would give its significance is, that is, paired t-test, right? In the study, variation in cholesterol level was seen before and after giving a drug. The test which would give its significance is paired t-test, right? Square root of p1 q1 upon n1 plus p2 q2 upon n2 is measure of standard error of difference between two proportion, right? Standard error of difference between two proportion. Okay, now here this is also the numerical portion. Will not. Okay. The height of group of 20 boy aged 10 years was 140 plus 13 centimeter, and 20 girl of same age group was 135 plus 10. To test the statistical significance of differences height, the test applicable is, now here the test applicable is t-test, right? T-test. Okay, we did question of t-test earlier. Yes, there was one question also. While applying chi-square test to a contingency table of 4 row and 4 column, the degree of freedom will be 4 minus 1 into 4 minus 1. That is how much? That is 9, right? Not required in chi-square test is, what is not required? Mean and standard deviation of the group is not required in chi-square test, right? Mean and standard deviation of the group is not required. Appropriate statistical method to compare two mean is, what is the appropriate statistical method to compare two mean? That is what? Students t-test, right? That is students t-test. That is appropriate statistical method to compare two mean. Appropriate statistical method to compare two proportion. Now talking about two proportion. Now two proportion can be calculated by chi-square test, right? Two mean can be calculated by standard students t-test. Test of association between two quantitative variable is done by what? Chi-square test, right? Chi-square test. And to compare two proportion also chi-square test is used. Chi-square test is for what? It is test for what? Two proportion, right? Difference between two proportion. The correlation between variable A and B in study was found to be 1.1. This indicates the correlation is what? 1.1. It indicates computational mistake in calculating the correlation, right? Computational mistake in calculating the correlation, right? Which of the following is not true about correlation, right? Correlation can measure risks, right? Correlation can measure risks is not the true relation, right? About correlation, right? Correlation cannot measure risks. If we know the value of one variable in an individual and wish to know the value of another variable, we calculate coefficient of regression, right? Coefficient of regression. If we know the value of one variable in an individual and wish to know value of another variable, we calculate what? Coefficient of regression. Which can be true regarding the coefficient of correlation between IMR and economic status, right? Which can be true regarding coefficient of correlation between IMR and economic status. That is R is equal to minus 0.8. Sorry, R is equal to minus 0.8. Correlation of height and weight can be measured by correlation coefficient, right? Correlation coefficient. Mosquito decrease as height increase in negative correlation, right? In negative correlation. Type 1 sampling error is classified what? Type 1 is our alpha error, right? Now here type 1 sampling error is said to occur when true hypostasis H1 get rejected. It is also called false positive, right? False positive, that is type 1 or alpha error, right? Okay. And type 2 error, beta error, is said to occur when a false hypothesized S not get accepted. It is also called false negative. Power of study can be increased by decreasing beta error, right? Decreasing beta error. After applying a statistical test, an investigator gets p-value as 0.01. It means that the probability of declaring a significance difference is 1%, right? The probability of declaring a significance difference is 1%. Okay, all true about p-value except is equal to 1 minus b, right? It is not equal to 1 minus b, which is probability of communicating type 1 error is the chance that the presence of difference is concluded when actually there is none. When p-value is less than a, the result is statistically significant. Statistical power of a trial is given by 1 minus beta, right? It can be given by 1 minus beta. 10 reading of BP taken before and after treatment is studied by peer t-test, right? Peer t-test. 10 reading of BP taken before and after treatment is studied by peer t-test. Here, since only 10 reading are taken and less than 30, we use t-test, right? Since same 10 reading are studied before and after treatment, we use peer t-test, right? Peer t-test. If the given data is qualitative or non-parametric, we use chi-square test, right? Chi-square test. So this was all about the question from inferential statistics. Now we are going to solve MCQs from disaster management, right? Disaster management. The first question is in drought, commonly noticed vitamin deficiencies. What is it? It is vitamin A deficiency, right? Vitamin A is most commonly noticed vitamin deficiency in drought, right? The most commonly reported disease in post-disaster period is gastroenteritis, right? Diarrhea-like thing. Which epidemic does not occur after a disaster? Right, after disaster, leptospirosis will occur. Leishmaniasis or leishmania is not occurred, right? ARDA will occur and rickettsia will occur, right? Okay, so which epidemic do not occur after disaster? That is what our leishmania, right? The most commonly reported disease in post-disaster phase is gastroenteritis. Stage of health and medical relief, disaster contaminant, right? Stage of health and medical relief is related to disaster contaminant. Primary phase 0 to 6 hours, right? In this time period, first aid and medical care should be provided. Primary phase from 0 to 6 hours, first aid and medical care should be provided. Secondary follow-up, that means 6 to 24 hours, transportation, sanitation and immunization should be done, right? Transportation, sanitation and immunization should be done. Tertiary cleanup, that means 1 to 60 days, right? Food, clothing, shelter, abstinence, social service, employment and rehabilitation should be done, right? From 1 to 60 days. Food, clothing, shelter, abstinences, right? Social service and employment rehabilitation should be done, right? Similarly, during disaster, rapidly classifying the injury on the basis of likelihood of their survival with prompt medical intervention is a part of. It is a part of what? It is a part of triage, right? It is a part of triage. That means during disaster, rapidly classifying the injured on the basis of likelihood of their survival with prompt medical intervention, right? That is triage. Triage has how many color? It has got 4 color, right? It has got 4 color. That is true about triage is, right? Now red, okay, now here green ambulatory is what true about triage, right? Triage. The disaster management triage, the patient who needs surgery within 24 hours are categorized onto which category? They are categorized onto what? Blue category, right? Under blue, right? Okay, similarly, as per the most common classification of triage system that is internationally accepted, the color code that indicate high priority treatment or transfer is high priority treatment are what? Red, right? Which color code and the person is given first preference in disaster triad? In disaster triad, the red is given first preference. Black color in triage is what? Death, right? Triage is what? It is a concept in trauma. Triage is the concept in trauma, right? Triage, simple triage, right? Sort patients using color code before transportation to health facilities becomes available, right? Rapid triage, that means start, right? Simple triage and rapid treatment, right? Simple triage and rapid treatment, right? Rapid triage, that is simple triage and rapid treatment, performed by lightly trained and emergency personnel, useful in mass casualty as train weeks and bus accident. Reverse triage, less wounded are treated, right? First in preference to more severely wounded, right? Less wounded are treated first in preference to most severely wounded. These are what? This is reverse triage, right? Example, war victim, disaster where medical resources are limited, right? Triage, the consist of rapidly classifying the injured on the basis of severity of their injuries and likelihood of their survival with prompt medical intervention. First come service is not followed in the emergency. Triage yield best result when carried out at the site of disaster, right? And triage sieve, it is what? It is quick survey to separate the dead and working from the injured, right? That is sieve, right? Sieve, to separate, right? To separate dead and working from injured. Triage sort, right? Remaining casualties are assessed and allocated to the categories. Remaining casualties are assessed, right? Assessed and allocated to the categories, right? Triage sort. Now triage system most commonly uses 4-color code system, triage system, right? Now the red is what? Highest priority of red is of highest priority. That means immediate resuscitation or limb life-saving surgeries in next 6 hours should be done. Yellow, right? High priority, right? Possible resuscitation or limb saving surgery in next 24 hours. And 6 hours that are red, and 24 hours that are yellow. And green of low priority, that means minor illness, ambulatory patient. Black, least priority, dead or morbidant patient, right? Tagging is procedure where identification is place of origin. Triage, right? Triage category, diagnosis and initial treatment are tagged on event of victim of disaster through color coding. During massive disaster, what should be done first? Search, rescue and foster should be done, right? Arrange the following phase of disaster cycle in logical sequence, right? So here, okay, the sequence is what? Impact, response, rehabilitation, and mitigation. So B is the right answer. Which of the following is nodal center for disaster management, right? Nodal center for disaster management, that is what? That is district is the nodal center, right? Nodal center. Now nodal center in case of disaster management are what? Districts, right? First step after disaster strikes is to search, rescue and provide first aid, right? Strike is to search, rescue and provide first aid. After disaster, immediate help from the uninjured survival, and only a small fraction comes by organized relief services. Post-disaster earthquake in Pakistan, which of the following vaccine is recommended by WHO? That is none of the above, right? WHO does not recommend typhoid, cholera, TT vaccine in routine use in endemic area, such as post-disaster area. Measles vaccine has highest priority, right? Measles vaccines. All vaccine are not given in disaster except, okay, that is measles, right? We already talked, that is measles. Chernobyl nuclear explosion accident occurred on 26 April 1986. It resulted in emission of what? That is I-131 CS, right? CS-134, CS-137, SR-90, right? Okay, so here the gas responsible for propel gas strategy is methyl isocyanate, right? Methyl isocyanate. Which of the calamity with the what is the calamity with most amount of damage? That is what? That is flood, right? Natural disaster causing maximum death is hydrologic, right? Hydrologic. So this was all about what question from our disaster management. Now the MCQs are from what? International Health Organization, right? Now without delay, the first question is, all of the following organizations have their headquarters at Geneva except UNICEF. UNICEF have at what? At New York, right? Okay. Which of the following statement is incorrect about WHO? The incorrect statement is the WHO is not a specialized political agent of UN, right? It is not political agency of United Nations, right? Okay, now here the World Health Day is celebrated on 7th April, as WHO Constitution came into force into 7th April 1948, right? Headquarters of WHO is in Geneva, Switzerland. And similarly, the current, okay, now it is the world data. The parent organization, United Nations Economic and Social Council, ECOSOC, right? Total member of nation is 194. Associated member nations of WHO are 2, right? Puerto Rico and Tokelau, right? Structure of WHO, it consists of what? WHO Health Assembly, Executive Board, Secretariat. Member in Executive Board are 34. 1/3 of membership is renewed every year in Executive Board. 1/3 of membership is renewed every year in Executive Board. Secretariat is headed by Director General. There are 5 Assistant Director Generals in Secretariat. Number of regional organization of WHO is 6. The first constitutional function is to act as directing and coordinating authority on all international health work. WHO and UNICEF has worked together in cases of malaria, TB, venereal disease, right? Okay. Match the following health agencies and location of their location, location of the headquarter. So our UNICEF, right? UNICEF has what? New York, right? WHO have Geneva and Switzerland. So here A, right? WHO is what? Our 3, right? Geneva, Switzerland. UNICEF is what? Our New York, right? 2 we have got what? B we have got 2, right? B we have got 2. That means A 3 and B 2, right? A 3 B 2. So here it is the answer, right? A 3 B 2. And C, food and agriculture organization. Now it is what? It is Rome, Italy, right? In Rome, Italy. International Red Cross is based on Geneva, right? Geneva. Now here talking about the head agencies, WHO, it is in Geneva, Switzerland, right? And then what we have got another, that is what? That is ILO, right? ILO, International Labour Organization, that is also in Geneva, Switzerland. UNICEF, UNDP, FAO, right? UNICEF and UNDP, these are in New York. UNDP also in New York, right? And USA, right? And talking about this food and agriculture organization, that's on Rome, right? In Rome. Now moving further, UNICEF provides all except it provides child nutrition, child health education, immunization, but not family planning. Gobi campaign of UNICEF encourages 4 strategies for child health revolution, that is G, growth chart to better monitor child development, oral rehydration to treat all mild and moderate dehydration, breastfeeding, immunization against measles, diphtheria, polio, pertussis, tetanus and tuberculosis, right? GOBI, growth chart, oral rehydration, breastfeeding, immunization against measles, diphtheria, polio, pertussis, tetanus, tuberculosis. In Nepal, the major program for focus of UNICEF is on child health, maternity and newborn health, HIV, AIDS, nutrition. G, growth chart for better monitoring of child development, right? Rabies free countries, that country is this is Australia, right? Disease under international surveillance, WHO. These are Laos-borne typhus fever, relapsing fever, poliomyelitis, malaria, human influenza, rabies, salmonellosis, right? Tropical disease targeted for research and training. What are these tropical diseases, right? What are the tropical diseases targeted for research and training by WHO? These are trypanosomiasis, filariasis, schistosomiasis, leishmaniasis, malaria and leprosy, right? So here leprosy, malaria, leishmaniasis, schistosomiasis, filaria and trypanosomiasis are the tropical diseases, right? Disease excluded and re-included from international health regulation till dated, that is smallpox, right? That is excluded and re-included, that is smallpox. Only certificate of vaccine required for international travel is, that is yellow fever, right? Yellow fever. All diseases are included in internationally notifiable disease except TB is not internationally notifiable disease. Cholera, plague, yellow fever, these are internationally notifiable disease, right? The disease under international health regulation, these are cholera, plague, yellow fever, wild poliomyelitis, human influenza, right? And SARS and smallpox. Quarantine was introduced as a protective against, this was for plague. Quarantine was initially for plague, right? List of quarantinable or disease: diphtheria, plague, right? Yellow fever, smallpox, infectious TB, viral hemorrhagic fever, SARS, SARS, right? The World Environment Day, that is what? That is 5th June, important day. 3rd January, Anti-Leprosy Day. 4th February, World Cancer Day. 2nd Wednesday of March, No Smoking Day, right? 8th March, International Women Day. 15 March, World Disability Day. 24 March, that is Anti-TB Day. 7th April, World Health Day. 8th May, World Red Cross Day. 31st May, No Tobacco Day. 5th June, World Environment Day. 26th June, that is International Day Against Drug Abuse and Illicit Trafficking, right? 1st July is Doctor's Day. 11th July is World Population Day. 8th September is World Literacy Day. 28th September is World Rabies Day. 1st October, International Day for Older Person, right? Older person. 2nd Wednesday of October, that is World Disaster Reduction Day, right? World Disaster Reduction Day. 29th October, World Slide Day. 10th October, World Mental Health Day, right? World Mental Health Day, right? Similarly, now here 24th October, UN Day. 10th November, Universal Immunization Day. 25th November, International Day Elimination of Violence Against Women, right? 1st December, that is World Sex Day. 3rd December is International Day of Disabled Person, right? International Day of Disabled Person. 10th December is Human Rights Day. first constitutional function of WHO, right? What is the first constitutional function of? To act as directing and coordinating authority on all international health work. Theme of World Health Day 2017, depression. Let's talk. So it is already world question. 3F have now been incorporated in UNICEF Gobi, that is family education, family spacing, and food supplementation. Sorry, female education, family spacing, right? Female, right? Education, right? Family and food supplementation. Member of Southeast Asia of WHO are, what are these? These are India and Sri Lanka. Members of Southeast Asia of WHO are India and Sri Lanka, right? Okay, these are the members, right, of Southeast Asia WHO, right? Zero. Member of SAARC region are, these are the member of SAARC region. Highest funding for reproductive health is by UNFPA, right? UNFPA, highest funding for reproductive health. World Bank gives loan for what? For economic growth, right? And emporiatrics refer to study of health of traveler, right? Emporiatrics refer to study of health of traveler. So this was all about the questions. So these all are repeated question, right? Repeated questions. So this was all about the question from international health organizations. Now we are going to talk on the topic from research methodology, right? Now the first question from research methodology is, what is research design, right? It is a framework, right? It is a framework of every stage of collection and analysis of data, right? We review the relevant literature. We review the relevant literature to know what to know, right? To know what is already known about the topic, what concept and theories have been applied to the topic, who are the key contributor to the topic, all of the above, right? Why do you need to review the existing literature, right? To find out what is already known about your area of interest, right? To find out what is already known about your area of interest. A sample frame is, what is a sampling frame? Sampling frame is a list, right? A list of all unit in population from which a sample will be selected, right? A sample will be selected. A simple random sample is one in which, right? A simple random sample is one in which every unit of population has an equal chance of being selected, right? Every unit of population has an equal chance of being selected. The next question is, it is helpful to use multi-stage cluster sample when, right? The population is widely dispersed geographically, right? When a population is widely dispersed geographically. When a population is widely dispersed geographically. What effect does increasing the sample size have upon sampling error? What effect does increasing the sample size have upon sampling error, right? It reduces the sampling error, right? It reduces the sampling error, right? What effect does increasing the sample size have upon a sampling error? It reduces the sampling error. Which of the following is not type of non-probability sampling? Which of the following is not type of non-probability sampling, right? Stratified random sampling. Stratified random sampling is not a type of non-probability sampling, right? Not a type of non-probability sampling. Closed-ended questions are those that have a fixed range of possible answer. An open question is the one that allow respondent to answer in their one term. A data from each row in coding schedule can be entered into quantitative analysis computer program, right? A data from each row in coding schedule can be entered into a quantitative analysis of program called SPSS, right? It is SPSS, the method that consists of collection of data through observation and experimentation, right? Through observation and experimentation, formulation and testing hypothesis is called, it is scientific method, right? It is scientific method. So this is all about what question from research methodology. Now the one-liner for PSM, that means the important MCQ statements, right? For from PSM, which were done from target. Okay, now here the normal distribution or Gaussian distribution. Now here the mean is equal to median is equals to mod, right? Mean is equals to median is equals to mod. Now in right or positive skewed curve, there will be what? Mean is always greater than median, greater than mod, right? In positive or right right, skewed curve, there is mean greater than median is greater than mode, right. And talking about left or negative skewed curve, what mode is greater than median is greater than mean, right. Here just opposite, right, left or negative skewed curve, right. The p value, now p value, it is what is the p value? P value, probability of type 1 error, right, alpha error, right. It is a probability of type 1 error, right. And alpha, the maximum threshold permissible of type 1 error, right, it is 5%, right, it is 5%. Now here maximum threshold permissible of type 1 error is 5%, and b is permissibility of type 2 error, right, b2, right, b2, and alpha, right, a1, right, a1 b2, we can remember like this, right, maximum threshold permissible of type 1 error, probability of type 2 error, right. And power, what is power? It is 1 minus beta, that is probability of type 2 error, 1 minus beta, that is 1 minus probability of type 2 error, right. Statistical error, now here we have got what? P less than alpha, p equal to alpha, and p greater than alpha, right. The any of the above is possible in the study where there is p, right, p value is equal to, right, alpha value, right. Here anything is possible. Now when p is less than alpha, the significant result, right, p is what? Less than 0.05, right. P is less than 0.05 because alpha, we have taken alpha as how much? 5%, right. So p is less than 0.05. Lesser the p value, more accurate the result and better the study, right. Lesser the p value, more accurate the result and better the study, right. Okay, now appropriate statistical method to compare two mean. When there is comparison of two mean, then it is students t-test, right, students to t-test. And when there is the appropriate statistical method to compare two proportion is what? Chi-square test, right, that is chi-square test, that is the appropriate statistical method to compare two proportion. Okay, type of sampling, talking about the type of sampling, these are probability sampling and these are non-probability sampling, right. The probability sampling, these are simple random, systemic random, stratified random, multi-phase sample, cluster sampling, and multi-stage sampling. These are what? Okay, probability sampling, right. Non-probability are propose, convenience, right, accidental, quota sampling, and snowball sampling, right. And talking about qualitative and quantitative and qualitative, right. Quantitative, these are frequency polygon, frequency curve. Quantitative, these are line chart, ogive, right, ogive, and scatter diagram and histogram. Talking about the qualitative, these are bar chart, pie chart, map, right, and pictogram, right. The qualitative are bar chart, right, pie chart, and map and pictogram. Okay, now cost, what is cost? The value of resources used to produce something, right, including a specific health service or set of services, right. What is cost? Cost is the value of resources used to produce something, right, including a specific health service or set of service. Now cost of using a resources, right, cost of using a resources in a service or treatment is not just the price paid for that resources, but also include the benefit, right, foregone by not choosing other alternative, right. Okay, so the cost is not just a money price or money paid, it also includes the benefit, right, that we get by not choosing other alternative. And direct cost, what is direct cost? Related to use of resources as a result of treatment and healthcare process, right. It is related to use of resources as a result of treatment and healthcare processes. Talking about indirect cost, what is indirect cost? Related to losses to the society incurred as result of impact of disease, right. Indirect cost is what? Related to the losses to society, right, incurred as result of impacted of disease, right. And intangibles, what are these intangibles? These are related to distress, suffering, anxiety, impact on quality of life resulting from illness and poor health. These are intangibles, right. Okay, now talking about WHO recommendation change. Now what is this? This is reduction of fat intake is how much? 20 to 30%, right, percent of total energy intake. Now how much should be the reduction in fat intake? It should be 20 to 30%, 20 to 30% of total energy intake. It should be this should be the reduction in fat intake, right. Similarly, consumption of saturated fat should be reduced by 10%, right. Fat intake by 20 to 30%, right, 20 to 30%, but saturated fat, it should be less than 10% of total intake. But nowadays it is how much? Less than 7%. 7% is the new one, right, new one, the saturated fat, right. Saturated and sat, right, saturated and 7, we can remember like that, right, saturated and 7. Okay, now now here the cholesterol and HDL level. What is the cholesterol and HDL level? The cholesterol and HDL level should be less than 3.5, right. It should be less than 3.5. It should be less than how much? 3.5, right. And WHO and NPCV definition, right, the visual acuity, if it is less than 6 by 18, to 6/60, that is low vision, right? 6/60 and 3/60, that is economic blindness, and 3/60 and 1/60 to it is social blindness. So 3/60, right? If you remember, 3/60 is our blindness, right? Blindness, social blindness. And less than 1/60 and perception of light is present, then it is manifest blindness. But perception of light is negative, then that is absolute blindness, right? Perception of light is also negative, then that is absolute blindness. Tom killed in road traffic accident. If it is killed within 1 month, right? If it is killed in 1 month, that is killed, right, due to what? Road traffic accident. But if it crosses 30 days, right, if it crosses 30 days, then it is not called what? It is not called killed, right, by due to road traffic accident. And fatal in road traffic accident is killed within 1 week, that is fatal, right? Killed not, that is fatal, that is killed term, one is fatal term, right? 30 days and one is 30 days and one is 7 days, right? 7 days. Okay, the symptom of caffeine, right? Caffeineism develop when daily intake is 500 milligram, right? Caffeineism, the symptom of caffeineism will occur if there is daily intake of how much? 500 mg, right? For alcohol intoxication, 50 mg per ml is enough, right? For alcohol intoxication, 50 mg per ml. So these two we can just what? We can read these two together. For caffeine, that is how much? For caffeineism, that is 500 mg, and for what? For alcohol intoxication, that is 50 mg per what? Ml, right? Neutral fold thickness, right, more than 4 will be suspicious for Down syndrome, right? For more than 4 will be suspicious, that means 4. If you can see D and 4, right? D and 4. So we can remember it like this. So nuchal fold when greater than 4, right, will be suggestive of what? Down syndrome, right? And barrier what treatment in obesity is done when BMI is what? Greater than 40, right? When it is greater than 40, at the time we do it, right? Sodium homocysteine level greater than 15 millimole per liter, right, increases risk of what? Our CAD, right? Carotid artery disease, right? Okay, now the serum coronary artery disease. Now serum homocysteine level when greater than 15 will increase the risk of heart diseases, right? Okay, coronary artery diseases. Now serum homocysteine level when greater than 15. Now increased maternity is risk for what? Patent ductus arteriosus, right? Increased maternity risk is risk for, will develop the risk for what? Patent ductus arteriosus, right? Okay, now 1 mcg retinol. Now 1 mcg retinol will contain how much? 3.3 international unit of vitamin A. It will consist about 3.3 international unit of vitamin A, right? 1 mcg retinol causes. Now DOTS has 5 components, that is HRZES, right? DOTS has 5 components. An agent with low pathogenicity, look, the low pathogenicity and high infectivity, right? High infectivity results in what? It will result in carrier. It will result into carrier. The carrier have what? Low pathogenicity, right? Low pathogenicity and high infectivity, that is carrier, right? Chemoprophylaxis in baby born with mother on antitubercular therapy is isoniazid, right? Isoniazid. The isoniazid is the what? The chemoprophylaxis in what? Baby born with mother on antitubercular therapy, right? That is isoniazid, 5 mg per kg, right? Most common post transfusion hepatitis, it is hepatitis C, right? Hepatitis C is the most common post transfusion hepatitis. For literacy rate calculation is 7 years, right? From 7 years the literacy rate is calculated, that means from 7 years the literacy rate is calculated. Okay, endemicity of malaria. For calculation of endemicity, right, if you can see EN, and in spleen also we have EN, right? For endemicity, what? The spleen rate is what? Important. And similarly for sensitivity index, right, in recent malaria transmission, in recent, who are they in recent? The infant are the recent. So infant parasite rate, right? You can remember that recent, right? Recent are what? Our infant are recent, right? They have just recently came into this world. So the sensitivity index in recent malaria transmission is infant parasite rate, right? The streptomycin, right? The streptomycin has potential to cause fastest resistance, right? It has potential to cause fastest resistance, that is our streptomycin. Best method of assessing preventive measure in control of TB is presence of suspect case, right? The best method what the best method of assessing preventive measure in control of TB is what? Presence of suspected case, right? The best method of assessing preventive measure in control of TB is presence of suspected case, right? The fractional dose injectable polio vaccine was started in Nepal in, okay, this fractional dose, it is also very important, asked many times. Fractional dose injected polio vaccine was started in Nepal in how much? In 2000, how much? 2018, right? In 2018, the fractional dose, right? Fractional dose. And in 2014, okay, it was what? It was the inactivated polio vaccine, right? Inactivated polio vaccine in 2014, right? The fractional dose was in 2018, right? 2018. And the inactivated polio was in 2014. The degree of freedom for 2 into 4 table in chi squared is, okay, how to calculate it? 2, okay, 2 minus 1 times how much? 4 minus 1, that is what? That is our 3. So the degree of freedom for 2 into 4 table in chi square test is 3. Geriatric population is how much? The geriatric population is 8% of total population, right? It is 8% of total population. Okay, similarly, rejecting true null hypothesis, it is what? It is type 1 error, right? Rejecting true null hypothesis is type 1 error, right? Rejecting true null hypothesis is type 1 error. Similarly, dependent variable, right? What are the dependent variable? Variable which is affected by other variable, right? The variable which is affected by other variable, simple as the name says, right? Okay, protection following injection of yellow fever vaccination starts in 7 days, right? Protection following injection of yellow fever vaccination, right? Yellow fever vaccination starts in 7 days. 7 days. Malaria during pregnancy, right? It will cause what? It will cause abortion, right? Abortion. Child with pertussis should be isolated for how many? 3 to 4 weeks, right? The child with pertussis should be isolated for 3 to 4 weeks, right? 3 to 4 weeks. Now, Aedes aegypti index, right? Aedes aegypti index, surveillance used by WHO for yellow fever, right? Should be less than 1, right? The Aedes aegypti index, the surveillance used by WHO for yellow fever should be less than 1. And nevirapine, right? Nevirapine, the single dose prevent mother to child transmission, right? Nevirapine, the single dose prevent mother to child transmission, right? Okay, 4 C's in counseling of HIV patient are compliance, client education, contact tracing, right? Condom promotion. So the 4 C's, right? These are compliance, right? The compliance, client education, contact tracing, condom promotion. That's it. The PPM in TB stands for, what does PPM stands for? It is public and private mixed, right? Public and private mixed, PPM. It is public and private mixed. Okay, the expanded program on immunization was globally launched by WHO in 1974 May, right? The extended program on immunization. The extended program on immunization was launched on, right? Extended program on immunization was globally launched by WHO on 1974, right? 1974 May. The extended program in immunization. Positive sick test, right? Positive sick test indicates susceptibility to diphtheria, right? Susceptibility to diphtheria, right? Susceptibility to diphtheria. Okay, the most infectious stage of pertussis. What is the most infective stage of pertussis? It is catarrhal stage. What is it? It is catarrhal stage. Catarrhal stage. Catch up, right? Now catch up. Now the catch up, keep up and follow up. Now these are 3 terms used for measles elimination. How to remember it? Catch me, right? CATCH, catch me. Okay, we can remember it like this, right? The catch up, keep up and follow up are, these are what? These are for measles elimination, right? Okay, pertussis. Now what is pertussis? No evidence of subclinical infection, right? Pertussis, there is no evidence of subclinical infection. Chronic carrier stage does not exist, right? Now in pertussis, chronic carrier stage does not exist and no evidence of subclinical infection, right? And talking about diphtheria, right? 95% of disease due to subclinical or chronic carrier, right? 95% of the disease is due to subclinical or chronic carrier, right? Subclinical or chronic carrier. Now disease, right? Talking about disease. Okay, now case fatality in the case of yellow fever is how much? It is 80%, right? And in the case of Japanese encephalitis, it is 20 to 40%. It's very important because in the question it is often asked which is not correct statement about yellow fever, and there it is mentioned about case fatality of yellow fever is 90%. So that is not the right answer, right? The yellow fever it is 80% and Japanese encephalitis it is 20 to 40%, right? Okay, now okay, these are the disease, okay, and some of the data. Now here the ASIC test, right? It is negative. Negative. What does the ASIC negative means? It is immune to diphtheria. right? Negative means immune to diphtheria, positive means susceptible to diphtheria. We have already said susceptibility, right? Acid test shows susceptibility. It is positive acid test means susceptible to diphtheria, right? And negative means immune to diphtheria, and pseudo positive means hypersensitivity, and combined means what hypersensitivity and susceptibility, right? Combined means. So acid test negative means immune to diphtheria, right? Immune to diphtheria. Positive means susceptible to diphtheria. Pseudo positive means hypersensitivity, and combined means 2 plus 3. That is okay. Now talking about pneumonic plaque, right? Talking about pneumonic plaque, it is transmitted from human to human, right? Pneumonic plaque is transmitted from human to human. Viral infection that respond to antibiotic, that is lymphogranuloma venerum, right? LGV, right? Lymphogranuloma venerum. Viral infection that responds to antibiotic, that is what? That is lymphogranuloma venerum, right? It is what? It is viral disease, viral infection that will respond to what? That will respond to antibiotic, right? Nepal is first member of WHO. Okay, sorry. Nepal is member of WHO since 1953. Since 1953, to combat malnutrition and improve the health status of children, midday meal, right? Midday meal is provided for this. For this, menu should provide at least 1/3 of total daily energy and 1/2 of protein requirement, right? The midday meal, there should be how much? Midday meal, right? To combat malnutrition and improve the health status of children, midday meal. What should be the midday meal? The midday meal should be provided, right? There should be how much? There should be 1/3 of total daily energy and 1/2 of protein requirement, right? Minus type decks, right? What is minus type decks, right? This decks in which edge of chair goes inside the edge of decks, right? Minus type desk. Okay, minus type decks is the type of decks in which edge of chair goes inside the edge of decks, right? It is also the asked question. Now level of significance alpha, it is what? It is probability of making error, right? Level of significance alpha is the probability of making what? The probability of making error, right? Alpha is 5%, right? Alpha, if we take alpha 5%, if p, right? If p power factor is less than or equal to 5%, low p value, that means reject the null hypothesis, right? Reject the null hypothesis. If it is less than 5%, less than or equal to 5%, then low p, that means reject the null hypothesis. If it is greater than 5, high p value, that means accept null hypothesis, right? Accept null hypothesis. Now confident coefficient, it is what? It is 1 minus alpha, right? Power factor, power is 1 minus beta. P, when power is less than, very much less than 0.1%, that is reject the null hypothesis. Okay, now we have already said if p is what? Less than 5%, low p, right? Reject the null hypothesis. If p is high, accept the null hypothesis. Okay. Now default TB, default case of tuberculosis, what does it mean? An interruption of TB treatment for 2 or more consecutive months during intended treatment period, right? What is default TB case? Default TB case, these are what? These are interruption of TB treatment for more than 2 or more than 2 consecutive months during intended period, right? NCD, because of NCD, non-communicable disease, right? In 2010, 50% of the cases were what? They died, right? 50% of the cases died, and in 2019 71%, right? Cancer, right? Cancer accounts for 9% of total NCD death, and diabetes 4%, right? 4%. Now human papilloma virus 16 and 18, most these are responsible for most of the cervical cancer, right? 16 and 18. Nepal government implemented Tobacco Act on 2011. These Nepal government implemented Tobacco Act on 2011, right? 1% decrease in hemoglobin, SbA1c, right? Glycosylated hemoglobin will decrease the microvascular complication by 37%, right? 1% decrease in HbA1c will decrease risk of microvascular complication by 37%. And HIV incident rate, what is the HIV incident rate according to 2077 and 78? It is 0.03 HIV incidence rate, right? It is 0.03. And adult HIV prevalence is how much? 0.12. Concentrated epidemic of HIV, concentrated epidemic of HIV is what? Prevalence is constantly over 5%, right? What do you mean by concentrated epidemic of HIV? That means prevalence is constantly over 5% in least one defined subpopulation, high risk group, but below 1% in pregnant women. So that is what? That is prevalent. That is what? Concentrated epidemic of HIV. That means prevalence is constantly over 5%, right? prevalence is constantly over 5% in at least one defined subpopulation, that is high risk group, but below 1% in pregnant women, right? Over 5% in at least one defined population, high risk group, but below 1% in pregnant women, right? So we need to keep this in our mind, right? Over 5% at least one defined subpopulation and below 1% in pregnant women, right? TB, what is the relapse case of TB? Okay, that means return smear positive after being declared cured. That means after treating, after providing medication, if the individual is what again returned, if the individual returns smear positive, that is what, that is relapse case. And failure cases remains or becomes smear positive 8 or after 5 months of treatment. Okay, now here failure is what, the 5 month of treatment, right? After the 5 month of treatment, if he comes with smear positive, that is our failure, right? And we have already said relapse after completion of medication, if the person again comes with smear positive, that is what, that is relapse. And talking about defaulter, what a defaulter, who misses treatment for a continuous period of 2 months or more, right? These are what, these are the defaulter, right, who misses treatment for continuous period of 2 months or more. Tobacco industry is a vector, right? Tobacco industry is a vector. Now according to Tobacco and Control Act, right, pictorial graphical warning should cover how much? It should cover 75% of area of cigarette packet, right? It should cover how much? 75% of area of cigarette packet. According to Tobacco Control Act, pictorial graphical warning, right, 75% area of cigarette packet should be covered. Extra cost on total cost of producing one additional unit of output is marginal cost. What is marginal cost? Extra cost, right? The extra cost on total cost for producing one additional unit of output, right? It is marginal cost, right? It is marginal cost. WHO recommends that the health budget of country should be at least 10%. It should be at least 10% of total budget. The WHO recommend that the health budget of country should be at least 10% of total budget, right? Stunting, right? There are 25%. Okay, it is according to 2022 data. The stunting are 25%, right? Wasting are 8% and underweight are 19%. So stunting are how much? These are 25% and wasting is 8% and underweight is 19%. Baby friendly hospital initiative, BFEHI, baby, right? Baby friendly hospital initiative was initiated by WHO and UNICEF in 1991, right? It was done in 1991, right? Okay. Now mean and variance are equal in Poisson's distribution. Now Poisson's distribution, what are the two things that are equal? They are mean and what? Variance. Variance are equal. 1% decrease in HbA1c reduces the risk of myocardial infarction by 14%, right? 14%. Similarly, diabetes related risks by 21%, microvascular complication by 37% and amputation or death by 43%. So this is what, these are the factors that will be decreased by 1% decrease in HbA1c. When prevalence of night blindness is greater than 1%, vitamin A deficiency of public health importance considered, right? When prevalence of night blindness will be greater than how much? 1%, vitamin deficiency of public health importance is considered, right? Contamination bias is typical to what? Randomized control trial. Now contamination bias is typical to randomized control trial, right? It is typical to randomized control trial. Dengue earliest case was detected in 2005. Dengue, the earliest case of dengue was detected in 2005, right? Okay, how to remember this? Contamination bias is typical randomized control trial, randomly contaminated, right? Randomly contaminated, that is contamination type bias is type of randomized control type. The area is declared free of cholera when 10 days, right? When 10 days have elapsed since death, recovery or isolation of last case, right? When 10 days have elapsed since death, recovery or isolation of last case. If 10 days have already passed, right, since the last case noticed or recovered or death, then the area is declared free of cholera, right? Okay, WHO labeled 3 diseases, right, of greatest enemies of mankind. These are malaria, tuberculosis and what? Sexually transmitted diseases. So these are what? The 3 greatest enemies of mankind: malaria, tuberculosis and sexually transmitted disease. In normal distribution, mean of in normal distribution, mean of what? Our 0 and A standard deviation of 1 is called standard normal normal distribution, right? Standard normal distribution. Now chi-square test is used to find what? Association between 2 variables, right? And 2 mean what was it? Our students students, right, students was used for finding two mean, right, relation between two mean, and relation between two variable, it is chi-square test. Now chickenpox rats and smallpox rats, now talking about these two. Now chickenpox rats, it is centripetal, right, it is centripetal, but smallpox is centrifugal. It is, our chickenpox is superficial and unilocular, right, it is pleomorphic. So this centripetal is the asked question, right, pleomorphic is the asked question, right. Now here axilla and flexure surface are affected first, right, there will be rapid evolution, right, it spares the hand, palm and sole, right, inflammation is around the vesicles, right. Okay, now here smallpox, right, it is centrifugal, it is asked question. Deep and multilocular, non-pleomorphic is asked question. Axilla is spared, just opposite, right, axilla is spared. Extensor compartment affected, right, extensor compartment affected. Here the flexure surface was affected, right. Slow evolution will be there. Palm and sole are affected, right, sparing and affected, these are just opposite, right. Now in chickenpox, right, the axilla, flexure surface, right, whereas these are affected, right, affected, whereas here these are not affected, right. Axilla is spared, flexure surface is spared, but extensor compartment is affected. Here the palm and sole are spared, but here palm and soles are affected, right. The inflammation is around the vesicles, no inflammation is around the vesicles. Stratified random sampling population are stratified random sampling will be appropriate if population are non-homogeneous, right. Stratified random sampling, right, here it's talking about stratified random sampling will be appropriate, right, it will be appropriate if population are non-homogeneous, right. Stratified random sampling will be appropriate if population are non-homogeneous. Okay, Z test, right, to know whether there is significant difference between what sample mean, right, known population parameter, right. Now Z test is used to know whether there is significant difference between a sample mean, right, and known population parameter, right. Association between quantitative variables, right, quantitative variables, continuous variables are measured by correlation. Now here correlation, now what it will do, it will find the association between quantitative variable, only variable that was chi-square test, right, between variable, but quantitative variable, right, okay, only variable, right, variable is what, our chi-square test, right, but here quantitative variables, right, and continuous variable are measured by correlation, right. Example, weight and cholesterol. What are these are weight and cholesterol, right. Chi-square test, find out association between two discrete attributes, smoking and cancer, right. Test of goodness of fit and proportion, right. The change in measurement of two linear correlated dependent and independent variable is called regression. What is regression? The change in measurement of two linearly correlated dependent and independent variable is called regression, right. Such that regression analysis, right, estimate the value of dependent variable based upon independent variable, right. Nepal's Tobacco Control Act on WHO framework convention on tobacco control come into existence in 2011, right. Tobacco Control Act came into existence in 2011. Cost effectiveness, an example of input output analysis. Yes, input output analysis, right, cost effectiveness is example of input output analysis. Inventory control is component of materials management, right. Inventory control is component of material management. Okay, hepatitis E, it will cause what, it will cause fulminating liver failure in pregnancy, it will cause fulminating liver failure in pregnancy. NIPAH, right, NIPAH virus is transmitted by right, from the sap of infected dead palms, right. NIPH virus is transmitted by infected dead palm, right. Elimination of reservoir is possible in rabies, right. Reservoir is what, is possible in rabies. Slow method of cost containment is right seizing, right, right seizing. Slow method of cost containment is right seizing, right. Now TB treatment code, right, in TB treatment code is denoted by, it is denoted by HMIS, right, 20, right. Now in TB treatment code card is denoted by, TB treatment card is denoted by HMIS 20, right. Now in VED analysis of inventory method, essential items should be how much, 50%. In VED analysis of inventory method, essential items should be 20, right. TB isn't a notifiable disease in Nepal, right. TB isn't a notifiable disease, cholera is, right. Policy, a guideline logistic framework for health activities to improve health condition of people, that is policy, right. A guideline logistic frame for health activities to improve health condition of people, that is policy. And plan, provide a comprehensive detailed course of action, right, that is plan, right, directed at achieving a specific end result. And program, what is it? Comprise of multi project that aim at outcome and benefit. And talking about project, comprises of individual tasks that aim at a specific outcome. And what is it? UNFPA, right? Now it is what? It is concerned with family planning and sexual health, population and developmental strategies, and advocacy, right? New scope of reproductive health is what? Gender based violence, right? Most common domestic violence. New scope of reproductive health is gender based violence. Farmer's lung, it is because of what? Inhalation of grain dust. Organism is Actinomyces micropolyspora feni, right? It is what? Various time it is asked. ANOVA test, what is ANOVA test? The statistical test which assess whether the means of two groups are statistically different from each other, right? The statistical test which assess whether the mean of two groups are statistically different from each other, that is ANOVA test, right? Assess whether the mean of two groups are statistically different from each other. Checking of scar of BCC vaccine is what? It is what? It is consecutive supervision, right? It is consecutive supervision, right? Checking the scar of BCG vaccine is what? It is consecutive supervision. Economics, study of scarcity according to Robbins, right? What is economics? It is study of scarcity according to Robbins. It is the what? Study of scarcity according to Robbins. Kala-Azar emanation in Nepal, right? Now Kala-Azar emanation in Nepal, it is in what? Consolidation phase, right? It is in consolidation phase, right? It is in consolidation phase. Chikungunya and dengue, it is differentiated by arthralgia. Chikungunya and dengue, these are differentiated by arthralgia. Now reservoir of Nipah virus, it is fruit bats, right? Fruit bat, right? It is fruit bat. Now rabies free countries, what is the rabies free countries? These are Britain, England, right? Britain and England. Road to Health card and growth chart was first designed by David Morley. Road to Health card or growth chart was first designed by David Morley. Annual household survey edition 2021, average family size of Nepal is 4.4. What is the average family size of Nepal? That is 4.4 is the average family size of Nepal, right? In Nepal, Japanese encephalitis is preferentially given at anterior lateral part of right thigh. In Nepal, Japanese encephalitis, right? Vaccine for Japanese encephalitis is given at anterior lateral part of right thigh, right? Accepted standard floor for person with respect to overcrowding is 90 to 100 square feet, right? 90 to 100 square feet. Depth of water seal is 20 to 30 mm, right? Depth of water seal is 20 to 30 mm. First country to introduce compulsory sickness insurance is Germany. Germany is the first country to introduce compulsory sickness insurance. Step, right? Approach of WHO is for non-communicable disease, right? Step approach for WHO is for non-communicable disease, right? Step 1, face-to-face interview. Step 2, simple physical measurement. Step 3, collection of urine and blood sample for biochemical analysis, right? Step 1 is face-to-face interview. Step 2 is simple physical measurement. Step 3 is collection of urine and blood sample for biochemical analysis. Now talking about human development index, right? What are the human development index? These are life expectancy, education rates, and gross national income, right? These are what? Life expectancy, gross national income, and education rate, right? Now life expectancy, it denotes quality of life. Education rate, it denotes level of knowledge, and gross national income, it indicates what? Standard of living. Now Nepal lies where in 143rd position according to 2021-22 with 0.602 value, right? With 0.602 value of human development index, 0.602 and 143rd, right? 143rd. Now Likert scale is what? Nominal scale. Likert is nominal scale. National immunization program is P1 program of Nepal. National immunization program is what? P1 program of Nepal. Malaria control program initiated first in what? 1954. It was initiated in 1954, and in 8th May 1980 smallpox is eradicated. Now when is smallpox eradicated? It is eradicated in 1980 May 8, right? May 8, right? May 8 smallpox eradicated, right? Malaria control program initiated first in 1954, right? Okay, 1954. Now national immunization program is the P1 program of Nepal, right? Okay, Likert is nominal scale. Okay, now SDG, right? SDG 2015 to 2030, there are 17 goals, right? Now 17 goals are there in SDGs. Now third goal is directed health related, right? Health related. And sixth is our clean water and sanitation. Now MDG, right, MDG, it lasted from 2000 to 2015, and now 4, 5, 6 are health related, right. Now in 4 there is reduction of child mortality, in 5th there is what, improvement of maternity health, right. In 6th there is combating to HIV, AIDS and malaria, right. So in MDG 4, 5 and 6 are health related, right. In SDG third goal is directly health related, right, health related. Now third goal is directly health related, that is good health and well-being, and 6th is related to clean water and sanitation. Drug of choice for pneumonia based on CBI and CI is amoxicillin, right, amoxicillin. Now yellow fever, what is yellow fever vaccine? It is 17D. 17D is the yellow fever vaccine. Amoxicillin is drug of choice for pneumonia. Bernardo, right, Ramazini, the father of occupational medicine. Bernardo is the father of occupational medicine, right. Frequency distribution measures is measured by histogram. Frequency distribution is measured by histogram, right. Now here Z score criteria is applicable to normal distribution. The health related right are mentioned in article 35 of Constitution of Nepal. The health related article were mentioned in what, article 35 of Constitution of Nepal, right. Okay. Now out of pocket expenditure in health in Nepal is around 54.52, right. It is according to 2020, it is 54.2% out of pocket expenditure, that is 54.2. First human case of bird flu died in Nepal was on March 29, 2019. That means in 2019, March 29, the first case of bird flu died in Nepal, right. Okay. May measurement month, right. May measurement month, that is MMM, is international screening campaign for arterial hypertension, right. May measurement month organized by International Society of Hypertension, right. International Society of Hypertension conducted what, screening campaign for arterial hypertension, that is May measurement month, right. Incubatory carrier, person capable of transmitting one infectious agent during incubation period, right. Person capable of transmitting an infectious agent during incubation period. These are what, our measles, pertussis, hepatitis B, mumps and influenza. Convalescent carrier, right, convalescent carrier, person who continue to shed disease agent during the period of convalescence, right. The person who continue to shed disease agent during the period of convalescence, that is convalescent carrier. Now healthy carrier, right, these are what, emerge from subclinical case. They are victim of subclinical infection who have developed carrier state without suffering from overt disease, right. Now this healthy carrier, what are these? Emerge from subclinical cases. They are victim of subclinical infection who have developed carrier state without suffering from what, overt disease. Now provision of free medical care is to the people at government expense is known as state medicine. Now what is this state medicine? Provision of free medical care to people at government expense is known as state medicine, right. Now community intervention studies are field trial. Community intervention studies are field trials. Now interval between onset of primary and second case is serial interval. The interval between onset of primary and secondary case, right, the interval between onset of primary and secondary case is a serial interval. Adverse effect of measles vaccine is, what is it? It is toxic shock syndrome, right. Measles is it is what, it is toxic shock syndrome. Now black color skin in MDT, right, in what, in MDT of leprosy is clofazimine, right. The black color of skin is due to what, clofazimine, right, it is because of clofazimine. Similarly lepra reaction is adverse reaction of what, dapsone. Lepra reaction is adverse reaction of dapsone, right. Black color of skin is due to what, clofazimine, and lepra reaction is because of what, adverse reaction of dapsone. Diluent in what, our diluent in Japanese encephalitis is what, phosphate buffer-saline, right, it is phosphate buffer-saline, that is diluent of Japanese encephalitis. Similarly indicator of health delivery system, right, population health center, right, indicator of health delivery system is what, population health center. White finger is due to vibrations, right, white fever is due to what, it is due to vibration. And Welder's flash is due to UV radiation, right, it is due to what, UV radiation. Best investigation for epidemiological study in diabetes, what is the best investigation for epidemiological study in diabetes? That is 2 hour postprandial what, our blood sugar, right. Now 2 hour postprandial blood sugar, right, it is what, it is the best investigation for epidemiological study in diabetes is 2 hour postprandial blood sugar. Now for effective cancer screening, pap smear should be taken every 3 years, right? For effective what cancer screening, pap smear should be taken every how many 3 years, right? Now IPAS, right, work for reproductive health. Now IPAS, it works for what? Reproductive health, right? First international sanitary conference was held on Italy. The first international sanitary conference was held on Italy. The main objective of WHO is to help international cooperation in field of health. Contraction of demographic gap starts in early stage, right? The contraction of demographic gap starts in early stage. Now effective literacy rate is literate aged 7 and above, right? Literates is 7 and above, and population aged 7 and above times what? 100, right? It is what? It is effective literacy rate, right? Quarantine was first done for plague, right? It was first done for plague. Now the polio, P1, the most common cause of epidemic, right? P2, the most antigenic and most easily eradicable, right? It is what? It is the P2. And P3 is most common cause of vaccine and paralytic poliomyelitis, that is P3, the most common cause of vaccine associated with paralytic poliomyelitis. It is our P3, right? Now metazoonosis, those diseases that are transferred by invertebrate host, right, biological vector, in which the causative agent multiplies, propagates, or developmental or both, right? These are metazoonosis, right? Now here what is going on is that it is transmitted by invertebrate host, right, biological vector, in which causative organism propagates, right, multiplies, and right, developmental is there. It requires vertebrate and invertebrate host for their completion of life cycle, like plague, arbovirus infection, right, and so on, right? And cyclogenosis, now what is cyclogenosis? Requires more than one vertebrate host but no invertebrate host, right, in order to complete developmental cycle of agent like teniasis and echinococcosis, right? These are cyclogenosis. And direct zoonosis, what are these? These are our rabies and brucellosis, transmission from an infected vertebrate host to a susceptible host by direct contact. Now what is the rule? A school should have how many? One urinal for 60 children, right? One urinal for at least 60 children and one toilet for at least 100 children, right? Tar component of cigar, it will cause lung cancer, right? Tar component of cigar, it causes lung cancer. Research focused for finding a solution of an immediate problem facing in society is called what? Applied research. Now what is applied research? Research focused for finding a solution for immediate problem facing in society is called applied research, right? Research focused for finding a solution of immediate problem. Formulation of mental health policy in Nepal was in 1996. Formulation of mental health program, right? Attributed risks of HIV transmission from mother to child during breastfeeding without intervention is 10 to 25%, right? It is 10 to 25%. The attributable risks of HIV transmission from mother to child, right, during breastfeeding. Okay, pandemic of influenza A is for how much? It is for how much? It is for 10 to 40 years, right? Epidemic of influenza for type A is for 2 to 3 years, and for influenza B is 3 to 6 years. Peak of influenza epidemic is reached within 3 to 4 days, right? Influenza epidemic is reached within 3 to 4 days, right? Okay, maternal, right, ABS is not protective in measles, right? It is not protective in measles. Special incidence rate is secondary attack rate, case rate, and hospital admission rate, right? These are special incidence rate. Typhoid fever is common in 10 to 19 years. It is common in 10 to 19 years. C influenza is more antigenically stable, right? It is more antigenically stable, right? To be protective in CDH, right, serum HDL should be greater than 40 mg per deciliter, right? It should be greater than 40 mg per deciliter, that is healthy what? Cholesterol, right? Okay, lifetime risks of developing TB if the person is HIV positive, right? It is 30%. What is the lifetime risk? It is 30% if the person is HIV positive. The lifetime risks of developing what? TB. The lifetime risks of developing TB if the person is HIV positive is what? 30%, right? Rate correction is used in what? Chi-square test of independence, right? Chi-square test of independency. National health policy what introduced in 2048, right? 2048 साल 2048. The national health policy was introduced in 2048 BS. Phase typing. Now what is phase typing? Epidemiological tool for tracing source of epidemic in typhoid. It is what? It is our face typing, right? Epidemiological tool for tracing source of epidemic in typhoid. COVID-19, right? COVID-19, the case fatality rate CFR was 1.5, right? 1.5. Case recovery rate was 95.4, right? 95.4. COVID-19. Malaria. Now here ABER in malaria is 1.32. API index, annual parasite incidence, right? Incidence is 0.03. Total positive in 2077-78 is 377, right? 377. And dengue 489 cases in 2077-78, right? 489 cases. That means the more cases of dengue were there, about 100 more than malaria. Kala Azar incidence is 0.07 per 1 lakh population of risk, population at risk, right? Leprosy CFR is 0.9 per 1 lakh and prevalence is 0.7 per 1 lakh and new case detection is 7.81 per 1 lakh, right? Okay, tuberculosis is 235 lakh incidence according to 2077-78 data. HIV positive tuberculosis is 4.6 lakh, right? MDR is 7.6, right? HIV negative tuberculosis mortality is 55 lakh per lakh and HIV positive TB mortality is what? 0.74 per lakh, right? And HIV incidence is 0.03 and prevalence is 0.12. TB patient who had HIV is 72, right? 72. Stunting is found in 25%, wasting in 8 and underweight in 19, right? Scrotal hematoma is earliest complication of vasectomy. Scrotal hematoma. Prevalence of polio is calculated by multiplying rough estimate by 1.3. Prevalence of polio is calculated by multiplying of rough estimate by 1.3, right? Tetanus, it is what? Thermostable, right? It is thermostable. OPB is thermoliable, right? Thermoliable, thermostable and liable. So P, it is somehow like what? B, right? So thermoliable. Oh, there is also B. Okay, so remember it, right? Stable, we can just we can just stable T and tetanus. Thermostable and thermoliable. OPB is thermoliable. Risk factor for cervical cancer is in what? Late menarche, right? Late menarche. Risk factor for breast cancer is early plus late menopause, right? Early plus late menopause, that is the risk factor for breast cancer. Simultaneous active and passive immunization is widely used in what? Rabies, tetanus and hepatitis, right? Rabies, tetanus and hepatitis. Edmostone Javriv-Stein, that is for measles, right? Edmostone Javriv-Stein is for what? It is for measles, right? Oka straight is for varicella. RA273 is for rubella. 17D for yellow fever. And what? Beijing Gassy 1414-2 is for Japanese encephalitis. Now a vaccine carrier should contain 4 fully frozen ice packs, right? It should contain 4 fully frozen ice packs. At PHC level, vaccine storage is by ILR, that is ice line refrigerator, right? Dial, right? Thermometer used, right? Okay, dial thermometer is used. At PHC level, vaccine storage is by what? It is ILR, ice line refrigerator, right? Walk-in cold room, right? It is regional level, right? WTC regional level. Maximum efficacy is for rubella 95% and measles 90%, right? Rubella 95% and measles 90%, right? First dose, maximum efficacy in first dose is for rubella and then measles, right? Okay, polyvalent vaccine, that means more strain of same species, right? More strain of same species. Polyvalent vaccine. Live vaccine are BCG, MMR, OPV, varicella, Japanese encephalitis live, rotavirus, typhoidal, right? Epidemic typhus, cholera, plague, swine flu, right? These are what? These are the live vaccine. Killed vaccine are the most asked are what? Our rabies, IPB, hepatitis A, pertussis, meningocele, killed cholera, killed plague, swine flu, killed, right? Toxoid are, what are these? These are diphtheria and tetanus. These are toxoid. And proteinaceous, these are pertussis, right? Proteinaceous and pertussis. Now cholera and for yellow fever, it should be given together, right? There can be a complication. Now in rotavirus, the complication is intussusception, right? In measles, toxic shock syndrome, it is asked. In rotavirus, intussusception, right? In GVS, right? In GVS, killed influenza vaccine, right? In TT, the brachial neuritis, right? The cold chain, it is what? It is done in +2 to +8, except for OPB, that is -15 to -25 and -30 to 5 in the case of yellow fever, right? Okay. Statistical regional WIC, walk-in cold room, that is -2 to +8, and walk-in freezer, right? Freezer, that is minus 15 to 25. That was for what? That was for our UPB, right? District, large ILR plus 2 degree Celsius to plus 8. Large DP, right? Deep freezer, minus 15 to minus 25. In PHC, ILR is done there, that is ice line refrigerator, plus 2 to plus 8. And DF, right? Deep freezer, minus 15 to minus 25 is used. From subcenter, maximum from subcenter, subcenter is the site for maximum failure of cold chain, right? Okay, now subcenter, the vaccine is carried. Now for BCG, the diluent is normal saline, right? It is asked question. For yellow fever, it is bold physiological. For measles, it is what? Sterile water, right? Dilute water. For MMR, it is dilute and saline water, sterile water. Sorry. For Japanese encephalitis, yes, question is asked, that is phosphate buffer saline, right? PBS, right? After mixing with diluent, should be used within what? 4 hours. It should be used within 4 hours, right? Okay. Now Tom vaccine was given by Louis Pasteur, right? It develops vaccine for rabies, right? Tom vaccination was used by Edward Jenner, right? He developed vaccination for smallpox and anthrax vaccine, right? Now the BCG, the strain is Danish 1331 strain, that is asked question. For measles, it is Edmund strain, Javier strain, that is also asked question. For mumps, it is Geril line. For rubella, it is RA273S. Yellow fever, it is 17D, it is asked question. Varicella Oka strain, that is also asked question, right? Japanese encephalitis, that is Nakayama, Beijing, B3 killed, that is also asked. The Nakayama, it is also it seems like the Japanese term, so Nakayama, it is also the asked question. Japanese encephalitis live, that is SA14-14-2, right? H1N1 killed, that is A7 California. Anti-malaria, that is SPF 66, and dengue vexia, that is CYD and TDV, right? Now this BBM, it is what? It is what? Marker for cold chain maintenance, right? Leprosy elimination is less than 1 case per 1 lakh population. In that case, the leprosy is considered eliminated. Neonatal tetanus, what is it? That is less than 0.1 cases per 1000 live birth. That is our neonatal tetanus elimination, right? Holoendemic, what is holoendemic? Refer to high level of infection beginning in early life and affecting most of the children population. What is holoendemic? Refer to high level of infection beginning in early life, right? Refer to high level of infection beginning in early life and affecting most of the children population, right? So gross reproductive rate, what is it? It doesn't take mortality into account, right? Gross reproductive age, it does not take mortality into account, right? Talking about the net reproductive rate, it takes mortality into the account, right? So N net and M, right? It takes M, N, M, right? N, M. But our gross reproductive age, it does not take mortality into account. Growth chart, right? Weight for age, right? Weight for age, it is used for what? Acute or chronic malnutrition, that is weight for age, right? Pregnancy, how much is required? Plus extra 350 kilocal per day, right? But in lactating, 600 kilocal per day is required, right? 600. From 0 to 6 months, 600, and from 6 to 12 months, how much? 520 kilocalorie per day is required, right? First trimester, how much? 150 kilocalorie is required. 1 lakh international unit is 30 mg of vitamin A, right? Mosquito hole, what is the size? It is 0.0475 inch. How much? 0.0475 inch, right? Greater than how much? 150 per what? 54 inches, right? Sorry, 150 per square inches, for square inches. So what is the size of mosquito hole? It is 0.0475, right, inches, and it is greater than 150 per square inches, right? Okay, incubation period of hepatitis A, it is 2 to 6, B, it is 6 weeks to 6 months, right? C, 1 to 4 months, D, 1 to 3 months, E, 3 to 6 months. Most common mode of HIV transmission is from men to women, right? The propagated epidemic, right? Secondary wave present propagated epidemic, right? There will be secondary wave presence of secondary wave will be there, right? In propagated epidemic, that suggests of occurrence of what? Polio, right? Headquarter of UNESCO is in Paris, right? UNESCO is in Paris. UNESCO, the headquarter of UNESCO. And UNICEF, it is in New York. I think it is in New York, right? Okay. UNESCO is in Paris. The period of erythrocytic zygony, right? The period of erythrocytic zygony, it is 72 hours for Plasmodium malaria, right? 72 hours, 3 days, right? 3 days. 48 hours of Plasmodium falciparum, right, and Plasmodium vivax and Plasmodium ovale, right. Period of erythrocytic size you're getting, right. 72 hours for malaria only, 3 days. For all it is how much? It is 2 days, right, 2 days. PQLI, right, PQLI includes what? IMR, literacy rate and life expectancy, right. Life expectancy of age 1, that is LIE, right, life expectancy, okay, literacy rate, right, expectancy, right, and then infant mortality rate, right, that is PQLI. Primordial prevention in coronary artery diseases. What is the primordial prevention? That is salt restriction, right. Salt restriction is the primordial prevention of coronary artery disease. It is not exercise, it is not BP monitoring, it is not statins, it is what? It is salt restriction. Salk, right, killed injectable, right. Now here the strain of poliovirus, one is Salk and one is Sabin, right. Sabin is what? Is live, it is name of person, right. Sabin is live, right. The Salk is killed, right, it is killed. The killing is what? Expensive, right. Living is what? It is economic, right. Short duration protection, the killed, the Salk will provide short duration protection, right. Herd immunity is not provided. Now here it will provide long lasting protection, provide herd immunity. Sabin will provide herd immunity, right. Okay. Now here VAPP and VDP has 0 chance here, relatively more chance here, right. It does not require stagnant condition, required what? -220 degrees Celsius, right, and established in what? MgCl2, right. Now what is the role of MgCl2? The role is what? To stabilize, right. MgCl2 stabilize. Okay. MCSW, right, they are posted in what? Sub health post. And in Aedes, the cycle of yellow fever is what? It is propagative. Yellow fever is what? Propagative, right. And talking about okay, it is propagative, right, it is propagative. Nepal Red Cross Society was established in 1963. Surveillance index, what? It is disability free of spectrometry, right. Life expectancy, duration of disability, right. 1 daily, 1 year of healthy life lost, right. Most common physical hazard in most industries is what? It is heat, right. The most common physical hazard in most industries is heat, right. Now preservative, for DPT, thimerosal, right, thimerosal is used for DPT. For measles it is kanamycin. For OPB it is MgCl2, right. For OPB it is MgCl2. These are the preservatives. Thimerosal. Adjuvant, okay. Adjuvant in DPT, it is aluminum. Adjuvant is aluminum, right. Adjuvant in DPT is aluminum. Immunity develops in 30 days after the administration of Japanese encephalitis, after 30 days. For measles it is 7 days, right, 7 days. Neurological complication of rate of 0.5 per 1000 is seen with rabies nervous tissue vaccine, right. Neurological complication of how much? At the rate of 0.5 per 1000 is seen with rabies nervous tissue vaccine. Now t-test compares to what? Two mean quantitative values, right. ANOVA used to compare more than 2 quantitative what? Variables, right. Now association is best implicated by, it is best implicated by what? It is best implicated by experimental epidemiology, right. The mean, right, plasma level of creatinine is determined in non-pregnant, right, not required for chi-square test, that is mean in different pregnant group. Statistical power of trial is equal to what? 1 minus b, right. Nested case control study is what? Prospective. Nested is prospective study. Crossover study is done when control and case are the same, right. Crossover is done when control and case are the same, right, when they are same. For pneumoconiosis to develop, 12 years minimum exposure is required. 12 year of minimum exposure is required. If rapidly progressive cancer are missed by screening test, length bias will occur. What will occur? Length bias, right. The rapidly progressive cancer is what? Missed by screening, then length bias will occur. Bicyanosis is spinners most common affected, right. Spinners are most common affected in bicyanosis. Urban malaria is caused by what? Staphylococcus. Rural is caused by what? Colchifacius, right, colchifacius. Similarly, the most important factor to be good screening is sensitivity. The most important factor to be a good screening is sensitivity. In study carried out in hospital ward, every 10th admitted patient was included in sample. It is what? It is systematic sampling, right. Every 10th admitted patient was included in the sample, that is systematic sampling. Chemoprophylaxis not indicated in what? It is not indicated in typhoid. Chemoprophylaxis is not indicated in typhoid. The extended definition of perinatal mortality include crown heel length of greater than 35 centimeter in birth, right? The extended definition of perinatal mortality include crown heel length greater than 35 centimeter in birth. Apgar score, right, less than 5 is what? High risk, right? It is high risk. The center inverted in under 5 clinic triangle denotes family planning, right? The center inverted triangle in under 5 clinic denotes family planning. Increase in maternal age increase the risk of what? Patent doctor's arteriosclerosis. Yes. Protective factor against dengue is what? Malnutrition. Malnourishment is the protective factor against dengue. In severe malnutrition, child with dehydration, ORS isn't indicated as it predisposes to hyperkalemia, right? Here in severe malnourished case, child, right, with dehydration, ORS is not indicated as it predisposes to hyperkalemia, right? Tumbler test, right? Tumbler test done to detect rash in meningococcal meningitis, right? In meningococcal meningitis. GEM Geriatrics is study of health of travelers. What? Travelers health. हजुर बाबा हजुर साझामा के गर्ने बाबा? ए ल ल ल हस् हस् हस्. Infodiatrics is a study of health of travelers health, right? Travelers health, right? It is travelers health. Clostridium perfringens, remote contamination water, because of remote contamination of water, right? Fecal streptococci, right? Recent contamination of water. It is remote and it is recent contamination of water, right? Fecal streptococci. Allophobia vaccine isn't indicated in child less than how much? 9 months, right? Less than 9 months. Absolute contraindication to influenza vaccination is what? Hypersensitivity to X, right? Absolute contraindication to influenza vaccine is hypersensitive to. Type of hypothesis, right? Universal, resource, and statistical. These are what types of hypothesis, right? Now the climate change, it is 4th, and earthquake it is 11th, and flood is 3rd, right? Disaster. Now okay, this was what? Okay, for this video this much is what? This much is for this video about one liner in PSM. So further we'll be covering all these things in next video.